I got my head out the sunroof, I'm blasting our favorite tunes. I only got one thing on my mind. You got me stuck on the thought of you. You're making me feel brand new. You're more than a sunshine in my eyes. You got those pretty eyes in your head, you know it. You got me dancing in my bed, so let me show it. You are exactly what I want, kinda cool and kinda not. Wanna give myself to you. Yeah, we're driving down the freeway at night. I only got one thing in the back of my mind. I'm feeling like this might be my time to shine with you, with you, with you. I got my head out the sunroof, I'm blasting our favorite tunes. I only got one thing on my mind. You got me stuck on the thought of you. You're making me feel brand new. You're more than a sunshine in my eyes. I got my head out the sunroof. You got me stuck on the thought of you. Yeah, we're driving down the freeway at night. I only got one thing in the back of my mind. I'm feeling like this might be my time to shine with you, with you, with you. I got my head out the sunroof, I'm blasting our favorite tunes. I only got one thing on my mind. You got me stuck on the thought of you. You're making me feel brand new. You're more than a sunshine in my eyes. La da la da la la la. La da 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 dee da da la 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 la. La da la da la la la. La da la da da
Memories follow me left and right. I can feel you over here, I can feel you over here. You take up every corner of my mind. What you gonna do now? Ever since the day you went away, no, I don't know how to erase your body from out my brain. What you gonna do now? Maybe I should just focus on me instead. All I think about are the nights we were tangled up in your bed. Oh no, oh no, oh no, oh no. You're going round in circles, got you stuck up in my head. Yeah, memories follow me left and right. I can feel you over here, I can feel you over here. You take up every corner of my mind. Your love stays with me day and night. I can feel you over here, I can feel you over here. You take up every corner of my mind. What you gonna do now? Ever since the day you went away, someone tell me how much more do I gotta drink for the pain? What you gonna do now? You did things to me that I just can't forget. Think about all the nights we were tangled up in your bed. Oh no, oh no, oh no, oh no. You're going round in circles, got you stuck up in my head. Yeah, memories follow me left and right. I can feel you over here, I can feel you over here. You take up every corner of my mind. Your love stays with me day and night. I can feel you over here, I can feel you over here. You take up every corner of my mind. What you gonna do now? Did you know you're the one that got away? And even though, baby, I'm still not okay. Did you know that my dreams, they're all the same? Every time I close my eyes, memories follow me left and right. I can feel you over here, I can feel you over here. You take up every corner of my mind. What you gonna do? Your love stays with me day and night. I can feel take up every corner of my mind. What you gonna do now?
I'm familiar with unrequited. I know you got a heart that's undecided, just like mine. It takes its sweet time. I've been trying to dive into the deep end, 'cause I don't really wanna lose a good friend, but I might find something divine. It's electric every time we touch. I've been living for this head rush, but sometimes it's too much. If we never try, how will we know, baby, how far this thing could go? Give me a sign if I'm on your mind. I don't wanna fall in love alone. I wish that I could tell what you were thinking. I hate that I slip up when I've been drinking, but oh well, I can't help myself. I'm getting really tired of this back and forth. Why don't we just give into this driving force? I mean, there's something between us. It's electric every time we touch. I've been living for this head rush, but sometimes it's too much. If we never try, how will we know, baby, how far this thing could go? Give me a sign if I'm on your mind. I don't wanna fall in love. I don't wanna fall in love alone. We never try, how will we know you, baby, how far this thing could go? Just how far this thing will go. Give me a sign, give me a sign. I don't wanna fall in I don't wanna fall. I don't wanna fall in love alone. You just need to be right here next to me, next to me, next to me. I don't wanna be without you, baby, anymore. I don't wanna fall. I don't wanna fall in love. I can't fall. I don't wanna fall. I don't wanna fall in love alone.
It's bad bitch o'clock, yeah, it's thick 30. I've been through a lot, but I'm still flirty. Is everybody back up in the building? It's been a minute, tell me how you're healing. 'Cause I'm about to get into my feelings. How you feeling? How you feel right now? Oh, I've been so down and under pressure. I'm way too fine to be distressed, yeah. Oh, I'm not the girl I was or used to be. Bitch, I might be better. Turn up the music, turn down the lights. I got a feeling I'm gonna be alright, okay, alright. It's about damn time. Turn up the music, let's celebrate. I got a feeling I'm gonna be okay, okay, alright. It's about damn time. In a minute, I'ma need a sentimental man or woman to pump me up. Feeling fussy, walking in my Balenciennes, trying to bring out the fabulous. 'Cause I give a fuck way too much. I'ma need like 2 shots in my cup. Wanna get up, wanna get down. That's how I feel right now.
crib and blow it back out. Shorty Filipino and she call me Manny Pacquiao. Alley-oop without the hoop, they call me Jerry Stackhouse. Dazing out in public, but your mama made me snap out. Before I get the dough, got the morning routine. Wake up bright and early to some brand new cream. Floss 3 times, baby, I'm so clean. Gravy got cheese now, that's poutine. Gravy coming hot like I'm hopping off the griddle. Pull up on a kid if you're trying to get belittled. All the mamas love me now, I think I'm being brittle. Flex the rainbow, bang it like some Skittles. Gravy, why you out of pocket? Out of pocket. Stop it. No. I'm getting money, Gravy Crockett. Never take a L no more. Never take a damn thing slow. All I know is chase this dough and get money. Never gonna take no loss. Never gonna lose my sauce. All I know is chase this and get money. Get money, get money.
Probably into the early morning.
Yeah, I live a fast life. Yeah, you know I live a fast life. I don't got a type, baby, I'm the cash type. Still getting dividends from a past life. I get your daddy's net worth on a bad night, cause I act right. Yeah, rockin' red, clapping ass leads like the 80s. Never give it up until the reaper come and slay me. Pull up with a Zelda and a beach and a daisy. I be dirty dancing, now the yelling Gravy Swayze. Never take a L no more. Never take a damn thing slow. All I know is chase this dough and get money. Never gonna take no loss. Never gonna lose my sauce. All I know is chase this and get money. Get money, get money. Get money. Gravy. Get money. Get money. Gravy. Get money. Disco weapon.
Fuck you, any mom, any sister, any job, any broke ass car, and that's shit you call art. Fuck you, any friends that I'll never see again. Everybody but your dog, you can all fuck off. I swear I meant to mean the best when it ended. Even tried to bite my tongue when you started shit. Now you're texting all my friends, asking questions. They never even liked you in the first place. Dated a girl that I hate for the attention. She only made it 2 days, what a connection. It's like you'd do anything for my affection. You're going all about it in the worst ways. I was into you, but I'm over it now. And I was trying to be nice, but nothing's getting through, so let me spell it out. A, B, C, D, E, F. You and your mom, and your sister, and your job, and your broke ass car, and that shit you call art. Fuck you, and your friends that I'll never see again. Everybody but your dog, you can all fuck off. Na 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 na. A, B, C, D, E, F. You said you just say
Hello. Good morning. Good morning po. Kamusta? Hala, tulog na yung mga tao. Kamusta? Kamusta? Kilala niyo naman ako siguro lahat, no? Kilala niyo naman na. Kamusta? Hmm. Buhay pa? Kaya pa? Pagod na? Carry pa? Buhay pa? Buhay pa? Kaya ako lang ba yung class niyo for today? Hmm. Yes, carry boom boom pa. Kaya pa lumabot. Ako, kamusta ako? Hindi ko nga din alam. Sana all may nangangamusta. Until 4, yeah. Kamusta ba ako? Hindi ko din alam eh. Pagod. Pagod ata. Kakayanin pa. Opo. Kaya ko lang. Ay, kakauwi lang ng church. Amen to the Lord. Okay? Rico's 4 tayo. Okay? Sana all ako lang ang priority, char. Okay, Rico's 4. So, Rico's 4 NP. Ano to? NP, ano ba tayo ngayon? NP3. Rico's 4. Punta muna kayo sa Rico's 4, NP3. 51 to NP5. Nandyan na ba kayo sa Rico's 4, NP3, number 51? Yes. Start na tayo. Okay. Mahirap ba yung Rico's 4? Ano mas mahirap? Rico's 2, Rico's 4. Ano mas mahirap? Medyo mas nahirapan ako maghanap ng ratio sa Rico's 4. Ano mas mahirap? 1, 2, 3, 4. Hala, wala sir. Lahat po mahirap. Lahat po. Rico's 2 kayo mas mahirap. Yeah, yung mga nag-sense sa akin, after na lang ng after ng tawag dito, after ng Rico's 4, tsaka ko explain. Apaterasyo, nagkakagulo. Parang weird yung Rico's 3. Sino ba Rico's 3 nyo? Sino Rico's 3 nyo? Well, dito sa Rico's 4, sa tututuro, sa irarasyo ko ngayon, meron dito lumabas sa board exam ko mismo. Yeah, I'll explain it to you later. Okay, let's start na. Situation. Nurse Cora admits Mr. De Guzman, 31-year-old, who was brought to the emergency room by his co-worker because of severe abdominal pain. He was observed. Baka yung iba, wala pang Rico's 3. Okay, holding his abdomen with his right hand while bending towards his right side. The emergency room doctor made this initial assessment and referred the patient to the surgical doctor and for further assessment. Ano kayang initial diagnosis dito kapag nabasa nyo kagad to? Kapag right-sided na abdomen, ano kaya most probably ang meron si patient? Meron siyang, ano kaya ang possible? Appendicitis. Very good. Pwede siya most probably appendicitis and assume nyo na. So, number 51, to describe a sensation of severe pain felt ruptured appendicitis, Nurse Cora applies deep pressure of her finger into the abdomen at any point away from the pain and then releases. This maneuver is termed as, ano kayang tamang sagot dito? Letter C, roving signs. Okay, roving signs kasi away from the pain. Ibig sabihin nito, sa left side po, kapag roving signs sa left, di ba? Ang McBurney's point, ano nagsabi ng McBurney's point? Ano kaya? Ano ang gagawin mo pag McBurney's point? Anong ginagawa? Pag McBurney's point, ito sa right lower quadrant. Pag tinouch mo sa may right lower quadrant, magkakaroon ng pain. Okay? Ang perforation, ano sabihin ng perforation? Perforation means hole. Okay? Gumawa ng hole. Okay? Hole that develops through the wall of the body organ. Okay? Yung anong blumber? Parang ngayon ko na na-encounter yung blumber. Walang Blumberg sign. Wait now. Okay. Yeah. Ito siya. Your rebound tenderness kasi, more of pag peritonitis ang manifestation mo. Okay? Ang rebound tenderness, more of peritonitis siya. Or also known as your Blumberg sign. Refer when the presence of pain is removed to the abdomen. Okay, abdomen. Ito kasi away from the pain kasi siya. Okay, away from the pain. Ang Blumberg kasi, ang Blumberg is also known as rebound tenderness. Gets ko na. Ngayon ko na nakita. Okay, sa ano siya, abdomen, and ito away from the pain. Most probably, nandito siya. Ito siya. Okay, nandito. Diba? Away from the pain. Okay, kaya siya magiging roving signs. Ang McBurney's point, diretso yan kagad sa right lower quadrant. Okay, diretso siya sa right lower quadrant. Gets ba? Malinaw? Or nalilito? Clear. Okay? So move on tayo. Number 51 is letter C. Letter C. Okay? Mr. De Guzman was diagnosed with ruptured appendicitis. Kapag nag-rupture appendicitis mo, anong complication? Peritonitis. Okay? When the appendix is suspected ruptured, a generalized abdominal pain is felt and becomes, ano kaya ang tamang sagot dito? Letter C. Very good, diba? Yan ang sign ng iyong peritonitis. Rigid, stiff, and board-like feeling. Kapag nag-peritonitis si patient mo, ano most probably intervention kaya dyan? Ano most probably intervention ang gagawin mo? Kapag nag-rupture or possible intervention, suspected mo, anticipate mo na kagad ano kaya? Antibiotic lang ba? Emergency surgery, stat surgery po yan. Okay, stat surgery yan. Okay, prepare mo na kagad si patient mag-underwent ng surgery. Bakit? Ano bang complication ng peritonitis kaya? Anong possible complication ng peritonitis? Pwede siya mag-sepsis. Could lead to your septic shock. Okay, pwede mag-lead dyan sa septic shock. Okay, next, 63, immediate. Surgery was done on Mr. De Guzman, which of the following measure of pain control is not advisable to be done by Nurse Cora while patient De Guzman is having post-op pain. Ano kaya? Take note, most probably nag-ruptured appendicitis to, most probably exploratory laparotomy yan. So letter Apple, coughing exercises. Bakit kaya? Pwede magkaroon ng increased abdominal pressure. Pwede po ba magkaroon ng dehiscence or evisceration? Yes or no? May chances po ba magkaroon ng dehiscence, evisceration? Yes. Okay? So, imbes na coughing exercises ang re-recommend mo, anong re-recommend mo kay patient? Splinting. Okay, splinting exercises. Yun yung paglalagay ng pillow over the incision site kapag na uubo si patient. Okay, letter Apple. After the operation, a nasogastric tube was inserted to patient De Guzman. Okay, the rationale for this surgical measure is to, ano kaya? Bakit? Pag nag-ano kasi yan sila patient, pag abdominal surgery, prone sila magkaroon ng ileus, 'di ba? Pwede sila magkaroon ng ileus or abdominal distension to relieve the pressure, 'di ba? To relieve the pressure and pain para kaya ka nag-i-insert ng NGT, letter CAT. Okay, decrease pain after the surgery, nagde-decompression ka. Okay, common kasi mag-i-ileus, sabihin nito walang forward movement yung patient. Okay, walang forward movement yung patient mo. Kaya letter C. Okay? Number 55. Nurse Cora assessed the pain intensity of Mr. De Guzman. The pain assessment tool appropriate to be used for Mr. De Guzman is, take note, 31 years old si patient. Okay, 31 years old si patient. Ano kayang tamang sagot dito? 31 years old si patient mo. Ano yung sabihin niya? 31 years old. Intensity. Okay, intensity yan. So, world rating scale, X to. X to. Okay, X yan. Okay. Ang faces pain rating scale kaya, saan kaya mas nakikita? Ang face pain rating scale kasi, wala siyang numeric. Wala siyang numeric. Ano lang siya, kumbaga, ano lang, parang identify lang. Di ba more of pediatrics ang faces pain rating scale, pati visual rating scale, more of pedia. Ilang taon ba yung patient natin? Ilang taon kaya? Letter? Ilang taon? 31. Okay? So, kailangan mo pa ba face pain rating scale or visual rating scale? Hindi na. I-verbalize ba ni patient agad kung anong pain scale niya? Kung gaano kasakit. Intensity, gaano kasakit yung pain niya. Yes. So ano mas appropriate? Letter dog. Okay, letter dog. Opo, mali talaga sa G form. Okay. Well, eto, nirasyo sa sagot sa last exam. I've also read, okay, I also read in sa ano, ang tawag dito sa Brunner, the single most important indicator of the existence and intensity of pain is the client's report of pain. Okay? The numeric rating scale is a verbal numeric scale where the patient grades their own on a scale between 0 to 10. Okay? The use of pain intensity scale is an easy and reliable method of determining client's pain intensity. Such scales provide consistency for the nurses to communicate with the client and other healthcare providers. To avoid confusion, numerical rating scale should use indicating worst pain possible of the individual. Okay? So letter dog. Okay, letter dog. I'll go for letter dog. Or I'll try to ano. Okay, I'll send the ratio sa ano. Okay, I'll send the ratio. Ito siya. Ayan. So I'll go for letter dog. Numeric rating scale yan. Kasi, di ba, your pain is always subjective. Subjective siya. Pain intensity ang hinahanap mo. Okay, pain intensity. Buti sana kung pediatric patient ang pediatric patient ang nakalagay sa situation mo. Pero hindi kasi pediatric patient ang nakalagay. Adult patient kasi siya. Okay? So I would go for letter dog. Okay? Next. Contradicting. Well, when it comes to this one kasi, it's more of, anong tawag dito? Pag ganito kasi, yung mga most appropriate, subjective kasi siya. Subjective siya. Ibig sabihin yan, there would be different answer from the lecturers itself. Okay? Ang ano dyan, okay, ang tatandaan nyo dyan, kung sino yung most probably confident kayong sagot because we're just recommending answers. Ito yung totoo. We're just recommending answers. Ibig sabihin nito, kapag yung mga appropriate, best, ganyan-ganyan, most probably, magkakaiba at magkakaiba ng sagot dyan. Okay? Pero for example, dito kasi you would take, okay, dito din for example, 31 years old si patient nyo. Okay, mas reliable ang numeric, di ba? Mas reliable ang subjective kaysa sa objective cues ni patient. Okay, kasi 31 years old, kaya ba mag-report ng patient nyo ng pain niya? Yes or no? Yes. Di ba? Yes. Hindi naman nakalagay na pediatric si patient or pedia yung patient nyo. So, mas papanigan nyo yung subjective over objective cues. Yes or no? Yes. Okay. So, ako, I'll be... hindi pa din. Hindi pa din. Okay? Hindi pa din. I don't, kumbaga kasi subjective kasi siya, mas magre-rely tayo sa face pain rating scale kapag pediatrics. Okay, pediatrics kasi 'di ba, ang pain is very subjective, yes or no? Pain is very subjective. If you would just depend on the objective cues, 'di ba? Paano kung nakasimangot lang para sa patient mo the whole time? 'Di ba? So for me, I would also go numeric pa rin talaga. Okay, numeric pa rin talaga kasi adult yan. Adult yung patient nyo. So, di ba, ang pain is always subjective. Ibig sabihin nito, kung ano sinabi ng patient mo, yun yung pain na nararanasan niya. Okay? So, I would go for letter dog. Okay? Next, you are the nurse on the night duty in the medical ward. You were assigned. Yeah, tatanungin mo lang naman, ano pong pain scale nyo? Di ba? Ano ba niyo? Yung verbal cues ni patient nyo or yung observation mo. Di ba mas ano ka na kasi pain is always subjective. Okay, subjective yan. Okay, at charges of to monitor the status of a 9-year-old boy with bronchial asthma. Okay. Yeah, I will go for regardless of adult emergency numeric. Pero kapag pediatric, face yan. Hindi naman kasi magsasabi yan yung patient nyo. Okay? Which of the following manifestation of the child would cause you to be alarmed? Ano kayang tamang sagot dito? Excessive sweating, no. Diba? Choking, wala naman siya sa kumbaga wala siya sa context. Okay? Cough with palm. Di rin naman. Letter dog. Letter dog. Bakit? Pag nagkaroon ng general chest tightness, anong possible? Anong possible? Anong possible? Most probably nag-obstruction or nag-complete blockage na yung airway niya. Okay, nag-complete blockage na yung airway niya. 57. You would like the child to be comfortable in bed. Which position should you put the child to ease his discomfort? Okay? Ano kaya? Di ba block na nga yung airway niya. So para sa letter cat, ipa-high Fowler's position mo na siya. Letter cat. High Fowler's position. Okay? Number 58. The pediatrician ordered theophylline by IV route. The effect of this drug is, ano kaya? Ano bang drug classification ni ni theophylline mo? Ang drug classification ni theophylline is, xanthine bronchodilator. Okay, bronchodilator siya. So, ang tamang sagot dito is letter cat, di ba? Wala namang sinabi. Pwede nyo din naman gawin yung pagganyan kung hindi kayo talaga sure sa hindi kayo sure sa sagot nyo. Pwede nyo i-context, wala naman sinabing gastric secretion, wala naman nilagay na coronary vasoconstriction or peripheral nervous system. So, letter cat. Okay? A best thing, kapag hindi nyo talaga alam yung mga, kumari ito naghanap ng effect ng drug, i-context clues. Okay, context clues na siya. Okay? Number 59. What appropriate activity should you advise a child while in hospital? Ano kayong tamang sagot? Ilang taon ba yung bata? Nasa school age na siya. Okay, nasa school age na siya. Ipagpapalaro mo pa ba ng teddy bear ang school age? Most probably hindi na. Okay? And take note, meron in distress yung bata, nag-asthma siya. So papakausapin mo pa ba siya sa classmate niya? No, 'di ba? No na. Okay? Anxious and uncomfortable yung bata, hindi naman niya magiging priority yung assignments niya. Letter C. Letter C. Kumbaga, wala nang gagawin kasi nga nag-bronchial asthma siya, hingal siya. So letter cat. Okay? 60. The patient is ready to go home. What health teachings can you give to him and to his mother? Ano kayang tamang sagot dito? Prevent the child from exposure to the dust and pollutants. Yes or no? Yes. Diba? Yes yan. Pag ganyan, tanggalin mo na to. Okay. Avoid exposure to extreme hot and cold. Yes. Diba? Increase fluid intake. Yes. Avoid hyperallergenic food. Yes. Diba? Letter cat. Letter cat. Okay, letter cat. Next. Maya, 65-year-old cook, restless and obese, was brought to the emergency room due to right abdominal pain, nausea, and vomiting for a week. She frequently changes her position to a more comfortable due to intense pain. You are the nurse in charge who admitted the patient after attending doctor diagnosis of her with acute cholelithiasis. Patient Maya's vomiting can be treated via nasogastric tube insertion with suction attachment. The measure will remove the gastric juice, stimulating painful contractions of the gallbladder, which is your, ano kaya? Letter apple. Letter apple. Ano yung ecchymosis mo? Ano yung ecchymosis? Pasa, di ba? Pasa yung letter boy mo. Okay, lithotripsy is what? Ano ang lithotripsy mo? Bruised area. Ano yung lithotripsy mo? It is a surgical procedure. Okay, surgical procedure yan. Okay, surgical procedure for your kidney stones. Okay, surgical procedure for your kidney stones. So the correct answer is letter dog. Letter dog po. 62. Patient Maya was ordered by the physician to undergo several diagnostic tests. You expect the patient that she will have an elevation of, ano kayong tamang sagot? Ano mo na yung letter apple? Ang letter apple mo, ito yung naglalagay ka ng dye, and then check mo kung gaano ka, bilis ma-remove yung dye sa system, removal of dye in the system. So most probably, ito, liver function to. Okay, liver function to. Okay? Ang lactate dehydrogenase, ito more of tissue damage. Okay, tissue damage. Okay, so the correct answer, anong tamang sagot? Letter what? Letter dog. Letter dog po. Okay, letter dog. Okay, letter dog. Ito, inimbento lang. Wala akong mahanap na transpeptidase. Transferase ang meron. Okay, transferase ang meron, yung gamma-glutamyl transferase, which is also determining your bilirubin levels. Okay, letter dog po ang tamang sagot. Okay, next. Honors Mags provides important instruction to Miss Maya on the prevention of your cholelithiasis. Select all that apply. Prevention daw. Maintain ideal body weight, yes or no? Maintain ideal body weight. Yes yan. Diba? Yes. Okay. Adopt low-fat diet. Low-fat diet ka ba dapat? Yes. Okay. Regular exercise. Yes. Diba? Prevent pregnancy, wala naman siya. Okay. Letter cat. Ano ba risk factors when it comes to your cholelithiasis? Ano risk factors? Diba yan yung F, diba? Female, 40, fat, diba? And you're fertile. Yan. Yan siya. Yan yung mga risk factors ng iyong cholelithiasis. Okay? Pero ngayon, diba, kahit mga bata nagkakaroon na ng cholelithiasis. Kahit nga, madami na din mga lalaki nagkakaroon ng cholelithiasis. Diba? Bakit kaya? Ano kaya reason? Bakit madami nagkaka-cholelithiasis? Sa samgyup. Umamin kayo. Samgyupsal. Ang taas ng intake ng samgyupsal. Legit. Tas, diba? Siguro karamihan dito mga twice a month. Twice a month ang samgyupsal. Umamin kayo dyan. Twice a month or once a week. Okay? Next. Miss Maya is prepared. Diba? So, ubos ang pera. Magrereklamo, ubos ang pera. Okay? Miss Maya is prepared for surgery. Nurse Mags provides comfort measure to relieve pain with the following nursing intervention except ito din, madami din magagalit sa akin dito. Pero I'll go for this one. Ano kaya? Letter, dependent versus independent nursing intervention. Letter C. Diba? Administering analgesics. Quiet environment, yes. Positioning, yes. Tinan nyo, back rub. Massage is a comfort measure that can aid relaxation, decrease muscle tension, and may ease anxiety because of the physical contact communicates caring. It can decrease pain anxiety by increasing superficial circulation to the area. Massage can involve the back and the neck, hands and arms, or feet. Letter C. Okay, letter C. I'll send lagay ko yung yung ratio. Ayan, so, kasama yung back. Yeah. Kasi nursing intervention, lahat naman kasi sila tama. Yes or no? Lahat naman sila tama. Yes. Pero ano bang anuin mo? Ano yung kumbagang ang tawag dito? Ano yung mas magiging priority mo? Independent or dependent nursing intervention? 'Di ba? Ano ba yung mas magiging ano mo siya dyan? Kasi nakalagay nursing intervention, di ba? Okay? We sought always for the independent muna. Take note, tama. For sure, tama ABCD nyo, yes or no? For sure, tama ABCD nyo. Yes. Okay, for sure, tama. Yan. So, I'll go for letter cat. Okay? Letter cat, except kasi siya. So, you would focus on your independent. Okay? Yes. Kasi yung back rub mo, okay, actually, sinabi ko din to, na kasi ang initial ratio when it comes to your back rub, ano daw, increases your pain. Yes or no? Yun yung ratio dyan. Increases daw the pain. Yes. Pero what I've read, ito, massage daw. Massage, di ba? Magbaback rub ka pag nag-massage ka sa back. Okay? So, pwede siya. Di ba? Pwede siya makarelieve ng pain. Di ba? So, I would go for your letter C. Okay? I would go for your letter C. Binring up ko na siya actually. Yeah, wala naman siyang din ano. Wala din naman siyang kumbaga contraindications when it comes to your ano, back rub. Okay? Gets ba? Or may violent reaction pa din. Okay, next. Okay, immediate post-operative care for MAGs. Yeah, tinama ko talaga siya. As in, binrot up ko siya sa ano. Includes providing careful instruction to Miss Maya. Which of the following interventions should be delegated to the caregiver? Ano kayang tamang sagot dyan? Letter, ano? Tingnan mo, delegation to the caregiver. Matic letter apple, mali yan. Diba? Matic mali yan. Okay? Diba? Health education ba? Pwede mo bang i-delegate? Yes or no? Health ed. No. Diba? X din si B at D. Letter cat. Okay, letter cat. Dave, 40 years old, came to the hospital for diagnostic workup for a cholelithiasis prior to surgery. Which of the following clinical manifestation would you most likely to observe when the patient is suffering from cholelithiasis? Ano kaya dyan? Saan ba muna kapag cholelithiasis? Left or right? Left or right? Nasa right. So, tanggalin natin ito sa letter boy. Di ba? Okay? Itong feeling abdominal fullness after taking meals, medyo ano siya, ang tawag dito broad. Okay, medyo broad to. Ang best answer natin is letter apple. Okay, letter apple. Indigestion, pain on the right upper quadrant radiating to the shoulder. Ano bang sign kapag mga ano, right upper quadrant tenderness? Anong tawag doon? Your Murphy's sign. Okay, Murphy's sign. Yan, Murphy's sign siya. Okay? Yan ang common natin. Number 67. Which of the following vitamins is interfered when there's obstruction to the bile flow of the cholelithiasis? Diba? Dito, pag ganito, hanapin nyo yung water-soluble vitamins saka fat-soluble. Okay? Vitamin A, fat or water? Soluble. Vitamin C, it is a water-soluble. Okay? How about your vitamin B? Water. So, parehas lang sila nito ni letter C. Si vitamin D mo, ay vitamin K is, ano, fat-soluble. Yan, letter dog. Ano pa yung mga fat-soluble vitamins? ADEK. Diba? A, D, and K. Vitamin ADEK. Letter dog. Letter dog. Number 68. The patient was ordered of endoscopic retrograde cholangiopancreatography. He was put on a mild sedation. As a nurse, what should you check as a priority action when he returns to the ward? Okay? Ano bang ginagawa nito? Nag-introduce ka ng scope, okay, endoscopic. Sabi ito, mag-introduce ka ng scope sa bibig Tapos, na nakasedate si patient. Okay, so ano bang priority mo pagkagising ni patient? Bumalik yung letter C. Okay, cough and gag reflex. Okay, para ma-prevent ang ano, aspiration. Very good, aspiration po. Okay, aspiration siya. Which of the following conditions is not a side effect of your anticholinergic drugs? Ano kayong tamang sagot? Take note, side effect ha. Side effect ang hinahanap natin dyan. Okay? Common side effects letter. Ano yung pinaka-common dyan na matik tatanggalin nyo? Letter, apple. Diba? Constipation. Apple. Ano pa? Apple, dryness of mouth. Diba? Matitira mo, blurred vision, and increased blood pressure. Oh. Kapag, 'di ba, meron tayong palatandaan sa anticholinergic drug toxicity, 'di ba? Blind as a bat, dry as a bone, red as a beet, hot as hell, and mad as hatter. Okay? So kapag blind as a bat, mydriatics ka ba, yes or no? Mydriatic, sabihin nagdadilate. Dadilate. Dilated ka. Yung pupils mo, yes or no? Dilated yung pupils. Yes, kapag dilated yung pupils mo, nagbo-blurred ba yung vision mo? Ay, sige. Okay. Ito. Wait lang. Okay. Most probably pag toxicity yan. Okay? 'Di ba? Toxicity siya. Ito yung expected mo, toxicity. Pero ang common side effect ng anticholinergic drugs mo ay ito yung toxicity mo. Okay, toxicity, malinaw tayo so far. Okay? Pero ang common na adverse effect or side effects mo is what? Anorexia, nausea, vomiting. Okay, dry mouth. Dry mouth. Blurred vision. Confusion. Constipation. Decreased sweating. Dizziness. Drowsiness. Dry eyes. Gastric distress. Ano pa? Headache. Tachycardia. Yan. And urinary retention. So anong wala dyan? Dinulat ko na lahat ng side effects ng anticholinergic drugs mo. Ano yung wala dyan? Letter dog. Letter dog siya. Okay? Opo, mali din po sa Google form. Tinama ko lang po. Letter dog. Okay, letter dog. Okay, letter dog po. Sige, kapain niyo muna. Ibig sabihin pag done na. Sir, bakit? Ito po lahat ng side effects niya. Ito lahat ng side effects ng anticholinergic drugs mo. Di ba ano yan? Tawag dito. Cholelithiasis. Okay? Your blurred vision, pwede siya maging side effect, pwede siya maging adverse effect. Ito, adverse effect to. Ito yung mga side effect mo. Okay? Ito yung mga side effect mo siya. Okay? Ayan siya. I don't know. Sa akin, binigay lang kasi sa akin yung tapos sabi sa akin, kapag may correct daw, i-erase daw. So, ni-erase ko yung Okay? Okay? Yes. Hindi po kasi side effect ang increased blood pressure. Wala kasi increased blood pressure sa sa side effect ng anticholinergic drugs mo. Okay? Wala siya. Okay? Wala siya sa mga, I've searched this one kung meron bang side effect ng blood pressure. Wala siyang lumalabas talaga. Kaya I went to letter dog. 'Di ba? Letter dog. Okay po. Ay shit, urinary retention. Oo nga, hindi ko nasulat retention. Well, kapag, sabi ko nga sa mga students ko, pag hindi kayo na-satisfy sa mga ganyan, 'di ba? Better you've researched, mas mag-research kayo kung ano ba talaga yung tamang sagot. Kung nagkakaroon ng conflicting answers. Okay? Mas maganda i-research na siya para maano kayo, 'di ba? We are trying din naman our best to research things, okay? Para malaman namin kung ano ba talaga yung tamang sagot. Okay? Para din sure. Para, kumbaga, pag na-present sa inyo, ano siya. Pero kung may mga conflicting answers, better na lang din na 'di ba? Okay. Next. When a client has nasogastric tube due to abdominal distension post-surgery, which of the following nursing responsibility should you do? Tamang sagot kaya dito. Letter, 'di ba? Measure mo yung gastric secretion, yes. Observe and record color, viscosity, and secretions, yes. Ensure that the gastric tube is patent, yes, para mag-drain siya. Assist patient to assume comfortable position. Letter, apple. Letter apple. Next. The hospital director of the tertiary hospital is alarmed with recent report of the Human Resource Department office that there is so much conflict going on among the healthcare professionals, which is affecting the quality of healthcare. Which of the following is a form of dispute resolution and considered a legal technique which is outside the court? Ano kayang tamang sagot dito? It's letter boy, arbitration. Ano ba yung arbitration? Arbitration is a form of alternative dispute resolution and it's a way to resolve the dispute outside the judiciary court. This dispute will be decided if by one or more persons, which renders the arbitration award. Ayan. Ayan yung ratio sa kanya. Okay? Ano yung bribe? Ano kaya yung bribe? Ano kaya ibig sabihin ng bribe? Bribe is parang suhol, 'di ba? You persuade someone to ask one's favor. Para ka nanunuhol. 'Di ba? Ang bribe ay parang nanunuhol. Okay? Correct answer is letter boy. Kumukopya ba kayo? Kumukopya ba? Yes, okay. Sige, kopya muna. Sorry na. Ayoko parang hindi kayo magmadali. Sabi sa akin pag done na. Okay, done na. Wala yung slides in 3, 2, 1. Okay, next. Change is defined as making something different from what it was. If you become a unit manager in the future, which of the following first step as an agent in promoting successful change in your healthcare setting? Ngayon tamang sagot dyan, you what? Pag gusto mo magkaroon ng change, gusto mo mag-commit muna doon para sa change, yes or no? Commitment muna. Letter apple. Okay, letter apple. Okay, letter apple. Ayaw mag-press. Letter apple. Revisit institutional vision mission and adhere to its commitment, 'di ba? In any change gusto mo mag-commit muna para maging baga maging religious ka doon sa sa pagbabago. Letter Apple. Okay, next. 73. Decision making is an organizational structure comes at many levels. The level which is considered empowering to staff members is when the unit manager does which one of the following. Empowering daw. Makes a decision when she reads the report concerns. 'Di ba? Dapat kasama empowering nga eh. 'Di ba? Dapat kasama yung staff niya. Okay? The best answer is letter Cat. Makes a decision after convening a core group to analyze the concerned issues. Letter Cat. Make decision by herself. Herself lang siya. So hindi rin to. Letter Apple, letter Dog, X yan. As direct report from personnel to decide on a solution. Mas maganda nga pag-uusapan nila. 'Di ba? Mas maganda para magkakaroon sila ng consensus. Letter Cat. The nurse manager is receiving some feedback. Then one of her staff nurses has been observed to be always irritated, bossy, and indifferent to her patients and some co-workers. Which of the following priority nursing actions should the nurse manager implement? Magmi-meeting ka ba niyan, yes or no? Magpapa-meeting ka ba kagad? O kakausapin mo muna siya privately? Kausapin mo muna siya, 'di ba? Kausapin mo muna siya. Pero kapag recurring na siya, 'di ba? Doon ka magbibigay ng memo, sanction. Okay, letter Cat. Number 75. A team building session was conducted by the HRDO task force to come up with the strategies for conflict resolution. Which of the following is a win-win approach in a conflict management? Kapag win-win, ibig sabihin nito, both ba sila mag-agree? Yes, 'di ba? Letter, letter yan? Letter Boy. Okay, letter Boy. Win-win approach kasi yan. Tingnan mo A and C, almost same answer lang sila. Same answer. Disagreements are settled with respective compromises. Compromising yung letter Dog mo. Okay, compromising si letter Dog, hindi siya win-win situation. Ang win-win, sabi lahat kayo mag-agree. Okay, without even compromising. Letter Boy. Next. Situation. Juvie, a retired barangay health worker, came to the OPD to her checkup for her diabetes mellitus. She had been diabetic since she was 37 years old. She has been taking her maintenance medication, which sometimes does not comply with. There are metabolic abnormalities in the development of your type 2 DM. Which of the following is not included in this abnormalities? Kapag type 2 DM po ba? Ano meron kay patient kapag type 2? Anong difference ni type 2 pati type 1 DM? Si type 1 may insulin, wala. Type 1 wala. Si type 2 may insulin, siya? Insulin resistance. Okay, insulin resistance. Okay, somatic X si letter Cat. X si letter Cat kasi not included 'di ba? Ang tendency nito nagkakaroon siya ng nag-i-increase ba ng production ng insulin, yes or no? No, nagde-decrease yan, letter Boy. Okay, decrease insulin production. Dalawa lang kasi yan sa pag type 2 DM. Ang type 2 DM mo, type 2 DM. Number 1, insulin resistance and decreased insulin production. Ayan siya. Dalawa lang siya. Insulin resistance and decreased insulin production. Okay. Next, 77. Miss Juvie was admitted to the hospital for further checkup. Which of the following diagnostic tests do you expect to be ordered by the diabetologist as an indicator that the patient is compliant with her medication. Ano kaya yan? Anong gold standard natin kapag DM type 2? Letter boy. Yung HbA1c mo or glycosylated hemoglobin level, HbA1c. Okay? HbA1c. 78. While Nurse Ellen was completing her assessment, she discovered the following finding. Which of the following should you refer immediately to the physician? Diba? Pag ganyan, expected versus unexpected. Okay? Expected ba na complication, tingling sensation of the hands and feet? Yes or no? Expected ba to? Yes, expected yan. Diba? Peripheral neuropathy. Changes in peripheral vision? Yes. Diabetic retinopathy. Beginning ulceration of the left big toe? Yes. Okay, yes din yan. Pero yung fruity, other breath, ano kaya yan? Complication, emergency po ba yan? Yes or no? Emergency po ba pag nag-deep? Yes. Most probably, anong diagnosis ni patient niyan? Diabetic ketoacidosis. Eh di ba pag nag-DKA si patient, emergency po ba yan? Yes. Okay, emergency yan. Okay, ano po ba sir, bakit nagkakaroon ng DKA? Common kasi yan, di ba? Nagkakaroon ng impaired metabolism sa fat and carbohydrates. So leading to your hyperglycemia. Okay? So syempre, ihi ka ng ihi, ang tendency mo magkakaroon ka ng cellular starvation mo. So kapag nagka-cellular starvation ka, anong mangyayari doon? Magkakaroon ka ng ketones. Kaya ka magpa-positive for your ketoacidosis. Okay? Kaya ka magpa-positive for your ketoacidosis. Sige, screen cap nyo muna. Sabihan niyo kapag next na. Okay na. Okay, is next. Nurse Ellen, the charge nurse. The nurse in charge of patient Juvie informed her physician that her glucose level is 38 millimoles per liter and quite unresponsive to verbal questioning. The nurse suspects that she is starting to develop her DKA. Which of the following manifestation is unique to this condition? Ano kaya? Ano po bang Kapag DKA, ano most probably yung respiration mo? Cosmos. O ano yung cosmos ba? Letter cat. Rapid deep respiration. Mga deep respiration. Ano ba itsura nun? Okay? So, marunong kayo mag-compute ng millimole per liter to mg per dl. Kasi di ba ang common lumalabas mg per dl talaga? Yes or no? Mas familiar kasi ako sa mg per dl. Kayo ba? Saan kayo mas familiar? Para lang aware kayo, kadalasan i-multiply mo to by by 18 lang. Okay, multiply by 18, makakompute mo ni mg per dl. Okay, for example, 38 millimole per liter times 18. Ano ba siya? 78 was letter dog. 38 times 18. 684. And taas niyan. 684 mg per dl. Ganyan na po mag-compute kapag kapag hindi kayo sure when it comes to your millimole. Okay, pag hindi kayo sure kapag millimole. Okay. Kasi hindi rin ako sure. Minsan kasi may mga weird yung lumalabas sa board exam minsan. Okay. 18, constant lang talaga siya. Constant siya. Okay, the times mo lang talaga siya na 18. Okay. Next, ganito itsura kasi kapag cosmal breathing. Okay, deep rapid respiration. Diba? Ang Cheyne-Stokes kasi may episode siya ng apnea. Okay. Ang Bayot naman, hyper, tapos biglang apnea, hyper. Yung Cheyne-Stokes kasi para siyang tataas, bababa, tataas, bababa, tataas, bababa. Ganun yung tendency mo kapag Cheyne-Stokes. Kapag Bayot naman, madami stop. Okay, ganun ang Ang cosmal, deep rapid respirations. Okay? Deep rapid respiration siya. Okay? Ay, tanggalin pala natin to. Screen cap nyo. Sabihin niya kapag next na. Next. Okay, ito. Nurse Ellen counseling. Role includes lifestyle changes as well as pharmacologic regimen. Zubi's family were interested to know information regarding insulin. She differentiated intermediate acting insulin from the short acting, which is, ano kaya dyan? Kadalasan kapag regular, okay? Ano kaya? Letter. Tandaan nyo, kapag nag-insulin ba kayo, ano mas preferred nyo, before or after meal? Ano mas preferred nyo? Before. Before, mas gusto natin before, ha? Mas gusto natin before meals. So, letter, dog, okay? Regular onset, 1.5 hour, diba? Peak is 2 to 3 hours and duration is 4 to 6 hour duration. Administer 20 to 30 minutes before administration. Okay? Kapag regular. Yeah, para hindi rin ano. Okay, tatandaan nyo, kadalasan yan, magiging ano dyan, before. Yung tatandaan nyo kapag yung choice before or after meal. Mas piliin nyo yung before, ha? Mas piliin nyo yung before. Kasi kapag nag-after kayo, baka kasi mag-hypogly. Okay, baka mag-hypogly yung patient nyo kapag ganun. Okay? Next. Situation, Nurse Mitch admitted Eileen, 38 years old, who was diagnosed by her physician with type 1 diabetes mellitus. She complains of easy fatigability and increased tiredness. Nurse Mitch during assessment noted that the presence of foot ulcer which Eileen was trying to hide. Okay? Type 1 DM daw. Nurse Mitch holds. Ala, sino yan, Manday? Ala, galit na galit, Manday. Ala, galit na galit man. Okay? While doing her assessment, her hands were cold and clammy. She suspected that the patient was having hypoglycemia. To relieve her condition, an immediate action is to offer her with what? Madami din magagalit sa akin dito. Madami din magagalit sa akin pero dito. Okay, ano po ba yung may present na simple sugar dito? Diba? Ano ba, ang question dyan, ano mas madali ma-breakdown? Simple or complex sugar? Simple sugar. Ano yung may simple sugar dito? Letter? Ano yung simple sugar? Fructose. Diba? Fructose is a simple sugar, yes or no? Diba? Yes. The correct answer is letter dog. Letter dog. Diba? Diyan tayo. Kasi ang candy mo, complex sugar ba to? Ha? Complex sugar. Hindi siya simple sugar. Okay? Hindi siya simple sugar. You would go for your simple over your complex sugar. Para mas madali bang ma-breakdown? Mas madali ba ma-breakdown? Yes. Okay? Meron nagsabi, for the client whose blood glucose is 70 and below, or a client with unknown blood glucose so exhibiting signs of hypoglycemia, administer 15 grams of simple carbohydrates. Okay, simple carbohydrates. Okay? Sino sabi? Okay, I'll try to that one. Pero nakita ko kasi talaga simple sugar yung fruits. Okay? Last ratio din candy. Sige, I'll try to confirm this one. Okay? Pero kasi binigay kasi yung candy. Ay, yung fruits. Okay, binigay kasi yung fruits. Nasa choices kasi yung fruits. So, mas mag-go ako sa fruits. Diba? Yes, mas accessible and mas available siya. Pero given that the choices, okay, given the choices, diba? Mas mag-go ka sa fruits. Okay? Given the choices. Grabe naman. Paano pag frutos? Grabe naman. Okay? Grabe naman. Wala naman nakalagay na frutos dyan. Okay? Pero given the choices kasi. Diba? Mas mag-go ka sa simple sugar rather than the complex one. Okay? Next. Kung walang fruits, siyempre go ka na sa candy. Okay? Pag walang fruits na nakalagay diyan, go ka na for the candy. Okay, go ka na for the candy. Nurse Mitch watches Miss Eileen while sleeping, an excellent guideline to different if a patient is just sleeping or experiencing hypoglycemic reaction is when one is observed to be, yung tamang sagot dyan. Paano mo ma-differentiate yung hypogly sa sleeping? Letter cat, diaphoretic. Okay, diaphoretic po. Diba? Snoring yan, ang snoring mo kapag severe na yung hypoglycemia niya. Okay, severe na yung hypoglycemia niya. Okay, letter cat. Nurse Mitch practice surgical asepsis during foot care. Which of the following technique has to be observed? Opening container of sterile water after putting on gloves, yes or no? Tama po ba yun? No. Okay, hindi rin po. Placing sterile dressing 2 cm from the edge of the sterile field, that is should be 1 cm. Okay, 1 cm dapat siya. Okay, cleaning the wound in circular motion from the outer towards the ulcer site, di ba? Dapat inner to outer, yes or no? Yes, inner to outer. Letter boy. Changing the sterile field after sterile water spilled on it. Di ba kapag nagkaroon ng moisture or kapag na-soiled yung sterile field mo, ano mangyari? Magiging contaminated na ba siya? Yes or no? Magiging contaminated na ba siya? Yes. Okay, magiging contaminated na siya. 84. Nurse Mitch after foot care encourages patient Eileen to do which of the following appropriate measures? Magbibigay ka ba ng lanolin? Ang lanolin mo kasi parang ointment, yes or no? Magbibigay ka ba ng ointment? No. Okay, no yan. Close to the skin po ba? Cut the tonus round at the edges. Close to the skin. Hindi rin po kasi ang tendency niyan parang mag-occlude siya. Okay? Apply alcohol after cleansing the feet. Masakit po ba yon? Yes or no? Masakit ba siya kapag naglagay ka alcohol doon? Yes, mahapdi yan, day. Mahapdi. Letter dog. Okay, letter dog. Wear at shoe type sleeper at home. Kumbaga yung parang Crocs. Okay, o kaya yung sinaslide mo lang siya. Letter dog. 85. Miss Eileen was administered NPH insulin at 8 a.m. At which time would Nurse Mitch expect the patient to be at risk for hypoglycemia? Most probably kapag ganito, after ilang hours yan, nagpipik yan ng ilang hours ang peak niyan? 4 to 6 hours. Okay, kapag nagpeak siya ng 4 to 6 hours, most probably doon ba siya pwede mag-hypogly? Yes or no? Yes. Anong tamang sagot dito? Letter boy. Okay, letter boy. 12 noon. Okay, letter boy. A 6-year-old boy is suffering from pain on his right inguinal region. His mother brought him to the hospital and was diagnosed to have incarcerated hernia. She had a scheduled herniotomy. Okay, what will be your first preoperative nursing measure? Tamang sagot kaya dyan. Kunin mo yung informed consent. Ibig sabihin nito, kukunin mo na informed consent form kung nag-ano ba talaga sila. Nagkaroon na ng consent. Letter apple. Okay? Bakit mali yung letter boy? Scheduled pa lang naman. Hindi mo pa naman siya dapat i-surgical gown. Okay? Shave the operative site. Nag-shave ba tayo pag OR, yes or no? Shave ba pag OR? No. Clipping or trimming na lang siya. Okay? Clipping or trimming. Bakit, sir? Kasi di ba common ba kapag nag-shave ka ba, common ba magkaroon ng cuts? Yes or no? Yes, pwede siya magkaroon ng cuts. Correct answer is letter apple. Letter apple. Next. The boy is transferred to the operating room. What is the best mode to be used in transferring the patient? Ano kaya yan? Letter letter boy. Stretcher. Stretcher yan. Okay, stretcher po. Letter boy. Next is number 88. The nurse must prepare the OR environment to be safe and comfortable for the child by reducing the air conditioning temperatures so as to prevent what? Diba? Pag air condition malamig, prone ba magkaroon ng hypothermia? Diba? Prone ba mag-hypothermic ang mga tao pag nasa OR? Yes, lalo na kapag post-op. Yes, yan. Prone sila mag-hypothermic. Okay? The scrub nurse has to prepare for pediatric herniatomy. Which of the following should be ready? No, ngayon tamang sagot dito. Yung mga monofilament kasi is used for what? For wound laceration or internal soft tissue wounds. Okay? Letter dog. Okay? Recommended daw kasi to sa mga patient na may repairing internal soft tissue wounds. Wounds or laceration. Ayan siya. Yan yung tamang sagot. Letter dog. Okay, letter dog. Okay. Next. Yung subarticular, siya, ang disadvantage kasi ng subcuticular kasi, hindi siya long-lasting. Kaya hindi ka nag-aano ng subcuticular. Okay, hindi siya long-lasting na suture. Kaya siya hindi siya choice mo. Mas gusto mo yung monofilament. Okay? The mother was afraid to submit the child for surgery. What is the best response to the nurse in this situation? Diba? I-acknowledge mo yung concern, diba? I understand your feelings, but your child needs to be operated on. Diba? Letter apple, it is all right to feel that way, but you cannot do anything now, diba? Meron pa din po bang kumbaga, meron pa din silang, may decision pa din sila kung anong gusto nilang gawin sa nila. It is a doctor's order, so you should have accept the situation. Hindi rin naman pwedeng ganun. Your child's condition is an emergency. Emergency ba yung herniatomy? Yes or no? Emergency ba yan? Herniatomy. Emergency ba siya? Most probably hindi. Elective po. Elective siya. Okay, elective type of surgery ang herniatomy mo. Okay? Next. The nurse are extensive legal aspects that guide the Filipino nurses in terms of regulation in practice of her profession. The Professional Regulation Commission or the BON as the regulatory board has the legal functions and responsibility except in one of the following. Ano kayang tamang sagot dito? Ensure quality nursing education, yes. Okay. Monitor and enforce quality standards and nursing practice in the Philippines to ensure efficient, ethical, moral, technical, professional, yes. Issue, suspend, or revoke certificate of registration for the practice of nursing, yes. Okay. Ano nagpamali dito? Hindi naman po nagko-collect ng fees. Okay? Hindi naman po nagko-collect ng fees ang PRC BON. Okay? Hindi sila nagko-collect ng fees. Letter dog. Number 92. You are a nurse in Las Piñas Doctors Hospital and have just completed 2 years experience in the surgical unit. One day, your supervisor ordered you to go on a float to the intensive care unit as two of the nurses called on sick in the said unit. What is the most important action you should do in this situation? Dito kasi, tingnan nyo yung composition ng sentence. Nakalagay dito just. Ibig sabihin niya para medyo ina-underestimate yung yung person. Okay, ano ba pinaka best answer diyan? Letter apple. Okay, apple pa din. Bakit? Explain to your supervisor that you might not be able to perform safely your duty as a nurse in the unit. Kasi nakalagay just. Okay, parang yung the way the sentence is parang ginawa, parang medyo hindi pa siya ganun ka-experience yung 2 years. Okay, parang hindi pa siya ganun ka-experience. At the same time, surgical unit kasi yan. Okay, surgical unit, hindi naman siya medical unit. So letter apple. Okay, letter apple. Next, 93. A 35-year-old married to an insurance agent was diagnosed with colon cancer only a month ago. The couple have very limited information about this condition. One day you saw the husband in the room reading the chart, which was advertedly left by the medical intern. What priority nursing action should you do in this situation? Tamang sagot. Tanungin mo siya kung anong concern. Okay? Anong concern? Letter dog. Okay? Ask the husband what information he would like to ask from the healthcare professional regarding the medical plan and diagnosis para ma-address mo. Bakit ba siya nagbabasa nun? Okay, para ma-address mo siya. Letter apple, X and get the chart. Parang ang rude. Okay, explain to the husband, yes. Diba? Pwede siya. Pero at the same time kasi yung letter dog, na-address mo yung issue. Yung issue dyan, curious yung husband kung ano ba mangyayari kaya siya nagbabasa. Letter dog. Okay, letter dog. Nurse Nicole is assisting Mr. Kaka, who just came from the recovery unit for a thoracic surgery. She noted that the dressings are saturated with blood, but the surgeon just reassured the nurse to reinforce the dressings and monitor him closely. After an hour, Miss Kaka went into shock and died. The family charges against the doctor and the nurse. What is the lawsuit involved in this case? Ano kayang tamang sagot dyan? It is what? Malpractice. Malpractice po. Ano yung assault? Ano yung assault? Ano kayang ibig sabihin na assault? Threatening. Nagte-threat ka. Diba? Nagte-threat ka. How about your battery? Ano yung battery? Ito yung unconsented touch or ginawa mo na mismo yung harm. Okay, letter dog is the correct answer. Letter dog. 95. What is the most important nursing measure that the nurse, Nicole, should have done to avoid the situation? Ano kaya? Monitor, yes. Diba? Report to the surgeon, yes. Diba? Call the supervisor on duty to assist you in referring the patient to the surgeon, yes or no? Bakit kaya hindi? Ano kaya reason? Diba? Ang context kasi dito, diba? Ang context kasi dito, ni-refer mo na siya kay doctor, yes or no? Ni-refer mo na siya kay doctor. Yes, ni-refer mo siya kay doctor, pero sinabi ni doctor na normal lang, continue. So, kanino ka magre-report after nun? Kung ganun yung nangyari, kay supervisor. Very good. Call the supervisor on duty to assist you in referring the patient to the surgeon. So include na natin si number 3, letter boy. Okay, letter boy. Diba? Kasi diba, yung context dito para hindi na siya mangyari ulit to avoid the situation. Diba? Monitor and record closely the vital signs until stable. Report to the surgeon the vital signs and degree of bleeding of the operative site. Pero kasi sa situation sa number 90, number 94, parang sabi ng doktor, monitor him closely lang. Diba? Yan. So letter 3, letter boy. Letter boy. Sabi sa amin, di na daw dapat agad. Kasi diba, ang kasi dito, diba, kanino ka ba Well, your supervisor kasi is supervisor on duty. That charges the supervisor on duty. Okay? Diba? The supervisors that charges in duty. Supervisor nga, siya nga yung head eh. Diba? So letter boy. Okay, letter boy. But I'll try to kasi parang contradicting yung answers natin dito. Try ko kausapin ko sino Okay, but I'll go for letter boy. Okay, letter boy. Okay, next. Honey, 23 years old, a dental student, has been having frequent bouts of tonsillitis in the past. One day, she developed low-grade fever, dyspnea, dizziness, and syncope and fainting spells while preparing for her final examination. She was rushed to the hospital by her parents and was seen in the emergency room by the physician on duty. Miss Jenny was the nurse on duty. The physician on duty ordered 12-lead ECG or EKG and other laboratory tests. What specific information is essential for the health professional to know when this EKG is ordered for the patient? Anong tamang sagot dito? Letter? Ano kaya? Letter C. Okay? Rate, rhythm, axis, and hypertrophy and infarction. Ano po ba ang inaano kapag ECG or EKG? Ang inaanap mo dyan, cardiac dysrhythmia. Sulat natin, cardiac dysrhythmia. Charot. Ano bang tamang spelling? Cardiac dysrhythmia. Yes. Okay. Location and extent of MI and cardiac hypertrophy. Yan siya. Okay? The correct answer is letter C. Letter C po. Next. Kopya na. G. Okay. Aside from EKG, the physician on duty ordered patient Honey to undergo your cardiac catheterization to establish further medical diagnosis of valvular heart disease. Which of the following is not true as part of Nurse Jenny instruction to the patient regarding this procedure? Cardiac catheterization. It is an invasive procedure, yes or no? Invasive procedure, yes. Okay. Kapag invasive procedure, kailangan mo ba ng consent? Kailangan mo ng consent, yes. Okay. Correct answer is letter Apple. Hindi po siya optional, but it is a required. Letter Apple. Okay. Next. Nurse Jenny must be alert that certain complications may arise from after the procedure. What priority nursing assessment should be observed? Kapag cardiac catheterization, take note nyo, kapag cardiac catheterization, artery ang ang site of access mo. Okay, artery po ang site of access mo. So ano most probably babantayan mo dyan? Saan ba, kapag artery, major arteries ang pinapasukan yan, it's either dito or medyo, or minsan femoral pa. So ano dapat ang babantayan mo? Letter boy, 'di ba? Signs of bleeding at the puncture site. Okay, signs of bleeding at the puncture site. Kapag nagkaroon ka ng bleeding, anong gagawin mo? Anong gagawin mo? Letter, it's pressure. Okay, pressure. 'Di ba? Ipe-pressure dressing mo siya agad-agad. Okay? Number 99. When teaching a patient, Honey, about self-management following cardiac catheterization, Nurse Jenny should emphasize to avoid one of the following. Ano kayang tamang sagot dyan? Kadalasan, yung mga patient mo na after the cardiac catheterization, pinagbe-bed rest muna yan sila. Okay, pinagbe-bed rest muna yan sila. Letter C. Taking showered with site covered after 24 hours. Letter C. Okay, letter C. Next, the physician on duty established Honey's diagnosis that she is suffering from acquired valvular heart disease. This condition is brought by, ano ba yung situation dito? Nagkaroon siya ng tonsillitis. Okay, most probably, kapag may frequent recurring tonsillitis, saan ka pwede mag-lead? Sa letter Apple, rheumatic fever. Okay, rheumatic fever. Okay, question sa NP3. Question sa NP3. Okay, let's have a quick break muna, 10-minute break bago NP4. Balik kayo ng 10:35. Okay, balik kayo 10:35. Quick break lang. Thank you. Okay? Nandyan pa kayo. Nandyan pa. Hello po. Yeah. Okay. Nurse Yasmin cares for a terminally ill client. Okay. Nurse Yasmin assesses the client for depression, which of the following is a key indicator for clinical depression. Ano kaya ang tamang sagot dito? Ano kaya? 'Di ba? A mental health issue is considered a clinical problem kapag hindi na po ba niya naalagaan yung sarili niya? Yes or no? Yes or no? 'Di ba? Kapag hindi niya na naalagaan yung sarili niya, it's a sign of problem po ba? Yes or no? Yes. Okay, the correct answer is letter dog. Inability to care for one's physical self. Letter dog. Okay. Next, the client has difficulty of sleeping. Which of the following interventions is least helpful for Nurse Yasmin to incorporate in her care plan? Okay. Give warm milk, yes or no? Yes or no? Pwede ka, yes. Diba? Yes yan. Okay. Perform muscle relaxation, such as massage, imagery, and music. Tama sa yes, pwede yan. Yung black tea, pwede ka ba magbigay ng black tea? No, kasi may caffeine to. Yes or no? May caffeine po ba ang black tea? Yes, okay. Etong yung letter apple mo, medyo broad kasi yan. Kasi may mga herbal tea ba na nagpo-promote ng sleep? Yes or no? Meron bang? Yes, example? Chamomile. Okay? Chamomile. 'Di ba? Chamomile yung mga letter dog. Hindi ka papatulugin yan. The care plan for the client includes family support. Which of the following is most appropriate for the family to establish a relationship with the healthcare team? Nurse Yasmin should, healthcare team. Kailangan ba magkaroon ng friendship, yes or no? Friendship. Promote friendship ka ba pag ganyan? Friendship, professional relationship dapat, di ba? Professional relationships na dapat. So, X. Hindi ka dapat makikipag-friends kapag professional relationship. Discuss the roles of the family members. I-discuss mo ba yung roles ng family members o yung roles ng interdisciplinary team? Ano kaya? Yung team. Correct answer is letter letter cat. Explain the roles of all members of the interdisciplinary team. Hindi po si family members, but the interdisciplinary team. Number 4, the client appears to be dehydrated. The family members are discussing whether their loved one should be given intravenous fluid. Which of the following concept about dehydration in terminal client should guide the nurse? Yasmin. Ano kayang tamang sagot dito? Letter, 'di ba? Kapag terminal ill client, ang goal mo is towards comfort and reduction of symptoms. Okay? Comfort and reduction of symptoms. Letter dog. Letter dog. Okay? The client shows signs of imminent death. Nurse Yasmin recognizes cardiovascular indicators of imminent death, which are the following except, tamang sagot dito. Kapag imminent death, ibig sabihin ito, mamamatay na ba talaga siya? Sure na mamamatay na si patient? Yes or no? Yes. 'Di ba? For sure yan. Lowered yung blood pressure niyan. X to si letter dog. Irregular heart rate? Yes. 'Di ba? Paano mo nalaman kapag mamamatay na talaga siya? Kapag bradycardia? Letter cat, except kasi hinahanap mo. Okay, except ang hinahanap mo. Three-fourths letter C and D. Okay. Ito pala yung mga clinical manifestations mo na impending clinical death. Ibig sabihin ito, na siya, mapunta na siya doon. For example, sa circulation mo, diminished sensation, mottling and cyanosis of the extremities, cold skin, slower and weaker pulse, and decreased blood pressure. Okay? Yan yung mga common. Sabihin sa akin kapag done yun ng screen cap. Okay? Next. A 65-year-old male client is admitted for prostate cancer on assessment. The nurse determines that the patient has experienced incontinence. The nurse knows that the incontinence is the most common symptom of prostate cancer. Based on the information gathered, the nurse writes a nursing diagnosis for of which of the following is most appropriate. Tamang sagot dyan. Letter, di ba? Urinary incontinence siya dyan. So most probably, ang correct answer dyan is letter dog. Impaired, risk for impaired urinary elimination. Letter dog. Number 7. Okay. To help manage incontinence, the nurse instructs the patient to do which of the following? Eat foods rich in fiber, yes or no? Magre-rich in fiber. Connected ba yung letter apple? No, hindi siya connected. Increase fluid intake, pwede. Pwede siya. Okay? Take medications to manage the pain. May pain po bang sinasabi? May pain po bang sinasabi? Wala din. Okay? Perform perineal muscle exercises. Yes. Anong best answer dyan? Letter dog. Letter dog. Okay? Letter dog. Okay? Next. The patient asks for the treatment option for his condition. The nurse explained that the treatment options are based on which of the following? Ano kayang tamang sagot dito? Letter? Ano kayang tamang sagot dyan? Okay. The patient asked for treatment option for his condition. The nurse explained that the treatment options are based on which of the following? Ano kaya feeling nyo? Gender. Ano ba to? Prostate cancer. May prostate cancer po ba ang babae? Wala yan, B. Diba? Wala yung prostate cancer. So, X agad si ano. Ito, X to. Socioeconomic status, pwede din. Pwede naman siya. Okay, pwede siya. Pwede siya. Yes. Socioeconomic status, pwede po ba siya? Yes or no? Yes or no? Actually, pwede din naman siya. Pwede din naman siya. Pero hindi siya mas importante as kesa kay BND. So, mag-ano tayo sa situation ng BND? Yes or no? Diba? BND. Okay, ability of the patient to manage physical and emotional implications of the incontinence. Pwede din naman. Grade and stage of the disease, yes, pwede din. Pero ano kaya mas maganda dyan? Letter? Ano? Conflicting answers din to be honest. Pero we would go for a letter boy. Letter boy. Kasi kasama yung age ni patient, okay? Tsaka patient preference, okay? Ability to manage physical emotional implications of your incontinence. Diba? Kaya mas mag-go tayo to your letter boy. Mali yung letter boy. Okay? Letter boy. Ito siya. Kasi anong tawag dito? Yung symptoms kasi niya, yun kasi yung yun yung naglalagay sa kanya. So letter boy. Okay, letter boy. Next. The patient asked the nurse what the physician meant to be his prostate cancer of stage 3 or T3. The nurse explained that the tumor is, ano kaya? Kapag T3, sabihin ito, pwede na ba siyang, pag may bone mets, anong most probably pag may bone mets na? Ano most probably? Stage, mets na yan. End stage na. So most probably stage 4, T4 na yan. Diba? Confining the prostate was not palpable during digital rectal exam. Diba? Hindi rin naman. Okay? Same answer lang din naman tong dalawa. Best answer was letter boy. Diba? Palpable and spread beyond the prostate and not to the organs. Okay? Ayan siya. Ito yung staging mo ng prostate cancer. Stage 1, small and only in the prostate. Diba? Stage 2, larger and maybe in the both lobes of the prostate but still confined with the prostate. Kapag stage 3, most probably may lymph nodes na nakasama dyan. Ibig sabihin yan, na siya. Stage 4, may bone na siya. May bone mets na siya. Okay? Bone mets. Letter, bali correct answer is letter boy to number 9. Number 9. Okay. Next, the nurse recalls the staging and reclassification of the prostate cancer. Which of the following is true? Okay, the Gleason grading system is for your prostate cancer po. Okay, prostate cancer, not for your hematological cancer. Again, your Gleason grading system is for your prostate cancer. Okay, prostate cancer po yan. Okay, at least 2 separate biopsies. Ang require nilang sample na kailangan dyan is 10 to 12 tissue. Okay, 10 to 12 tissue specimen ang nire-require mo dyan. 10 to 12 tissue specimen. Okay, correct answer is letter boy. The normal prostate range under 40 years of age is less than 4 to 6. Okay, a normal PSA considered to be 4 nanograms per ml of blood. Okay, of blood. Correct answer is letter boy. Okay, letter boy. Sabi sa akin kapag move forward na. Okay. Nagpamali si A kasi hindi siya ginagamit sa hematological cancer but ginagamit siya sa prostate. Sa prostate cancer po ang Gleason grading system. Okay? Next. You are newly promoted charge nurse of a department in a tertiary hospital. You review management concepts to prepare. You review management concepts to prepare for the position. The following questions pertain to the management resources. You're oriented on the healthcare economics. The study of economics focuses on how choices are made to overcome scarcity of resources. Which of the following best state illustrates healthcare economics? Ano kayong tamang sagot dito? Providing less healthcare services that is optimal in order to contain cost. Hindi, 'di ba? Mas gusto mo ba yung mas madami ang mabibigay na healthcare services? Yes. Okay? Using individuals with less knowledge, 'di ba? Mas gusto mo yung competent. Okay, mas gusto mo yung competent. Correct answer is letter boy. Diba? Taking economic risk as healthcare provider, providing adequate or appropriate care minimize risk of expensive utilization. Letter boy. Okay, letter boy. Okay, number 12. Which of the following is true about regarding healthcare economics? Ang healthcare economics mo ay ano? Tamang sagot dito. Okay, tamang sagot dito. Letter C. Healthcare economics is new concept in nursing. Okay? Healthcare economics is new concept in nursing. Actually, wala pang masyadong sources regarding your healthcare economics. Okay, wala pa talaga masyadong resources when it comes to your healthcare economics. You understand that the key factor to influence client care is the cost involved in the delivery of healthcare services. Which of the following resources, okay, resources na hinanap natin is not required to support the services rendered by the nurse? Ano kaya? Your time, your human resources, and equipment are the resources needed to deliver quality and safe patient care. Letter boy. Okay? Again, your time, your people are your human resources and equipment. Ito yung mga kailangan mo para makapag-deliver ka ng quality and safe patient care. Letter boy ang maling sagot kasi not. Okay, not. Okay. Next. You are aware that there's a need for you to understand how to manage costs of client care as it relates to clinical practice. Which of the following are nurses accountable for? Ano kaya yan? Siyempre, doon ka na sa ano, sa broad na answer, 'di ba? Letter C. Okay, distribution and consumption of resources such as time, supplies, drugs, staff, and your personnel. Okay, clinical practice kasi siya. Okay, so most probably nandun siya sa pagdudutihan mo. Letter cat. Letter cat. Sir, madami po bang ganitong concepts? Yes. Madaming ganyan concept sa Palmer. Ay, sa board exam. Panay Palmer talaga. Okay? While touring the department where you were assigned, you noticed that the supply room is stocked with medical supplies and equipment. Which of the following is best action you will take? Okay, tamang sagot dyan. Create a task force to assess the situation and report the findings. Pwede siya sa letter dog. Okay, pwede siya sa letter dog. Take an inventory of supplies and equipment. Nandito din siya sa letter dog. Diba? Request maintenance to sort out supplies and check the medical equipment to determine if they are still functional. Nasa letter dog din siya. Call for staff meeting and discuss how best utilize the available resources. That is your umbrella answer, letter dog. Okay? Kapag mga ganyan, hanapin niyo mga umbrella answers. Okay, letter dog. Okay? Next. Situation, a 34-year-old female client complains of experiencing double vision and frequent headaches. The client claims to be forgetfulness, mood swings. A diagnosis of right frontal lobe lesion. Ibig sabihin ba may mass bang nakita? May mass or pwedeng meron nakitang iba? Yes or no? Yes. And the client was admitted for your craniotomy. Okay? The client claims to have a diagnostic workup in the outpatient unit before she was admitted. The admitting nurse prepares the client for which of the procedure that most likely confirm the presence of your brain tumor. Okay? Ano kaya yan? Yung x-ray mo, hindi yan madedetect, promise, hindi yan madedetect. Ang best answer dyan is your CT scan kasi it would direct your soft tissues. Okay? Mas maano yung soft tissue dyan. Kumbaga makita yung mismong brain mo kung may presence ng brain tumor. Letter boy. Okay, letter boy. 17. While the client is being interviewed, she had seizure. Okay, kapag nagka-seizure, anong priority mo? Habang nagsi-seizure si patient mo, letter apple, protecting the client kasi may safety issue ba to, yes or no? Yes, okay. Safety yan ang priority mo kapag nagsi-seizure yung patient mo. Letter apple. Diba? Letter apple. After the surgery, it is important to position the head of the client properly to, tamang sagot dyan. Para saan daw? Ano muna bang position of choice mo pag ganyan? Anong position of choice mo? Kung ano post-op yung patient mo, craniotomy. Diba ang goal mo ba ma-lower ang intracranial pressure, yes or no? Yes. So anong position of choice mo? It is what? 30 degrees, diba? 30 degrees. So most probably low Fowlers yan. 15 to 30 is low Fowlers. Okay, low Fowlers po. Okay, low Fowlers siya. Yes, kasi ang semi-Fowlers mo nasa 45. Diba? Ang high Fowlers mo almost 45 to 90. Ang low Fowlers mo nasa 30. Okay, nasa 30 yan. Okay, ano bang tamang sagot sa number 18? It is to what? Decrease your intracranial pressure to facilitate venous strain. Letter apple. Letter apple po. Okay, letter apple. Number 19, the nurse is aware that one of the measures listed below contraindicated in post-operative pulmonary toilet. Ano kayang tamang sagot dito? Siyempre, pwede ka mag-deep breathing, yes. Okay, pwede ka mag-turning, yes. Coughing, yes. Kasi assisted naman si patient ba yung may control kapag nagka-cough siya, yes or no? Yes, siya yung may control dyan. Pero kapag suctioning mo ba, ano bang tendency mo dyan? Pwede ba siya maka-increase ng intracranial pressure? Yes. Kasi walang control yung patient mo dyan. Ikaw yung pwede ka mag-suction na mag-suction. Okay, letter apple. Okay, letter apple. Number 20. The surgeon orders her glucocorticoid dexamethasone to be given following craniotomy. The nurse recognizes that this drug, ano nga yung tamang sagot dito? Ano po ba ang steroids in general? Anti-inflammatory po ba ang steroids? Yes or no? Anti-inflammatory? Yes. Ano bang ginagawa kapag anti-inflammatory? Nire-reduce mo ba ang pamamaga? Pagmamanas? Yes. Anong tamang sagot dito? Letter dog. Letter dog siya. Diba? Your dexamethasone is a steroid. Steroids are strong anti-inflammatory agents that may reduce the edema in the cerebral tissues. Letter dog. Letter dog. Okay. Next. Next is your a nurse in the nursing intensive care unit attends to a 20-year-old female client who was involved in a vehicular accident 3 days prior to admission. The prognosis is a very poor brain activity was detected after 2 electroencephalograms were taken. The family decides to wean the patient from ventilator support. The family talks to the nurse about the decision regarding to get the nurse's support. Which of the following is not appropriate? The nurse, what? Ano kaya dyan? Check the physician orders for sedation and analgesia and make sure that the anticipated death is comfortable and dignified. Yes. Okay. Explain to the family what will happen each phase of weaning and offer support. Yes. Okay. Participate in decision making. Kasama ba dapat to? Dapat kasama ba yung family sa decision making? Decision making, yes. Kasama yung family sa decision making. Pero, ano mali dito? Letter C, tell the family that that will occur almost immediately after the ventilator is from the ventilator support. Okay, hindi kasi siya agad-agad mamamatay. Okay, hindi siya agad-agad mamamatay kasi ang tawag dito sa dito sa Pilipinas, bawal mo kasi tanggalin sa intube. Kumari yung patient mo mechanical ventilator. Tapos hindi kaya magtanggalin yung vent ni patient. Hindi kasi pwede yun natatanggalin mo lang agad-agad. Kahit sabi mo may waiver ka. Okay, kasi bawal, ethical siya. Kumbaga ethical conflict siya. Okay? So most probably magtatanggal yan ng ventilator support kapag kaya na ni patient. Okay, kaya ni patient yan. Kasi kapag tinanggal mo yung ventilator support, kahit sabi mo nag-decide yung family tanggalin siya tapos hindi kaya ni patient, bawal siya. Okay? At hindi rin naman po agad-agad mamamatay yung patient. Okay, kapag tinanggal mo siya sa ventilatory support. Letter cat. Weaning. Ibig sabihin ng weaning mo, unti-unti mo siyang kasi di ba we have your hindi ko kasi sure kung kayo. Alam niyo yung FiO2? Alam niyo yung FiO2 when it comes to your mechanical ventilator? FiO2. Aware kayo sa FiO2? Yes. Di ba? Ayan yung parang pressure of oxygen na binibigay kay patient. Yes or no? Parang the oxygen na binibigay kay patient. So for example, yung patient, ang meaning ng weaning mo, for example, yung patient mo, approximately nasa 70%. So, uunti-untiin mo siya ibaba para ma-wean off mo siya, para matanggal mo siya sa mechanical ventilator. Yun ang ibig sabihin ng weaning. Okay? Yung tinatry mo siya kung hanggang saan kaya ni patient. Para at the end of the day, matatanggal mo siya sa mechanical ventilator. Yun ang ibig sabihin ng weaning. Okay? Letter C. Dito tayo. 2 hours after the ventilatory support was discontinued, the patient dies. The nurse discusses that with the family possibility of donating the deceased person organs. The following are guidelines in organ tissue donation. Okay? The religious beliefs in organ donation and transplantation must be respected. Yes or no? Kailangan ba mas i-respect nyo? Yes. Okay. Donor must be free from infectious disease. Yes. Okay. The family and the deceased should have been offered an opportunity to speak with the knowledge organ procurement coordinator. Yes. Okay. The correct answer is letter boy. Okay. Letter boy. Kasi tingnan mo, consent by the physician. Di ba ang magko-consent niyan dapat yung family or yung patient itself. Okay. Letter boy ang tamang sagot. 1, 2, 4. Okay, 124. Anong Organ Donation Act nyo? RA what? Organ Donation Act. Organ Donation Act, RA. Okay, RA yun. RA 7170. Okay, RA 7170 or your Organ Donation Act of 1991. Okay. Next, number 23. The legal definition of death that facilitate organ donation is the cessation of what? Ano siya? Letter C. Okay, ano po ba ang legal definition ng death dito sa Pilipinas? Ang legal definition ng death dito sa Pilipinas ay the irreversible cessation of your circulatory and respiratory functions or the irreversible cessation of all functions entire the brain, including the brain stem. Okay, but the best answer is the irreversible cessation of your circulatory and respiratory function. Okay, letter cat. Sorry, sige. Letter cat. Balik ako sa 22 Pwede ba bumalik sa 22? May nagre-request lang. Pwede ako bumalik sa 22. Ito siya. Yan. Okay na. 23. Done na 23. 24 na. Pwede naman 24. 24. The patient is pronounced dead by the physician. Which of the following nursing actions violate the standards of care for a dead person? Tatanggalin mo na ba ng tubes to si patient? Yes or no? Yes. Diba? Tanggalan mo na ng tubes yan. B. Okay. Identification band. Yes. Lagyan mo. Okay. Prepare the transfer to the morgue. Yes. Okay. Ba't mali yung letter boy? Kasi naka-ano pa siya, sitting position pa siya. Kawawa naman, day. Diba? Kawawa naman. Diba? Papahigain mo ba yung patient mo? Proper anatomical position? Yes, proper anatomical position ka dyan. Okay? O dito. The family goes to the stages. Yeah. Diba pag pinaupo mo, ano mangyayari? Ano mangyayari kapag pinaupo mo yung pasyenteng patay na? B, lulundo yan, B. True or false? Magpo-fall pa yan. Mahuhulog sa upuan niya. Diba? Number 24 po is letter boy. Okay? When the family goes through the stages of grieving, what are the stages of your grieving process? Nang tamang sagot dito. Ano yung letter D? Ano yung D? Denial. A. Anger. Tapos, ano yung B? Bargaining. Tapos, depression. Then acceptance. Malay, dapat ganyan lang yung board exam questions, no? Panay ganyan lang, 1 to 100. True. Mas gusto niyo yung mga ganyan tanong, for sure. Ayaw niyo ng mga conflicting answers. Diba? Okay? Paano yung pag yung board exam questions nyo, 1 to 100 SATA? G kayo doon. Pero tawag dito, lahat ng sagot, all of the above. G kayo. Diba? Diba? 1 to 100, all of the above ang sagot. At least naka 100 kayo sa isang NP. Diba? Pag tinanong kayo, ano score mo sa NP3? 100. Diba? Ikaw, ay baba naman ang score mo, 80 lang. Diba? Okay? Malay nyo, meron ganung hindi ko kayo binibigyan ng site niya, pero merong ano ba yun? Merong previous board exam. 1 to 100 daw, SATA daw. Sabi nila, meron daw. Di ko maalam. SATA select all that applies. Oo, meron daw yung 1 to 100 daw SATA. Sabi nila. Hindi ko alam. Oo, NLE. Alam ko 2016 ata. 2016. Okay. The nurse assesses the patient for complications. Which of the most common complication? True, tapos signs and symptoms. Sakit nung promise kapag signs and symptoms. Pero NCLEX, di ba ganun ng NCLEX? Oh. Emergency room. So feeling nyo ba magkakaroon to ng abscess formation pag ganyan? Magkakaroon ba siya ng abscess formation? Abscess formation. No. Be ang abscess formation mo, matagal pa yan. So tanggal na si letter dog, letter boy. Okay? Pero titingnan, pag ganito, pansin nyo ba magko-context clues kayo sa sa ibang choices, yes or no? Kasi doon yung makikita yung tamang sagot. Yes. So anong sagot dito based sa ibang items? Letter apple. Okay, letter apple, 'di ba? Paralytic ileus and renal failure. Bakit, sir? Okay? Kasi titingnan mo dito sa number 27. The nurse knows that the renal trauma, okay? Further complications can occur such as what? Ang tamang sagot dito, letter, ano kaya? Letter cat. 1, 2, 3, 5. Ba't mali si number 4? Ano ba dapat? Hypertension. So pwede mo bang sagutin dito sa most probably pwede siya mag-lead to your renal failure kasi meron dito sa number 27, renal trauma, yes or no? Di ba ganun ka mag-context clues kapag ganyan? Yes, kaya ka nag-letter apple kasi kinontext clues mo siya. Okay? Ho? Paano ba kayo magsagot ng recalls? Paper ba kayo magsagot ng recalls? Paper, sa papel kayo magsagot ng recalls no? Or sa Google? Google. Okay. So wala pa kayo idea kung paano magsagot ng board exam? Proper, yung technique sa pagsasagot ng board exam. Wala pa, gets. Okay. Well, ang technique na nag-work sa akin nung board exam ko, sinagutan ko muna lahat 1 to 100 pero hindi ko siya i-shade. Okay, hindi ko siya i-shade. Nasagutan ko siya sa questionnaire. And then every 5 items dun ako mag-shade. Okay, every 5 items dun ako mag-shade kapag sure na ako. Okay? Kasi 2 hours po ang board exam, hindi po 1 hour. Hindi siya 1 hour 30 minutes. 2 hours siya. Okay, you have all the luxury when it comes to that one. Okay, may nagtanong lang kasi kung daw. Depende sa inyo kung paano mag-work. Okay, depende sa inyo kung paano mag-work. You can practice. Yung mga nag-face-to-face dito, pwede kayo mag-practice ng ganun. Okay? Pwede kayo mag-practice. At the same time, sige, singit ko na nga. Ang board exam po, hindi po ganito ang ang sinishade nyo. Alam nyo ba yon? Hindi ganito. Hindi ganyan. Hindi siya bilog-bilog. Alam nyo ba yon? Hindi siya bilog-bilog. Hindi siya bilog-bilog. Ganito ang nyo, pag-shade nyo sa board exam. Ganyan siya. Ganyan. Yeah. Tapos wala yung gitna. Wala tong gitna. Ito. Wala to. Ay, charot. Wala yan. Para siya nakaganito. Para lang may idea kasi may nagtanong Para nakaganyan siya. Yan. Ganyan ang board exam po. Okay? Ganyan siya. Yeah, hindi po ganito Para lang magkaroon kayo ng idea, parang hindi niyo pa Yeah, may training. Yeah, may training yan. Hindi ko lang sure ngayon kung may training pa ng Scantron. Okay? Kasi may nagtanong lang. Ilang oras binibigay per NP? 2 hours. Pero ang top rank ilang hours lang kayo nagsasagot? 1 hour 30 or 1 hour? Para masanay kayo. Okay, para masanay kayo. Kasi magugulat talaga kayo. May mga board exam takers 30 minutes pa lang tapos na. Okay, may mga board exam takers na 30 minutes pa lang tapos na. Yes. I've encountered that one sa room. Kasama ko sa room, taga PLM yun. Hindi ko makakalimutan kasi nagulat ako. 30 minutes pa lang tapos na siya ng NP3 or NP4. Hindi ko na matandaan. 2019 pa ako nag-boards. Yes. Pumasa ba siya? Yes or no? Feeling nyo, pumasa ba siya? Yung 30 minutes na nagsagot ng isang NP. Feeling nyo? Yes, pumasa siya. Pumasa siya. Yes. Sobrang bilis na magsagot. As in, nagulat ako. Sobrang bilis niya. Okay? Pero ako nagsasagot ako 2 hours. Natatapos ko yung 2 hours. Pwede po ba sulatan ng questionnaire? Yes. Pwede pong sulatan. Okay, pwede siya sulatan. Okay. Okay? Hindi ko din alam, bilis na magsagot. Okay? Take your time pag nagsasagot na exam. Okay, take your time. Anong ba yan, ang dami ko ano. Anong ginagawa kapag break ako, hindi ako nakikipag-usap. Hindi ako nakikipag-usap kapag sige, carry lang, hindi ako nakikipag-usap pag ang tawag dito. Kapag break. Ayoko makipag-usap pag nagbe-break kasi 1 hour per break. NP2 ay NP1 break 1 hour 'yon. NP2 break ng 1 hour. NP3 uwi. NP4 break ng 1 hour. NP5. B, hindi pwede bilhin pa uwi ang test paper man, B. Nakakaloka ka man. Hindi pwede, B. Okay? Oo, B, binabalik ang questionnaire po. 'Di ba? 75, yeah. Correction, ito yung common na ang tawag dito, dilemma. Pwede ba mag-correction? Pwede po ba magbura? Okay. Most of the lecturers sabi nila yes. Ay bawal. Mas maganda wag ka na magbura. Sabi nila. Pero ako kasi nagbura ako nung board exam. Nagbura ako nung board exam. Kasi alam kong tama yung sagot ko. Alam kong tama yung, nagkamali ako ng shading, so alam kong tama ako yung, as in 100% sure akong tama yung sagot ko. So rather than sure ako na mali yung sagot ko, dinilit ko siya. Tinanggal ko siya. Okay? Kasi ang dyan, ano bang tawag dito? Ang nangyari kasi niyan, ginawa namin, nung nag-Scantron, Scantron training kami. Sabi kasi ni Top Rank, same daw ng Scantron machine ang nasa Top Rank, pati nasa PRC. Ang ginawa namin, para nakailang tries ata kami, 3-4. Ginawa namin. Una, dire-diretsong walang bura. Yung pangalawa, tinry namin madaming bura. Yung score pa din namin doon sa Scantron training, 100 pa din. Okay, kaya yun yung namin. Yun yung ginawa namin dati. Nung nag-Scantron training kami, hindi ko alam kung meron pa din Scantron training. Para lang i-test namin kung kapag may bura ba, pwede, mali ba yung mababasa. Okay? Yun yung ko. 75, at least 75 daw. Pero hindi ko po alam kung paano po kino-compute yung board exam, ha? Hindi ko po alam kung paano kino-compute ang scores. Okay? Hindi ko alam kung paano kino-compute ang scores. Okay? The nurse assesses the... basta sure na borado. Yeah. Sabi din nila, highest and lowest daw yung naka-base. Sabi nila. Okay? Hindi po ako nag-top sa board exam. Isa lang po ako nakapasa. Okay? Isa lang po ako nakapasang estudyante na wala, pumasa lang. Yun. Okay? Nakapasa pa rin naman. 'Di ba? Wala naman nakalagay dito sa akin na board top notcher ako. Ang mahalaga naman at the end of the day, pumasa ka. 'Di ba? Yun yung mahalaga. Yes or no. Yun, naniniwala ako dyan. Promise. Naniniwala ako dyan. Parang, sabi nga ng kapatid ko, wala naman nakalagay sa noo mo, wala nakalagay sa uniform mo, wala nakalagay sa lisensya mo kung top notcher ka. Wala naman nakalagay. Pare-press lang naman tayo sa sweldo ng nurse. Diba? Pares lang naman tayo mababang sweldo. Totoo hindi. Maming kayo. Pares lang naman tayo mababang sweldo. Sabi ko nga sa mga estudyante ko, sa atin may mga board top notcher, ang liit ng sweldo. Sa ibang bansa walang board top notcher, pero 5 times ang sweldo natin. 'Di ba? 'Di ba? Kaya sabi ko nga sabi ko nga we aim for the best for us, which is to top the board exam. Pero pag nakapasa ka, hindi ka ba masaya kapag hindi ka nakapasa? Masaya ka na dapat, huy, buang kapag hindi ka nakamasaya na pumasa ka. 'Di ba? Yun yung ko palagi. Yun yung palagi ko sinasabi sa mga students ko. Pag pumasa ka, masaya ka. Hindi yung malungkot ka dyan kasi hindi ka top notcher. Yes, hindi ka nga top notcher, pero pumasa ka at the end of the day. 'Di ba? Okay, dito na tayo number 28. The nurse assesses the patient to determine the extent of injury. 'Di ba? Which of the following signs is a cardinal sign of your renal trauma? Kapag renal trauma, most probably meron kang letter dog. Ano ibig sabihin ng hematuria? Hematuria is ano ibig sabihin ng dugo sa ihi, blood sa urine. Yes, blood sa urine. Okay, blood sa urine. Letter dog. Okay, letter dog. Next. The nurse writes nursing diagnosis for the patient and stab wound. The most appropriate nursing diagnosis is, anong tamang sagot dito? Saan po ba nakatama ang ano mo? Kidney mo sa may lumbar abdominal area. Lumbar area, letter dog. Letter dog, lumbar area. Take note kapag, alam niyo naman siguro kapag nursing diagnosis po, always depend on the signs and symptoms ng patient mo. Okay? Always depend on the signs and symptoms ng patient po. Hindi po kayo magsasabi doon sa ano, sa kadalasan ang common error ng students medical diagnosis nagre-refer. Signs and symptoms ay magbe-base. Okay, signs and symptoms po. Okay? The physician prescribed your MRI of the both kidneys to confirm clinical suspicion and determine severity of the injury. Which of the following activities is the primary nursing consideration in preparing for MRI? Nag-NPO po ba kapag MRI? Yes or no? Nag-NPO? No. Okay? Ba't mo i-administer lahat ng medications? X to. Kailangan po ba lahat ng patient magse-sedate? Yes or no? No. Okay? Hindi po lahat nag-sedate, magre-require ng sedation. X to. Okay? Tama sana si ano? Si letter boy. Report findings of medical screening. Yes, dapat yan. Pero hindi kasi lahat ng pasyente sinesedate. Ang best answer mo is letter C. Okay, coordinate the MRI with other patient care activities and inform the patient about the test. Okay, letter C. Okay, letter C. Okay. Hindi rin siya wini-withhold kasi take note, administer all medications. Ibig sabihin to, lahat ng gamot na meron si patient, ibibigay mo. Okay? Usually, yes. Ang bata sinesedate, yes. Okay? Kadalasan, magsesedate tayo kapag claustrophobic yung patient. Okay? Kapag claustrophobic yung patient, bakit, sir? Kasi po yung MRI po approximately nasa 1 hour ka nasa loob ng tube. Okay? 1 hour yan, tapos malakas yung ano niya, yung tunog niya. Approximately 1 hour, ha? Approximately. So, ang tendency mag-increase anxiety nila, lalo na pag claustrophobic, kaya sila nagsesedate. Okay? Kaya sila nagsesedate. Ang tatandaan nyo pa, pag MRI, kailangan naka-position sila ng maayos, hindi sila gumagalaw. Okay? Hindi sila gumagalaw. Next. Nurse Ailes is a staff nurse in the oncology unit of a tertiary hospital. She reads a literature on anti-neoplastic medications. Nurse Ayla understands the importance of continuing professional development, which of the following is the main purpose of your CPD. 2, anong tamang sagot dyan? Plastika na sagot yan, B. Okay, ba't kayo nagsi-CPD? Ang tamang sagot dyan, kaya nagsi-CPD ay para ma-renew yung license, true or false? Para lang makapag-renew. Umamin kayo dyan. O, diba? Para makapag-renew. Pero pag mag-board exam, plastikan tayo ng plastic na sagot yan, letter apple. Update one's professional knowledge and competence. Diba? Hindi ko lang sure kung totoo, may utangan pa nga daw ng CPD units. Kumbaga, pwede ka mag-renew pero magkakaroon ka ng utang sa PRC. Sabi nila ganun daw. Hindi ko alam kung totoo. Diba? Hindi ko sure kung totoo yung ganun. Yung parang kung may ruling na ganun na pwede kang kumbaga para makakapag-renew ka pero may utang kang CPD units. Diba? May ganun. Kasi di pa ako nagre-renew ng lisensya ko, so wala pa, wapakils pa ako. Ngayong year pa lang ako magre-renew ng lisensya ko, so ngayon pa lang ako magkakaroon ng pake sa CPD units. Okay? Nurse Ayla, diba? Pero diba sabi nila, pag first renewal mo, kailangan mo na ba ng CPD units, yes or no? Diba? Hindi pa. Pag first renewal mo. Okay? Nurse Ayla reads the drug cyclophosphamide, Cytoxan, is given to the patient with breast cancer. Nurse Ayla understand that this drug is, ano kayong tamang sagot dyan? Tamang sagot, letter apple. Anong drug classification ng cyclophosphamide? It is an alkylating agent. Okay, alkylating agent. So ano siya? It is a cell cycle non-specific. Ito siya. Okay. Cell cycle non-specific could include your alkylating agents, anti-tumor antibiotics, hormonal therapy. Yung cell cycle specific mo is your anti-metabolic, your mitotic inhibitors, your topoisomerase, and your taxanes. Okay, nice to know lang po yan. Okay, nice to know lang yan. Pero take note yun din, matik may isang cancer na lalabas sa board exam. Matik yun. Sure yun, may isang cancer na lalabas. Di ko lang sure kung ano. Okay, may isang CD din yan. May isang CD din na lalabas. Communicable disease. Ang kakatapos lang, ano ba last year, tapos na yung rabies, tapos na yung cholera, tapos na yung dengue ang alam ko. Tapos na din yung dengue. In the recent 1 year ha. Last season kasi alam ko rabies ang lumabas. Rabies ba? O parang rabies. Ay, dengue. Dengue, rabies ata lumabas. Last year ng May ang lumabas cholera. Cholera yung lumabas. Ay, prior to that one, November yung rabies. Ngayon alam ko, ay leprosy pala. Leprosy ngayon November. Tapos nung May cholera, nung November 2021, rabies. Okay, so medyo, medyo ano na kayo dyan. Alam nyo na parang hindi po expected dyan. Pero aralin nyo pa din. Okay, aralin nyo pa din. So, mataas ang mga chances na lalabas na dyan HIV, pulmonary tuberculosis, ano yung mga expected na lalabas dyan. Okay, kasi tapos na yung cholera, pati yung leprosy mo. COVID may lumabas na. May lumabas ng COVID questions. Okay, may lumabas na. Last season din glaucoma lumabas din. So medyo di natin sure, most probably hindi yan lalabas. Okay? 33 is letter apple. Nurse Ayla reads that in the literature that the patient with breast cancer taking Cytoxan should observe the following. Given the case, what should Nurse Ayla instruct the patient to do? Ano po bang common? Common side effect niya. Anong pwede mag-cause? Kay patient na may Cytoxan or cyclophosphamide, pwede siya mag-cause ng ano kaya? Ano kaya? Possible na mangyari. Hemorrhagic cystitis. Very good. Hemorrhagic cystitis. So anong gagawin mo para ma-prevent ang hemorrhagic cystitis? Letter. Ano kaya siya? Letter dog. Okay. Increase fluid intake to 2,000 to 3,000 ml per day. Letter dog. Okay. Kasi cystitis. Sabihin nito, kiss mo na yung letter apple. Kasi hemorrhagic cystitis. And take the medication with food. Wala din naman siya sa context. Increase potassium intake while on medication, wala din siya sa context. Tatandaan nyo kapag Cytoxan, hemorrhagic cystitis, kailangan mo siya i-hydrate ng i-hydrate. Kailangan mo siya paihiin ng paihiin po. Okay, ang cyclophosphamide. Okay. Number 34. Nurse Ayla understands that patients receiving anti-neoplastic medication should do which of the following? Drink beverages containing alcohol in moderate amounts. I-recommend mo ba yun? No. No. Okay. Be sure to receive flu and pneumonia immunizations. Kailangan i-contact mo muna sa physician. Take aspirin. As for headache, bakit bawal mag-aspirin yung patient mo? Bakit bawal mag-aspirin ang patient mo na naka-anti-neoplastic medication? Bakit kaya? Kasi, di ba? Ang tendency ba nito, ang mga patient mo na merong nag-anti-neoplastic, mataas ba or mababa ang hemoglobin? Mataas mababa ang hemoglobin? Mababa. Mataas mababa ang WBC? Mababa. Mataas mababa ang platelet? Mataas mababa ang platelet count? Mababa din kasi meron silang bone marrow suppression. Pag nagbigay ka ng ASA, pwede ba mag-bleed na mag-bleed? Pwede ba siya mag-bleed na mag-bleed? Yes. So, ang correct answer lang dito is letter apple. Number 2 lang po. Okay, number 2. Okay. Number 35. An incident was described in the literature where a patient developed stomatitis. Okay. After receiving a course of anti-neoplastic medications, which of the following actions would be best for the nurse to do? Lemon, mahapde, yes or no? Mahapde. Kapag stomatitis, yes, mahapdi yan, B. Ayaw mo niyan. Hindi mo ba papakainin yung patient mo? Avoid foods and fluids. B, grabe naman, torture. Okay, brush teeth. Mahapdi po ba ang stomatitis? Yes or no? Diba? Yes, mahapdi yan, B. Masakit siya kapag natamaan ng toothbrush mo. And prone mag-bleed pa. Letter, tamang sagot dyan. Letter, dog. Letter, dog. Okay, letter, dog. 34 po is letter, apple. Letter, apple. Okay. Next. The head nurse of trauma unit produces changes to improve the quality of care of trauma patients. Okay. The head nurse presented a set of goals to the staff nurses. Which of the following goal is not relevant to improving quality of care? No. Ano kaya? Ano kaya dyan? Ano bang gusto mo kaya ka nag-improve ng quality care? Siyempre, ayaw mo ng merong pain or suffering. Waste of resources. Okay? Needless death. Sabihin niyan, ano, bigla ang pagkamatay, mga ganyan. Okay? Letter apple. Ayaw mo naman, di ba? Ang, kumbaga ba, ang sagot, ang ano dito, kung bakit ayaw mo, kaya ka lang ba kaya ka lang ba gusto mag-improve yung quality of care para ma-prevent ang legal suits? Di ba hindi? Okay, needless death, yung mga biglaan mga pagkamatay na magugulat ka na lang. Okay, yung mga biglaan. Okay, for example, ano, yung patient mo na admit lang for cholecystectomy. Tapos namatay siya kasi severe hypoglycemia kasi nakapag-IV push ng insulin. Parang ganun. O kaya nakapag-IV push ng potassium. 'Di ba? Yun ang ano mo, needless death. Okay? So letter apple. Okay, letter apple. Next, 37, the head nurse review and reports on staffing. The following findings result to a better patient outcomes except a higher, tamang sagot kaya dito. A higher nurse-patient ratio shorten the length of, yes, 'di ba? Na hindi naman mag-gets ng government natin, yes or no. 'Di ba? Higher nurse-patient ratio results in the reduced mortality. Yes, 'di ba? Pag mas magandang nurse-patient ratio mo, mas better. Okay? Tamang sagot dito. Letter dog. Feeling nila kasi kapag mas mataas ang ang nurses, ang number of nurses, ano ba mangyayari? Increase ang bayaran ng hospital, which is hindi, 'di ba? Kapag mas konti ang nurse kasi, mas prone ba sa error to, yes or no? Mas prone, yes, na to be honest, hindi rin mag-gets ng ng government itself kung bakit, 'di ba? Akala nila kapag mas mataas ang pay ng nurses, mas mataas yung yung babayaran ng hospital or ng government. Hindi nila ma-realize na kapag pangit ang staffing mo, 'di ba? Ano mangyayari? Mas prone ba sa error? Yes, 'di ba? Kaya nga dapat nasa ideal tayo, 'di ba? 'Di ba? Nasa ideal tayo. Ano bang solusyon ng government diyan? Capping. 'Di ba? Nurse capping. Ang sabihin ng nurse capping, yan yung may number of nurses lang na pwedeng pumunta sa ibang bansa. 'Di ba? May number of nurses lang for. Hindi ko lang sure kung anong maximum, parang nasa 1.5. Hindi ko sure kung true 'yun. Pero 'di ba nurse capping ang ginagawa nila, hindi nurse salary increase, 'di ba? The head nurse determines to reduce medication errors in the trauma unit. She recognizes that medication errors often occur in relation to the following except, tamang sagot kaya dito. Preparing the wrong concentration, yes, common to. Saan common yung preparing wrong concentration? Ibig sabihin maling dosage ng gamot sa pedia patients yan. Okay. Failure to question unclear medication, yes. Lack of knowledge about medications, yes. Kaya dapat ba expert ka sa pharmacology, yes or no? Yes. Okay, kahit alam mo lang indication ng gamot, okay na yan. Hindi na yung mga super specific. Okay, super specific. Letter dog. Okay. Sabi ko nga sa mga bagong nurses palagi, kailangan alam nyo yung gamot kung para saan pag nagbibigay kayo ng gamot. Okay? Palagi yun. Uso naman si Google ngayon para alam nyo kung para saan yung gamot na yun. Okay, to reduce the error. The head nurse suggests that to reduce medication error, several measures will be instituted. Which of the following is the most appropriate? Ano kayang tamang sagot dyan? Letter 38 po is letter dog. Letter, anong best answer dyan? Letter apple. Ano po ba yung use of point of care to access drug reference information? Ang point of care technology kasi, ito siya yung parang online or para siyang electronic kung saan mamamonitor mo kung ano yung mga gagawin kay patient. Documentation nandun na din. Parang siyang electronic management record. Okay? Kaya letter apple ang best answer dyan. Kasi makikita mo doon kung ano siya ibibigay, mas madali mo din ma-search kung ano indication ng gamot. Okay? Kaya letter apple. At the same time, kapag gumagamit ka ng point of care technology, makikita mo din doon kung paano dilution, paano tamang computation ng mga gamot for patient. So letter apple. Okay, letter apple. Okay, letter apple. Number 40. The headers is aware that managing and improving quality care in the trauma unit requires which of the following? Personal attention to the patient needs and their families. Yes, di ba? Personalized care ang kailangan mo dyan. A blame-free environment. Gusto nyo ba yun yung blame-free environment? Yes, okay. A clean and orderly trauma unit. Yes. Okay. Letter cat. Madaming ganyan sa board exam na tanong. Yung mga almost pamigay. Okay, almost pamigay na tanong. Madaming ganyan. Madami din namang tanong sa board exam na hindi talaga kayo completely familiar. Okay, hindi talaga kayo completely familiar. As in, wala kayong idea. Okay, a good example ay ito. Scleroderma. Alam niyo yung scleroderma? A nurse Maria is attending nurse of a 40-year-old female admitted in the medical unit with a probable diagnosis of scleroderma. Okay? The patient complains of pain in their fingertips and pallor, followed by blanching of the extremities and redness. Nurse Myra knows that these symptoms are characteristics of which of the following disorders. Kapag swan neck deformity, ano yan? Kapag swan neck. Ano siya? RA. Kapag symmetric polyarthritis, RA. Ano to? Symmetric po, symmetric. Pag symmetrical ay ano? RA. Okay? RA. Wait lang. So anong tamang sagot dyan? Ang sagot dyan? It's your letter boy. Okay, Raynaud's phenomenon. Ano yung tsura niyan, sir? Di ba? Tingnan mo. Fingertips pallor, tapos magkakaroon ng blanching of the extremities, and then redness. Ganito siya. Okay, pallor muna. Magto-turn into blue, then magkakaroon ng redness. Okay? Ganyan ang Raynaud's phenomenon. Okay, ganito po ang Raynaud's phenomenon. Ano po ba, sir, kapag scleroderma? Okay? Kapag scleroderma, tatandaan nyo lang yung mnemonics na crest. Okay? Na-screen cap nyo na ba yan? Screen cap nyo muna. Ito siya, tatandaan nyo kapag scleroderma. Calcinosis, which is the calcium deficits in the skin. Raynaud's phenomenon, spasm of the blood vessels in response to the cold stress. Esophageal dysfunction, acid reflux, and decrease in motility of esophagus. Sclerodactyly thickening and the tightening of the skin on the fingers and hands. Hindi ko alam kung paano i-mention yan. Dilation of your capillaries causing red marks on the skin surfaces. Okay, screen cap nyo muna. Okay? Okay? Sabi sa akin, pagdaan na. Done na. Next. Nurse Myra assesses the skin of the patient, which phase of the skin occurs first and are usually painless and symmetrical. Tamang sagot. Ano yung tamang sagot? Letter dog, edematous. Ano yung second phase? Ano kayong second phase? It's your... Ito siya. Ito na. Okay, ito na yung phases mo. Okay? Manifestation number 1, edematous. Magiging indurative and then atrophic. Again, edematous, indurative, and then atrophic. Dami sa kapag done na. G. Okay. So, nurse, di ba, nagsabi nga, most probably edematous yan. Edematous. Nurse Myra writes a nursing diagnosis for the patient. Which of the following is a priority nursing diagnosis? Oh, edematous. Kapag edematous, anong problem mo? Anong possible problem mo? Skin problem, yes or no? Skin, yes. Anong tamang sagot dito? Letter boy, impaired skin integrity. Okay, impaired skin integrity. Nurse Myra assists the patient in coping with the disorder during the early stages of your chronic disease. Kapag chronic disease, okay, most probably may impact ba yan sa buhay ni patient, yes or no? Most probably meron bang impact yan? Yes. Patient tend to focus on which of the following behaviors. Anong tamang sagot dito? Pwede ba magbago yung buhay mo kapag may chronic disease ka? Yes, magbabago yung lifestyle mo. Letter O, yan yung focus na impact of lifestyle changes. Diba? Letter boy. Okay, letter boy. On number 45, Nurse Myra prepares discharge plan for the patient. Which of the following is the most following objectives are most appropriate? The patient should, number 1, di ba? Try to prevent breakdown of the skin ulceration. Yes, tanggal to. Okay. Avoid activities that trigger pain. Avoid activities, yes. Okay. No. Modify to include legumes. Ang legumes mo ba gas forming, yes or no? Gas forming? Yes. Di ba may esophageal dysfunction ka nga? Di ba may esophageal dysfunctions ka? So, X na agad si legumes mo. Tanggal si letter B. Tanggal si letter apple. Correct answer is letter C. Okay, letter C. Okay. Nurse Belen is a manager of a trauma unit. She supervises the staff nurses and regularly holds conferences with them and other unit personnel. In one of the meetings, she orients the staff nurses on their various functions. She cites clinical situations related to the nurses' dependent, interdependent, and collaborative function. An interdependent function of a nurse is when the nurse, ano kayang tamang sagot dito? Letter apple, irrigates the feeding tube that appears obstructive. Ano ba yan? Pwede mo bang gawin yan without doctor's order? Yes or no? Yes, pwede. Diba? Apply a dry sterile dressing to an abdominal incision. Pwede mo ba gawin yan? Yes. Okay. Helps a client choose food-rich protein from an ordered diet. Yes. Diba? Ang tamang sagot dito is letter boy. Give eye-ships to a client who has an order of NPO. Bakit, sir? Ang interdependence, tatandaan nyo lang, cooperate together. So yan, cooperate together to accomplish what we want. Okay? Sabihin yan, parang you are compromising. Okay? You are compromising. For example, di ba NPO na nga yung patient mo? So, bawal na ba siya kumain? Yes or no? Yes. Diba? Bawal kumain kapag NPO. Pero magbibigay ka ng ice chips to compromise. Ibig sabihin to compromise, you meet halfway. At the same time, papaalam mo din to kay doktor. Para meet halfway tayo, para accomplish natin kung ano bang gusto natin. Binigyan kita ng ice kahit NPO ka, hindi mo naman siya lulunukin. Para lang ma-moisten yung mouth mo. Okay, that is what we call your interdependent. That's what you call your interdependent. Number 46 is letter, boy. Letter boy. Next, a nurse decides to give a partial bath to a client instead of complete bath. The nurse is working kapag ganyan. Ano kaya yan? Papaliguan mo yung patient. Kailangan pa ba ng doctor's order yan? Yes or no? No na. Diba? Ano yan? Independent nursing function po ba? Yes or no? Yes. Letter Apple. Independently mo siyang ginagawa. A nurse works with a skincare team. The nurse is functioning. Kapag skincare team, sabihin ito, madami ba kayong kasama dyan? Yes or no? Madami? Yes, it is collaborative. Okay, collaborative yan. Okay, collaborative. The nurse initiates a visit from the member of the clergy for a terminally ill client. The nurse is functioning as win-win situation yan. It's letter Apple. Interdependent. Hindi kasi siya collegially. Hindi siya collegially. Independent kasi ikaw gagawa. Hindi ka naman clergy. Hindi ka naman clergy, be. 'Di ba? Hindi ka naman Ang interdependent, 'di ba, you go for a win-win situation. Okay, you go for a win-win situation. Ang collaborative, ibig sabihin to referral. Kumbaga siya collaborative. Kung wari tatlong healthcare professional, for example, stroke patient mo, sino ba nag-collaborate kapag stroke patient? Doctor, si nurse. Pwede po ba si PT kapag stroke patient? Yes, pwede yan. Pwede po ba si occupational therapy? Yes, kaya siya naging collaborative. Okay, number 50. When a nurse uses straight catheter to obtain urine specimen for laboratory test, the nurse is functioning as what? Anong tamang sagot niyan? Pwede ka ba mag-catheterize ng patient? Yes or no? Pwede ka ba? Na-train ba kayo mag-catheter? Yes, na-train tayo mag-catheter, 'di ba? So you are doing it independently. Okay, independently. Letter C. Okay, train tayo mag-insert ng Foley catheter po. Okay. The nurse assists in the care of female clients, Jaira, is a 35-year-old woman with hyponatremia. According to the client, she is taking diuretic medication. Diba? Which of the following statements is true about hyponatremia? Diuretics may produce small quantities of urine. Yes or no? 44 po. Ang layo ng 44. Small quantities of urine, large quantity. Large. Diba? Large yan. Okay, X to. Hyponatremia because of excessive fluid diluting the potassium. Wala namang minasyon na potassium dyan. X, letter boy. Okay. Serum sodium determined above 135. Ano po ba normal level ng sodium? 135 to 145. Okay? So kapag above 35, normal ba yun? Yes, normal yun, B. Normal to. Anong tamang sagot? Letter dog. Yeah. Pwede naman. Yeah, pwede siya. Okay? Lalo na kapag magko-collect ka lang naman ng ihi. Okay? Next. In assessing the client should focus on which part of the following? Ano kaya? Spiritual state of the client. Meron po ba? Spiritual state. May nakasabi po ba sa situation? Yes or no? No. X. Diba? Diagnostic to be done in the client. Assessment ka pa lang naman. Assessment. So, hindi pa yan. Physical signs and symptoms, that is too broad. Okay, too broad. Bakit? Pwede po ba mag-seizure ang patient na may hyponatremia? Yes or no? Yes. Okay, pwede kasi yan biglang mag-seizure. So, pwede din po ba magkaroon ng disorientation ang patient na may hyponatremia? Yes. Okay. Yes yan. So, letter dog. Okay, letter dog. Oh. So dito, i-base mo yung sagot mo sa number 53 sa number 52. Anong tamang sagot dito? The nurse write a nursing diagnosis. Which of the following is appropriate? Diba? Tandaan nyo, kadalasan kapag hyponatremia, central nervous system ang natatamaan dyan. Okay? Again, kapag hyponatremia, isa sa mga common manifestation mo is yung central nervous system. Pwede siya mag-cause ng personality changes, seizure, and confusion. So, letter apple. Okay? Central nervous, decrease or disturbed thought process. Okay? Disturbed thought process. Apple. Number 54. The client has serum sodium of 115. A priority nursing intervention for the nurse to letter dog. To, ano kaya? Di ba sabi natin, pwede ba mag-seizure kapag hyponat? Yes or no? Yes. Letter boy. Take precautions on the occurrence of your seizure. Seizure. The nurse is much aware that the client is receiving D5 water at 100 ml per hour. Is most at risk of developing which of the following conditions? Di ba hyponatremia na nga magbibigay ka pa ng D5 water? Anong tendency niya? Mas lalo ba mag-hyponat si patient? Pwede ba mas lalo magkaroon ng delusion? Yes. Magpa-further delusion ba to? Yes. So anong tamang sagot dito? Ang tamang sagot dito, letter apple. Hyponat. Mas lalo magkakaroon ng further delusion yan. Okay? Kasi D5 water, wala namang sodium containing ang D5 water mo. Okay? D5 water, isotonic, hypertonic. Isotonic, hypertonic solution. It is isotonic. Isotonic. The only D5 containing na isotonic. Diba? D5-NSS. Isotonic, hypertonic. Hyper. D50 water. Hyper. Lactated. Plain LR. ISO. Plain NSS. Okay. D5-NSS. D5 NSS hyper. Yung D.3 NSS. O yung D.45 NSS. Hypo. Okay, hypo. Okay. Nurse Frances assists in the care of female patients with coronary artery disease. She schedules the time to educate this group of women about your coronary artery disease. 54 is letter boy. Okay, a correct statement about CAD is in women is that, anong tamang sagot dito? Letter dog, yes po. Kasi po, as you grow old yung female, mas dumadami yung mas higher yung chances nila CAD. Okay. Letter dog. Pag yung mga ganitong sagot, mahirap siya kasi you would research talaga. Okay, pero common ang tawag epidemiology, statistics sa board exam. Okay, research indicates that women with CAD needs to exercise or to decrease risk of having CAD. Which of the following exercises is recommended? Ano po bang recommended? Ilang minutes per week? Ilang minutes per week ang recommended? Per week. Per week, at least 150 minutes. Again, at least 150 minutes. In a light to moderate physical activities. Anong tamang sagot dito? Letter apple. Isabihin niya, total ng 150 minutes po ang kailangan. 30 minutes 5 times a week. Letter apple. May letter apple. Next. Nurse Frances give information about the blood pressure in women. Which of the following is correct? Ano po ba yung mga risk factors? Weight po ba? Risk factor po ba siya? Yes or no? Or may affect the blood pressure? Yes. Di ba? Age. Pwede po ba ang age? Yes. Okay. Oral contraceptive ba? Nakakataas ba ng blood pressure? Nakakataas po ba? Yes, nakakataas ng blood pressure ang oral contraceptive. Anong tamang sagot? Letter dog. Letter dog. Weight, age, and oral contraceptives used to affect their blood pressure. Okay? Hypertension affect CAD risk as women age. Okay? Higher blood pressure. Di ba? High blood pressure is twice as common as oral contraceptive users. Mas mataas ang chances mo. Okay? Hala ka, ano yan, ma'am? Galit yarn. Okay? Charot lang. Okay, next. Number 59. Nurse Francis explained the stress can be managed by which of the following? Ano kayong best answer dyan? Siyempre, gusto mo mababa or mataas yung stress level mo? Ano gusto mo, mataas or mababa? Manageable, di ba? Manageable siya. So, tanggalin mo na to si high stress level. Gusto mo ba ng constant stress? Yes or no? No, ayaw mo ng constant stress. So, gusto mo may high control ka na meron low stress level. Eh, kamusta yung stress level nyo ngayon sa board exam? Mataas, mababa? Sakto lang. Increased. Okay. Eh, yung control nyo, kamusta control? Sakto lang, sir. Ewan ko na lang po talaga itong mga to. Okay. Natutulog pa ba kayo? Yan yung palagi ko tinatanong sa mga students, natutulog pa? Medyo, minsan. 4 hours. Sarap kaya matulog. Dapat minimum 8 hours. True. Diba? Minimum 8 hours of sleep. Alam mo na. True yan. Uy, wag 2 to 4 hours. Masakit sa ulo. What's tulog? Uy, masaya kayo matulog. Okay? 70 days na lang daw before the board exam, sabi ni Mama. Nurse Francis explains that stress can be managed by which of the following? Anong tamang sagot dyan? Spiritual meaning, di ba? Kapag stress, hindi yan. Okay? Taking prescribed medications, di ba? Mas maganda kasi mag-letter dog reflection. Okay? Reflection on your condition and accepting. Ibig sabihin ito, nagkakaroon ka ng self-awareness. Okay, mas maganda magkakaroon ka ng self-awareness. Letter dog. Ay, letter dog. Tapos sila natin itong isang situation, tas lunch break na. Okay. The nurse assists in the care of a female client, 45 years old, admitted for severe pain related to cancer. In relieving pain, most related to cancer, which of the following nursing action is most appropriate? Or relieving pain, hindi ka naman po mag-a-assist, di ba? So letter apple, tama or mali? Mali kasi assessment to, di ba? Yes or no? Assessment to. Okay. Allow the client to stay in one position to prevent occurrence in pain. Di ba? Parang hindi naman siya ganun ka-ano. Place hand bedroll to the client's back. Hindi rin naman. Ang best answer dyan is letter cat. Apply heat and cold in the areas that are painful as prescribed by the physician. Letter C. Okay, letter C. Number 59 is letter cat. Okay? 62. A client has tunneled epidural catheter to control the pain. The catheter site should be assessed every shift by the nurse on duty, which of the following indicates catheter migration or tissue trauma. Anong tamang sagot dito? Direct answer to letter cat. Okay? Bright red bleeding, fluid under the dressing, and pain, and with loss of pain control. Sabihin na fluid collecting under the dressing, sabihin na tanggal talaga siya, nag-dislodge. Okay, nag-dislodge siya. Okay, letter cat. Okay, letter cat. 62 is letter C. 61 is letter cat. Okay? Ito tayo. If the catheter becomes disconnected from the tubing, the nurse should use which of the following solutions to clean the tubing or connectors? Anong tamang sagot dito? So, matik malito. Matik malito. Okay, ano sa alcohol or povidone iodine solution? The correct answer is letter boy. Okay, alam nyo ba yun kapag magka-IV catheter insertion, dapat ang nilalagay mo ng povidone iodine or povidone solution? Ay, chlorhexidine to be specific. Chlorhexidine, hindi na alcohol. Chlorhexidine na. Alam niyo ba yun? Chlorhexidine na ang pag nag-IV insertion kayo, chlorhexidine na, hindi na siya alcohol. Ang recommended. Okay, chlorhexidine na po ang recommended. Okay, di ba? Okay, next. Ay, naging teacher niya si Sir Lian. Akala ko niya siya. Lahat ba kayo naging ano niya si ano? Sir Lian, si Kuya Lian. Lahat kayo naging lecturer si Kuya Lian. Hindi ko kasi alam kung saan si Kuya Lian eh. Ay, yes, ano pa rin pala siya. Pero hindi na siya pure ano no, pure lecturer. Dati kasi full-time siya dito. Okay. The nurse instructs the client to report if she experiences signs and symptoms of your local anesthetic toxicity, which includes the following. Ano sagot nyo dito? Ito yung mga common signs and symptoms or common na toxicity mo. 'Di ba? Ito siya. Ito. Ayan. Ay, charot. Ba't death yung lumabas? Ito siya. Ayan. Agitation, confusion, dizziness, drowsiness, dysphoria, auditory changes, tinnitus, oral numbness, metallic taste, and dysarthria. Pero pwede din yan mag-lead to your seizure, respiratory arrest, or coma. Okay, pwede siya mag-progress. And the correct answer is letter boy. Okay, letter boy. Letter boy. All of the options. Number 64. 65. The client describes as knife-like chest pains that increases intensity on respiration. Which of the following symptoms is most likely its origin? Ano kayang tamang sagot dyan? Letter apple. Okay. Kapag gastrointestinal ang manifestation, ano most probably? Kapag pain na gastrointestinal, ano yung mga common? Kapag gastrointestinal, common dyan, cramping pain, tsaka dull pain. Okay? Dull pain. Kapag cardiac, ano common manifestation kapag cardiac? Ano? Crushing, very good. What else? Pressure, crushing pain. Burning ba pwede? Burning pwede yan. Tsaka tightness. Okay, tightness. Ang sharp pain, pwede din naman sharp pain sa ano? Sa cardiac. Pwede naman siya sa pulmonary. Okay, the correct answer is letter apple. Okay? O, lunch break muna tayo before mag number 66. Okay, balik kayo ng 1 p.m. Okay? Uy, lunch break, balik na ng 1 p.m. Okay, thank you so much. Have a nice lunch. Happy lunch. Hello. Good afternoon. Good afternoon po. Hello po. Kamusta? Kamusta? Busog? Masarap matulog ba? Hmm. Ang init, no? Di ba kayo nainitan? Ang init. True or false? Init, no? Sarap ano? Sarap matulog. Sobrang init. Sarap tumapat sa aircon. True. Di ba? Sarap tumapat sa aircon. Hello po. Hi, sir. Sir ward clerk ka, di ba? Ikaw yung ward clerk. Oh, di ba? Assign ka na sa amin. Okay, kilala kita, sir. Don't worry. Okay. Start na ba tayo? Okay, let's start na. So, fresher. Grabe sila. May questions pa ba kayo so far? Questions, violent reactions. Normal talaga yon na magkaroon kayo ng violent reactions sa mga, lalo na pag yung mga what is the most, yan, common, dami nagkakaiba ng sagot talaga. Okay? Oh, let's go na. The hospice nurse cares for a 60-year-old female client with terminal illness. Okay, to provide holistic care. The nurse assists the client in meeting spiritual needs. Okay, take note po, spiritual needs siya. Okay, which of the following therapeutic nursing interventions addresses the spiritual needs of the clients with terminal illness? Okay, spiritual needs. Ano ba yung spiritual needs? You will, hindi man ka, you would pray with the client. Letter dog. Diba? Spiritual needs kasi siya. Ano ba dito yung spiritual needs? Yung pray with the client lang ang pinaka-spiritual needs dito. Letter dog. Okay. Number 67. As death approaches, the nurse provides invaluable support to the family. Other support people for the family includes the... Anong tamang sagot kaya dyan? Ano kaya? O, tingnan nyo to. Nandun kasi kanina, di ba? Nandun kanina is spiritual needs. So you would go for your letter. Context is letter boy, spiritual advisor. Okay, letter boy, spiritual advisor. Siyempre, hindi ka po na muna pupunta ng funeral doctor, director. Yung social worker, pag yan, para saan ba social worker? Kadalasan sa mga bills. Okay, yung mga bills ang social worker. O kaya, ayan, bills. Since dying naman yung patient, bills ang kailangan mo dyan. Kung wari, hindi sila makabayad ng mga bagay-bagay. Si social worker yan. Okay? 68. The client is experiencing dyspnea which is causing the client to be anxious. The nurse plans holistic approach of care for the client. The nurse should, anong tamang sagot kaya dito? Ano kayong pinakamagandang sagot? 66 is letter dog. Letter dog. Ano kayong pinaka-best answer dito? Secure an order, liberal doses of anxiolytics. Di naman, diba? Morphine, wala din naman siya. For pain kasi ang morphine mo. Di rin to. Okay? Anxiolytics ang kailangan mo. Diba? The best answer is letter boy. Allow the family to stay with the client. Letter boy ang best answer dyan. Okay? Letter boy. O, number 69. The hospice nurse assists the family to establish a relationship with the healthcare team by... Ano kayong tamang sagot dyan? Healthcare team. Para naulit na tong tanong kanina, no? Naulit na siya. Para naulit na siya per other context. The correct answer is letter C. Explain the roles of your interdisciplinary team members involved in the care of the client. Okay? In the care of the client. So letter cat. Okay, letter cat. 68 po is letter boy. Boy. Okay? The nurse assesses the client whose condition is deteriorating. A cardiovascular indicator of imminent death is, ano kayong tamang sagot dito? Nasagot na din to kanina. Ano kaya? Nasagot na din to kanina. Diba? Ano ba mas imminent sa'yo? Kapag mamamatay na yung patient mo, fluctuating. Ano sabihin ng fluctuating? Ano sabihin ng fluctuating up and down of your blood pressure? Eh di ba kapag imminent death na siya, ibig sabihin mamamatay na siya, ano most probably yan? Most probably decreasing blood pressure na siya. Diba? Decreasing blood pressure na siya. Irregular heart rate, diba? Irregular heart rate, sobrang broad niyang concept. Okay, sobrang broad niya. Okay? So ang best answer dito, anong best answer? A or B? Imminent death, mas? Ano kaya? Ang late sign mo dyan, ang late sign mo most probably kapag bradycardia na yung patient mo. Sabihin niya hindi na nagpa-pump ng maayos. Letter boy. Okay? Letter boy. 'Di ba? Ano ba 4 main characteristics mo kapag imminent na yung death? Opo, mali po talaga sa form. Yes. Okay, ano ba yung mga mo? Loss of muscle tone, 'di ba? Slowing circulation. Ano ba yung diyan? Cue na slower na yung circulation mo, bradycardia, 'di ba? Changes in respiration. Ano yung mga example ng changes in respiration? May episode na ba siya ng apnea? Yes or no? Yes, pwede na may na yan. Pwede nagkaka-episode sa ng apnea yung patient mo. Bradypneic na ba yun? Yes or no? Yes, expect mo medyo bradypneic na yan si patient mo. Okay? So ang best answer dito is letter boy. Letter boy, bradycardia. Okay? Next number. Charot. Situation, Nurse Kevin is a nurse manager of a surgical unit. He applies principles of resource management to improve the client care in the unit. Okay? Nurse Kevin supervises 4 nurses in the surgical unit with 40 clients in various stages of care. 10 clients are receiving preoperative care, 5 are ambulatory and ready for discharge, 10 are scheduled for major operation, 5 are recovering from operation, and 10 clients are in rehabilitation. Nurse Andy applies the concept in resource management, which makes a choice among individual competing from scarce resource. Ano kayang tamang sagot dito? Kapag ganyan, take note, kapag scarce resource, ibig sabihin yan, magkakaroon ka ng, ano kaya? So, wala ka namang problem dyan. So, it's not a resolution. Diba? Technical application, more of sa mga equipments to. Sa mga equipments to, the best answer is letter Apple, rationing care. Okay? Ibig sabihin nito, limited lang yung number of nurses. Tapos, magte-take ka ng, para ba magko-compromise ka. Okay? Ang scarce resources dito is your number of nurses. Diba? So, ang gagawin mo dyan, proper allocation. So, rationing care ang gagawin mo siya. Letter Apple. Okay, letter Apple. Next, 72. Nurse Kevin applies an essential element in resource management in a surgical unit, which is, ano kaya yan? O resource management, magma-management ka, ano kaya ang pinakamagandang dapat gawin mo? It is your, diba? Ang effective communication, more of, conflict resolution, yan siya. Diba? Hindi siya. Pares lang to si A and letter C. Okay, so we would go for A, B, or D. The correct answer is organization kasi resource management ang pinag-uusapan dito. So letter dog, organization. Okay, resource management, ibig sabihin ito, it's either most probably human ang inaano mo dito. Human ang pinag-uusapan po dito. So it's organizational skills. Letter dog. '73. Nurse Kevin participated in budget preparation for the unit. Which of the following terms refer to the salaries and cost supplies of the equipment? So, X po agad si cost-benefit analysis. X din to si cost center kasi dalawa lang naman ang cost mo dyan. It's either direct cost or indirect cost. Okay? Tandaan nyo, kapag direct cost, ano laman yan? Most probably salaries of the personnel, clerical supplies, yan yung mga yan. Ano naman sir ang indirect cost natin? Ang indirect cost natin, it would include for the advertisement of nursing position, tsaka yung mga housekeeping ng sabihin nito yung mga external na, kumbaga maintenance of the public area sa hospital. So anong tamang sagot dito? Ano kayong tamang sagot dyan? Letter based on the letter boy. Okay, letter boy, direct cost kasi nandiyan yung salaries of the personnel and clerical supplies. Okay, yan yung difference silang dalawa. Okay, done na po kopyain. Opo. Next. Nurse Kevin explains the concept of resource management to his staff. Which of the following is true about resource management? Sorry. Ano kaya? Evidence-based nurse practice ba to? No. Okay, hindi siya evidence-based nurse practice. Okay, controlling the environment? No, 'di ba? Hindi siya. Applying management? No. More of the cost. Okay, more of the cost. Resource management, letter dog. Okay, controlling the rising cost of healthcare while providing quality care of the clients. Letter dog. Next. 75. Nurse Kevin participates in recruiting. Okay, recruiting and retaining staff and other personnel. So hindi lang nurses. This is an example of what type of resources. Ano kaya yan? Letter? Siyempre, human yan. Human resources. Okay, human resources. Itong financial resources, ito yung siyempre yung mga major stockholders mo. Okay? Financial resources, ito kung saan ba nanggagaling. Yung mga pera. That is your financial resources. Okay? Material resources, ito yung mga saan ba nanggagaling yung mga for example, supplies. Supplies ng okay, medical equipment. That is your material resources. Okay? Pero ito kasi, recruiting and retaining nursing staff. Okay? Kapag staff, matik yan, human resources. Okay? Human resources. Okay? Linaw po? Opo. Okay. Next. Situation. A 45-year-old male is admitted for a productive cough with thick yellow, sputum, and shortness of breath. Sputum production, common po ba sa sa may COPD, yes or no? Common po ba sa kanila yan? Yes. Okay. Shortness of breath, common. Expected or unexpected ang shortness of breath kapag COPD ka? Expected. Very good. Expected yan. With according to him, increasingly progressed for the past 4 weeks. Okay? For the past 4 weeks. Based on the information gathered, the nurse formulates a nursing diagnosis of what? Ano kaya? Ang cues mo about sa pag-ubo, about sa sputum. So most probably magsi-self-care deficit ka ba? Hindi. Kasi ang self-care deficit, most probably kapag self-care deficit, yung pagligo, pagkain, yan yung self-care deficit. Activity intolerance, ibig sabihin nito yung paglalakad, most probably kapag activity intolerance, paglalakad. Diba? So letter boy, ang best answer dyan. Ineffective breathing pattern related to the shortness of breath and productive cough. Okay, letter boy. Okay. 77. Well, productive cough naman eh. May nagtanong, ba, sir, kapag ganyan ineffective airway clearance ba siya? Productive cough siya. Nadadahak ba niya yan or hindi? Magiging ineffective airway clearance lang siya kapag hindi niya unproductive yung cough niya. Ibig sabihin hindi niya nalalabas na maayos. Productive cough, ibig sabihin nalalabas na maayos yung sputum niya. Okay? Okay. Next. The nurse writes a nursing diagnosis which is the basis for the care of the patient. Which of the following is an expected outcome for the client? Tandaan nyo kapag ganyan, kabaliktaran lang ng nursing diagnosis no yan. Okay? Kabaliktaran lang yan ng nursing diagnosis mo. Okay? Kabaliktaran lang yun. The correct answer is letter apple. Okay, improved breathing pattern. Di ba nga nagkaroon nga siya sa letter boy, ineffective breathing pattern. Okay? Kabaliktaran lang. Kadalasan, natandaan nyo, ang nursing diagnosis nyo ay kabaliktaran niya yung outcome. Yung outcome nyo. Okay? Achieve airway clearance kasi productive cough naman siya. Wala naman siya na unable to expectorate the sputum. Diba? Wala naman siya nakalagay na ganun. Okay? So most probably, nalalabas na yung sputum na meron siya. 78. The nurse needs an article on risk factors of COPD, which include environmental exposure or host factors. Which of the following is most important environmental risk factor worldwide? Ano kayang tamang sagot dyan? Letter, ang possible talaga, ang greatest risk factors when it comes to your smoking, ay to your COPD, smoking. Letter apple. Okay, letter apple. 76, ay 78 is letter apple. Okay. 78. The nurse perform an assessment on the patient. Which of the following action is a priority by the nurse? Schedule the patient for spirometry. Wala pa naman. Diba? Wala pa to. Assess the level of pain. May pain ba kayo nakikita dyan? Yes or no? May pain po ba sa context niya? Yes or no? Wala po. Okay? Eh yung mga cues ba niya, expected or unexpected yung mga cues niya? Expected niyo ba yung mga cues niya? Expected niya. Diba? Anong i-refer natin sa physician? Diba? Wala tayong i-refer sa physician. Gets ba? Wala tayong i-refer kasi expected yung shortness of breath niya, pati yung ano niya, production ng phlegm niya. Diba? Anong best answer dyan? Letter? Boy. Okay, obtain thorough health history. Bakit? Eh kasi, expected yung yellow sputum niya tsaka shortness of breath. Diba? Maling as a form. Okay, expected nga yung shortness of breath, pati yung thick yellow sputum. Okay. Performs assessment. Performs assessment. Okay. Performs. Ibig sabihin niyan performs. Sabihin present tense yan. Okay. Performs assessment. Sabihin present tense yan. Sabihin ginagawa ba niya yan? Yes. Okay. Kailan ka ba magre-refer? Kapag may unexpected ka, may unexpected po ba sa cues mo? Wala. Diba? Kapag unexpected, abnormal. Diba? Obtain thorough assessment kasi nga, taalamin mo kung bakit siya nag-progress or at least hindi progress yung shortness of breath na pati sputum production. So letter boy. Okay? Letter boy. Okay? O number. Question. May question ba? May hindi ba malinaw? Okay? Okay, next. The nurse recalls reading a research article on burden of lung disease. The findings revealed that the women in rural areas are also vulnerable to lung disease from inhaling ethanol or gases from the charcoal and wood fire. The study is best described as, tamang sagot kaya dyan. Letter, ano kaya? Letter C. Okay, quantitative. Tatandaan nyo lang, kapag quantitative, more of ano yan? Ang inaanap mo kapag quantitative is more of yung para ka nagde-derive ng isang conclusion. Si qualitative mo, more of why ang sinasagot mo dyan. Bakit ganyan? Bakit ganon? Bakit ganyan? Okay? Pero kasi mapapansin mo dito, women in rural areas are also vulnerable to lung diseases from inhaling ethanol or gases from the charcoal and wood fire. Okay? Yun siya. Next. The nurse assists in the care of a 10-year-old male child with bronchial asthma. The nurse environmental. Okay, environmental, which is, di ba kapag environmental, wait, nasan ba yan? Oo nga, no? Wait lang. I'll check on that one, 78. Wait lang. Oo nga, no? Wait lang. May nag-point out kasi sa akin. Diba? Environmental risk factors ang nakaano dito. True nga naman. Okay. Gets. Okay. Kapag environmental risk factor, gets ko na. Kapag environmental risk factors, okay. Letter A po, cigarette smoking. Ano ba yung cigarette smoking? Ano siya? Wait lang. Wait lang. Wait lang. Cigarette smoking. Sa'yo. Wait lang. Wait lang. Passive hindi. Gets. Okay. So when wait lang. Wait lang. Wait lang po. Wait lang. I'll answer this one later. Proceed lang tayo dito. Okay? I'll answer this one later. Okay? I'll answer this one, yung number 78. Pag-aaralan ko lang kung ano siya. Bakit yun yung sagot. Okay? I'll answer this one, number 78. Okay? Proceed muna tayo. Explain sa inyo later. Okay? The nurse assists in the care of a 10-year-old male with bronchial asthma. The nurse documents care given to the child. Okay? The nurse completes an admission assessment on the child primarily to, tamang sagot dito, letter boy. Identify and clusters of data. Okay, identify and clusters of data. Kasi tapos ka naman na mag-assessment. Di ba after na assessment mo, ika-cluster mo yung data. Tsaka ka magkakaroon ng nursing diagnosis mo. So letter boy. Okay, on admission, the nurse records the following data according to the mother. The child has history of asthma triggered by exposure to cold and smoke and nuts. Vital signs taken as and recorded as follow. Temperature 99.4, respiratory rate of 36.4, pulse rate of 160 beats per minute. This is an example of what charting. Ano kaya? Okay? Ano kaya? More of what? Narrative charting to. Okay, ano sabihin ba ng SOPI? Ano yung sabihin ng SOPI charting? Ito yung may subjective, objective, assessment, planning, intervention. Yun yung ano mo siya, parang tawag dito, parang more of NCP siya. Yes. Ang focus charting mo, ano siya? May data ka, may action, tapos may response. DAR. Okay? DAR ang gagawin mo. So most probably letter apple yan. Okay, narrative charting. Okay? Which would be an example of your objective data, the nurse records. Okay, tamang sagot dyan. Objective, ibig sabihin ba nito, ikaw nag-observe, yes or no? Objective, ikaw yung nag-observe, yes. Anong tamang sagot dito? Letter apple. Okay, letter apple. Once the data is collected, the first thing the nurse does is to what? Okay, tamang sagot. Siyempre, ano una mong gagawin? Letter apple. Okay, determine the significance of the information. Ano susunod mong gagawin? Ano susunod mong gagawin? Letter boy, 'di ba? Formulate your nursing diagnosis, tapos write a client-centered goal, and then design a plan of nursing intervention. Okay? Again, ang first thing to do mo, determine the significance information, then formulate the nursing diagnosis, write a client-centered goal, and design a plan of nursing interventions. Okay? Next. The client reads the patient chart. What part in the chart would the nurse find the documentation of the current medical diagnosis? Current. Ano kaya? Best answer dyan. Ano best answer dyan? Current medical diagnosis. Sabihin yung pinakabagong medical diagnosis po ba? Yes or no? Pinakabago. Yes. Okay. So, saan mo most probably makikita yan? Client flow sheet, wala yan. Nurses notes, most probably wala yan. Saan kaya? Letter dog. Okay. Physician progress notes. Bakit? Kasi makikita mo doon kung anong current diagnosis niya. Ang admission sheet, ano nakalagay doon? Admitting diagnosis. 'Di ba? Admitting diagnosis doon. And for sure, nagpa-prognosis si physician dyan. Okay? So, doon mo makikita kung anong current. Sabi niya, pinaka-latest na meron si patient ngayon. So, letter dog. Okay, letter dog. Physician progress notes. Okay? Yan talaga, physician progress notes. Kasi, di ba, for admitting diagnosis mo, ang admitting sheet mo, makikita mo lang admitting diagnosis. Pero physician's progress notes, di ba? So, letter dog. Okay, letter dog. Yeah, actually, nakalagay lang dyan, letter D lang, tapos walang ratio. So, sinanapan ko ng ratio. Yeah, so physician progress notes talaga siya. Okay, letter dog. Okay. O, bakit daw letter boy? Bakit daw letter boy? Ano kaya reason ba't letter boy? Ba't kaya letter boy? Ba't kaya letter boy? Nasa admission sheet. Pero meron kasing progress notes na. Okay, sa progress notes, mas makikita mo kung ano yung latest. Okay? Mas makikita mo mas ano yung latest niya. Okay? Okay, next. The Director of Research and Development assigns a Nurse Aubrey to the principal investigator of a research project being undertaken to improve nursing services. The following question relates to ethics and research. Nurse Aubrey understands that the subject in any study must be guaranteed of all of the following except, ano kayo? Letter, syempre kailangan may privacy siya. Kailangan may confidentiality and protect from harm. Okay? Best answer is letter Apple. Di mo dapat i-disclose yung financial compensation. Okay? Letter Apple. For informed consent to be ethical, Nurse Aubrey must, ano kaya yan? Contact a lawyer. Kailangan pa ba ng lawyer kapag mag-informed consent? Hindi na. Okay? Third person to present a witness signing the informed consent? Hindi na din. Okay? As long as mentally competent yung patient mo. Make a recording of the consent recording. Okay? Letter Apple. Letter Apple po. Nurse Aubrey understands that revealing the names of subjects in a published research report is tamang sagot. Letter. Okay. Pwede ba yun? I-reveal mo yung pangalan ng patient mo? No. Bakit? Ano may invade dito? Your privacy, confidentiality, anonymity. Yeah, anonymity. Okay, letter dog yun. Okay, unethical siya. Okay, unethical po siya. Okay. O number 89. Nurse Aubrey prepares a set of questionnaires. She places an identification number on the corners of the questionnaires corresponding to the master list of names and numbers of the subjects. This is to assure that subjects that the information they will provide will not be shared to anyone. The principle is called, tingnan mo to, information na pinrovide nila. Ano kayang tamang sagot dito? Information, kapag information, confidentiality. Okay, confidentiality yan. Okay, kapag anonymity, demographics to. Okay, demographics. Okay. Gets ba? Demographics kapag anonymity. Okay. Number 90. One of the subjects in the ongoing study wants to withdraw from the participating. Pag magwi-withdraw ba, pwede mo po ba payagan yes or no? Pwede ka ba pumayag kapag magwi-withdraw? Yes. Okay? Pwede yan. Okay? Anong tamang sagot dyan? Letter Apple. Okay? Permit the subject to withdraw without prejudice. Okay? Without prejudice. Letter Apple. Okay. Miss Myra, an oncology nurse, assists in the care of a 14-year-old female client diagnosed with breast cancer. The client asked Miss Myra what part of the breast is cancer usually found. Based on the knowledge, the nurse says that most malignant tumors occur in the saan kaya? Upper outer quadrant. Okay, upper outer quadrant. Okay, saan naman usually nagme-mets? Saan usually nagme-mets ang breast cancer mo? Saan siya usually nagme-mets? Saan kaya? Pinaka-common. Saan ba pinakamalapit ang breast? Ano yung likod ng breast? Sa lung. Okay, sa lungs. Saan pa? Sa bone. And pwede din naman sa brain and liver. Pero ang pinaka-common lungs. Okay, pinaka-common lungs and bone. So susunod dyan sa liver at brain. Okay? Ito siya. Okay. O, dito lang. Dito siya common. Bakit, sir? Kasi nandito yung lobules mo. Okay? Kasi nandito palagi nagpo-produce ng milk. Kaya most probably dito yung highest chances mo mag-create ng cancerous. Okay? Cancer. Upper outer quadrant. The physician orders a modified radical mastectomy, right? The client returns to her room after surgical procedure. Which of the following positions will the nurse place the right arm of the client? Pwede ka ba mag-blood pressure sa right arm? Yes or no? Right arm. Kapag after mastectomy, no. Hindi na. IV insertion sa right arm. Pag ganyan. No na din. Okay? So, ang tamang sagot dito, ano kaya? Letter dog. Okay? Elevate the pillows para ma-prevent ang ano? Para ma-prevent ang lymphedema. Very good. Para ma-prevent ang lymphedema mo. Okay, elevate on pillows with client's hands higher than her elbow and her elbow higher than her shoulder. Okay, letter dog. The client has radiation therapy after the modified radical mastectomy. In caring for the skin of the site of the therapy, the nurse instructs the client to avoid all of the following practices except, ano kaya? Pwede ka ba magbigay ng ointment? Ointment? Pwede ka ba magbigay ng ointment? No, bakit? It can add up sa irritation. Diba? Irritation. Talcum is also an irritation. Sunlight. Bakit ayaw mo expose sa sunlight? Pwede ba siya mag-further burn? Yes or no? Yes, pwede yan magkaroon ng further burn. Letter apple. Wash the area with water. Okay? Wash the area with water. Next. The nurse further explains to the client that the normal tissue response to radiation is kapag pustule formation, ibig sabihin nito merong merong pus. Okay, kapag pustule formation, merong pus yan. Kapag nag-atrophy, that is not also normal. Hindi yan expected. Okay. Slouching of the two layers of the skin, hindi nito expected. Pero expected ba na mumula? Yes or no? Mamula. Yung skin surface. Yes or no? Normal ba yun, yung mamula? Yes, expected yun na mamumula siya. Letter dog. Okay, letter dog. Okay, letter dog. Next. Miss Myra understands the risk factors for the development of breast cancer include the following except ano kaya? Early onset of menstruation, yes. That is a risk factor. Diba? History, yes. Okay? And your delayed onset of menopause. Letter C. Ano pang mga other? Ano pa others? Obesity ba? Risk factor din po ba obesity? Yes or no? Yes. Okay, ano po ba yung mga other risk factor? Age, family history, early menarche, late menopause, okay, previous history of breast, uterine, and ovarian, CA. Nulliparity. Smoking, yes, that is a risk factor din. Yes, smoking is also a risk factor. Late first birth, obesity, and high dose of radiation. Ayan siya. Sige, copy niyo muna. Okay. Tapos na? Tapos na? Yeah. Okay. Next, the nurse attends a session of alternative complement and complementary for pain medication. Some of the information she acquires are discussed in the following situations. Okay. The nurse learned in the session that complementary therapies for pain management is what? Complementary therapies. Ano ba yung mga common complementary therapies? Ano-ano kayo mga common? Ano-ano kayo mga common? Yan yung mga herbal, medicine, aromatherapy. Okay? Ano kayo pinaka-best answer dito? Letter dog may be used at any time as adjunct therapy. Okay, ano ba yung adjunct therapy? Ibig sabihin nito, to assist the primary treatment. Okay, to assist lang the primary treatment. So letter dog. Okay, letter dog po. Number 97, time travel is a, siyempre dito hypnosis, X to. Okay, hindi yan hypnosis. Okay, ano bang gagawin mo kapag time travel? Letter apple. Okay, a form of imagery where the patient visualizes a time when his or her pain is relieved. Letter apple. Letter apple. Number 98. Applying pressure to which of the following organs would be considered as reflexology? Okay. Ang reflexology mo is a type of your acupressure. Okay, type of acupressure yan. That would eliminate specific diseases or conditions. This area would be the, anong tamang sagot dito? Letter? Commonly yan saan? Sa feet and hands or ears. Okay, letter cat. Letter cat. Okay, letter cat. Okay, letter cat. Okay. Number 99, an agent that is used in aromatherapy to decrease anxiety is what? Ano kaya yan? Letter, letter dog, lavender. Ano yung ginger? Ang ginger mo kadalasan, ito ginagamit to for colds. Ano pa? Stomach upset. Decreases your nausea. Soothes sprain and muscle spasm. Muscle spasm. Ay, hindi kita. Ayan siya. Okay, yung lemongrass, pati yung black pepper oil, wala akong makitang, kumbaga yung pagkakatiwala mong source. Kung ano bang ano niya. Kasi parang, pag hinahanap ko yung source ko, black pepper oil, iba-iba yung lumalabas sa kanya. Kaya hindi mo na ako nagbigay dyan kasi baka ma-quote ako na mali yung ano. Pero etong ginger, pati sa lavender, nasa ano siya? I believe nasa Kosher siya. Okay, nasa Kosher yung ano, yung book. Okay, nasa Kosher yung source na yan. Okay? Sabi sa akin pag next na. Herbal meds, may lumalabas pa sa board exam. Wala akong matandaan na may lumabas na herbal medicine. Sa board exam ko, ang lumabas FHSIS, tsaka vaccine. Yung vaccine, ang lumabas na vaccine ref. Okay, saan daw ref ilalagay ang ganyang vaccine? IMCI, wala pa, simula 2019, wala pa nag-IMCI. Kaya alam nyo na. Wala pa, simula sa batch ko, wala pa nag-IMCI. Yes. Okay. Pero hindi ko naman aralin nyo na lang, mas maganda aralin nyo. Pero parang hindi na masyadong ginagamit ang IMCI. Malay nyo, pagdasal nyo, walang pedya sa board exam nyo. Diba? Malay nyo. Sa board exam ng kapatid ko, November 2018, wala daw pedya. Walang pedya na lumabas. Diba? Swerte. Saka per board exam, meron kayong general theme. Okay? For example, ang board exam ko, ang theme namin, emergency nursing. ERDN, tsaka Palmer. Yan. Ang daming ERDN nun, tsaka Palmer. So emergency nursing pa, naka-infuse pa sa OB. Kaya medyo tricky talaga siya. Okay? An agent that is aromatherapy to congest and reduce associated with cold allergies is what? Ano kaya? Letter boy. Okay, letter boy. Kadalasan din ang eucalyptus mo din, tinatawag din siya, it enhances your immune system. Okay, ito pa yung other mo sa sa eucalyptus. Ito siya. Yan. Okay, yung COPD, I'll research muna that one pag nag-break tayo. Okay, I'll research that one. Pero mas mag-proceed kasi talaga ako sa cigarette smoking kasi siya talagang most number sa buong mundo talaga. Okay? Pero as of now, I'll try to research on that one. Medyo may point din naman yung environmental risk factor yung nakaano talaga siya. Okay, I'll research on that one. Then send ko kayo kapag meron ako nakitang answer. Okay, questions on your NP4? Kaya mo yan, ma'am. Ganyan talaga. Kaya pa. Kaya mo yan. Okay. Next, NP5. NP5. Okay. Next, NP5. You are teaching a patient about taking prophylactic warfarin, sodium, which of these statements indicate that the patient understands how to take the drug. Select all that apply. Pag ganito, okay, pag ganito na, kumari, drugs action peak and towards, hindi niya sure kung ito ba. Maximum dosage, hindi niyo rin sure. Effect of drug continue to 4 to 5 days after discontinuing. NP5. NP5 po. NP5, number 1. Okay? And I should have my blood levels tested periodically. Pero ito, number 4. Protamine sulfate is the antidote for warfarin. Ano bang antidote mo for warfarin? Ano kaya? Vitamin K. So matik itong number 4, mali na ba yung statement na to? Yes or no? Mali na ba to agad? Yes. Okay? So ang gawin mo dyan, tanggalin mo si letter apple kasi may 4. Tanggalin mo si letter cat. Tanggalin mo si letter dog. So matik ang sagot mo. Okay? Letter boy. Okay, letter boy. 2, 3, 5. Okay, paano yung sir nag-change answers from previous ratio? Ang gagawin ko, tatry ko kausapin yung mga nag-ratio. Sino ba yung mga nag-previous ratio? Tatry ko kausapin yung kung bakit yun din yung sagot nila para lang din maano. For example, di ba, mostly ba saan yun, mostly ng sagot ko, saan, na conflicting na sagot ko, kanino? Okay. Julia and JD. Okay. Kilala ko naman yung mga yun. Okay. Okay, Sir Manya. Okay, Sir Manyago din. Sige. I'll try to ask them din. Okay. I'll try to ask them. Ay, ang dami naman. Okay, I'll try to ask them din. Okay, para din ma-confirm. Okay. Number 2. Okay. Maintaining oral hygiene for a stroke patient is important in his care. In his care. You're teaching a family member how to give oral care to the stroke patient. Which of the following nursing measure is not appropriate when giving oral care to such patient? Ano kayang tamang sagot dito? Pag ganito, not appropriate, so maling sagot ang hinahanap natin. Okay, cleaning the patient's mouth and teeth with soft bristle toothbrush, pwede. Okay, portable suction, pwede po ba portable suction? Kailangan po ba may portable suction? Yes, better, mas maganda to prevent aspiration. Opening the client's mouth with padded tongue depressor, yes. Bakit nagpamay yung letter dog? Ano kayang risk nito kapag pinut mo siya at the back lang? Hindi mo siya, dapat di ba naka-high back rest siya? Yeah, okay. It's your aspiration. Pwede siya mag-aspirate. Letter dog. Okay, letter dog. Number 1 is letter boy. Letter boy. Okay. Next. Your patient has paraplegia. Ano yung paraplegia? Ano yung sabihin ng paraplegia? Waist down na paralysis or weakness? Paralysis, very good. Paano kapag tetraplegia? Tetraplegia. It is what? Ano yung tetra? Ano kayong tetra? Most probably for all 4 extremities. Yes, tetra. Plagia is all 4 extremities. Are paralyzed. Okay. About yung hemiparesis, para lang ma-differentiate na natin. Ano yung hemiparesis? Ano kaya siya? Okay, ano kayong hemiparesis? It is your weakness. Half of the body. Okay, weakness of half. Okay, half of the body. So, tatandaan nyo, kapag paresis, weakness. Kapag plagia, paralysis. Okay? Again, kapag paresis is weakness. Kapag plagia, paralysis siya. Okay? Your patient has paraplegia. In giving instruction to the watcher, when giving the patient's position in bed, which of the following is not appropriate? Ano kaya yan? Lifting the patient when moving up in bed. Yes. Okay. Rolling the patient. Yes. Okay. Yes yan. Using trapeze to help the patient lift out of the bed. Paraplegia lang naman siya. So most probably, may strength pa ba yung upper extremities? Yes or no? Yes. Okay. And bakit hindi ka magsa-slide ng patient to move up the bed? It can cause what? Friction. So pag nagkaroon ka ng friction, pwede mag-cause ng pressure sore or pwede magkaroon ng sugat si patient mo. Letter dog. Letter dog. Okay. Next. A patient is experiencing mood swings. Often times she has episodes of crying that are distress to the family members. What is the best technique that you will advise the family members when the patient is having crying spells? Ano kaya? Expected ba yun sa mga stroke patients na possible magkaroon sila ng mood swings? Yes, expected yun. Aware kaya sila sa mga ginagawa nila pag ganyan? Aware kaya sila sa mga ganyan? Most probably no. Okay, most probably no. Okay, anong tamang sagot dito? I-ignore mo ba yung patient mo? Number 3 po is letter dog. I-ignore mo ba si patient? No. Okay, no po. Okay. Tell the behavior. Di ba hindi rin? Okay, ang pinaka-best answer dyan is letter boy. So ano affected kapag nagkakaroon ng mood swings si patient? Right-sided brain damage or left? Ano kaya? Ano kaya? Pag right-sided brain damage, ano kaya most probably? It is on your right. Okay? Right yan. Kadalasan po kapag may mga mood swings ka nasa right yan. Okay? Impaired judgment. Okay? Kapag mga right-sided brain damage, ano affected mo? Left or right ng body? Ano kaya? Left. Very good. Left yung affected dyan. Okay? Left yung affected dyan. Ayan siya. So, kadalasan kapag mood swing, nasa right brain damage ang manifestation niya. Okay? Right brain damage kapag mood swings yan. Number 5. To prevent joint ano ang common? Pag left ano siya? Left-sided weakness, 'di ba? Ano ang common? Actually wala siyang mas common. Okay, it would vary kasi talaga kung ano affected mo. 'Di ba? Kung right-sided ng brain ang damage, ano ma-affected sa iyo? Left or right ng katawan mo? Left. Paano naman kapag kapag meron kang left brain damage, ano maapektuhan sa iyo? Right? Saan dyan yung pwede magkaroon ng neglect? Neglect, unilateral neglect. Most common saan? Saan kaya? Mas common ang unilateral neglect mo sa may left-sided weakness. Sa may left-sided weakness mo. Pag right brain damage ang meron siya. Okay, right brain damage siya. Okay. Kadalasan tatandaan nyo, si right brain damage, ito yung palamura. Okay, palamura to, promise. Kapag right-sided brain damage, palamura. Si left brain damage, wala tong sinasabi. Tahimik lang siya. Okay? Yun yung tatandaan nyo. Again, kapag right brain damage, parang palamura, tapos impulsive ng galawan nila. Ayan. Si left brain damage, kadalasan to tahimik lang to, promise. Tahimik, tas nakangiti. Ganyan sila kadalasan. Yes, okay. Parang ito kasi si right brain damage mo kasi para silang walang, yun, tama, wala silang judgment. Hindi appropriate yung judgment na meron sila. Okay, ito kasi si left brain damage, parang hindi siya nagsasalita. Ayan, impaired speech or language. Okay, kaya kadalasan tahimik lang to mga to, si left brain damage. Okay. Makikita nyo yan pag nag-work na sa hospital, kung nag-admit kayo, yung isang patient na stroke patient mo sobrang naninigarilyo, nagmumura. Yung isang patient mo naka-lie still lang, parang walang reaction sa lahat. Ganon. Okay? Next na. Next na po ba ako? Next na po. Okay. Okay. To prevent joint deformities of the arm and hands of a hemiplegic patients, what are the appropriate position will you include in your health teaching of the family members? Okay. Tingnan mo to. Number 1 pati number 5 opposing answer. Placing a pillow in the axilla so the arm is away from the body. Keeping the arm at the sides using pillow. Ano kaya mas gusto mo dyan? Away or nasa sides lang? Siyempre ayaw mo ng away. Okay, ayaw mo ng away. X to. Okay, X agad to. At ito. Okay. Inspecting a pillow under the slightly flex. Yes. Gusto mo ba naka-immobilize yung extremity with the sling? Yes or no? Or gusto mo naka-placing on one hand cone so the finger may be flexed. Gusto mo may nakaganon siya para hindi siya naka-flat na ganyan. Letter dog. Okay, letter dog. Okay, 2, 4, 5. Okay, 2, 4, 5. Number 6. Ay, charot. Situation. You are a community health nurse assisting a family in the care of their daughter suffering from the post or past traumatic stress disorder. While caring for this client, the family noticed a loud noises causing serious anxiety response. Which of the following explanation by you would help the family understand the client response? No kaya yung tamang sagot dito? So letter cat. Okay. Pinaka ano dyan, environmental triggers can cause the client to react emotionally. Okay. Letter cat. Diba? Bigla kasing loud noises, okay, which is not normal, okay, which can cause what? Trigger. Kaya siya mag-react ng ganyan si patient mo. Letter cat. Okay. Which of the following instructions should you include about the relationship for this client with post-traumatic stress disorder? Papa-avoid mo ba sa kanya yung emotion niya? Yes or no? No. Diba? Hindi. Okay. Warn the client that she will have the tendency to be over-dependent in relationship. Hindi rin. Okay? Encourage the client to resume former roles as soon as possible. Eh, di ba nagkaroon nga siya ng traumatic stress disorder? Tsaka take note as soon as possible ka. Anong tamang sagot? Letter apple. Okay, letter apple. Assess the client's discomfort when talking about the family member. Letter apple. Which of the following nursing intervention would be best help this client and her family handle interpersonal conflict at home? Have the family what? Ano pinaka-best answer dyan? Teach the client to identify defensive behavior. Be X yan. True or false? X yung letter boy. X to? Yes, X yan. Defensive behavior. Okay? Agree not to tell the client what to do about the problem. X din. Okay. Pinakamaganda dyan, family meeting po ba? Yes or no? Family meeting? Yes. Ano yung family meeting dito? Letter apple. Letter apple. Discuss how to change dysfunctional family patterns. Letter apple. Which of the following nursing actions would be more appropriate when speaking with this client about trauma she experienced? Kapag ganyan, B, 'di ba? Kapag mga ganyan, verbalized feelings po ba kadalasan yan? 'Di ba? Pag psych, tandaan nyo, kapag psych patients and verbalized feelings palagi. Yes or no? Or listen, ang palaging intervention mo. Okay? So, matik yan. Anong tamang sagot dito? Letter apple. Kasi pinahayaan mo siya mag-verbalize ng feelings niya para nakikinig ka attentively. Okay, letter apple. Okay, letter apple. Number 10. Which of the following nursing actions would you include in the plan of care for this client who keeps saying that the trauma she experienced was just a bad luck? Ano kaya? Encourage to verbalize the experience. Yes or no? Verbalize na naman? Yes. Okay. Pag may verbalize feeling, yan yung most probably yung tamang sagot nyo. Letter boy. Okay, letter boy. One of the competencies expected of you as a beginning professional nurse is to have positive attitude toward research. True ba yan? Gusto niyo ba research? Mamin kayo. Diba? Ayaw niyo mamin kayo, diba? Same. Okay? You plan to study the effect, diba? On the effectiveness in teaching active exercise to post-stroke patient. Which of the following research design will you give the most confidence to answer the research problem? Ano kaya yan? Pag dito, okay, For example, non-equivalent control group design. Ibig sabihin nito, walang randomization lang. Okay, wala lang siyang randomization. Okay. Okay. Yan. Ang post-test only control group design, ano to? So, may intervention ka. Tapos, may post-test ka. Yan siya. Ang one group pre-test post-test design, paano siya? Ang one group pre-test post-test, isabihin ito, meron kang pre-test, may intervention, tapos meron kang post-test. In one group lang. Okay, in one group lang. Okay, yan yung ano niya, by definition niya. So, paano ko ito magpapagkasya? Dito. Kita nyo ba dito? Kita nyo dito? Yeah. So, ang time series design, ano to? Meron kang, tinitingnan mo yung, ano, multiple observations. Okay, multiple observations. So, anong gusto mo dito? Ano kaya? Ano kaya? Pinaka-best answer dyan is what? Is your, ano, letter, ano kaya? Letter apple, time series. Kasi effectiveness of films. Okay, effectiveness of films. So, mas gusto mo multiple observations ang gagawin mo. Para titingnan mo kung maganda ba yung exercise na gawa sa mga stroke patients mo. So, letter apple. Okay, letter apple. Okay, letter apple. Number 12. Which of the following sampling technique is the most appropriate to answer research question on the effectiveness of exercise on the mobility of post-stroke patient? Madami ba mga post-stroke patient? Yes or no? Madami ba mga post-stroke patient? Yes or no? Madami mga post-stroke. Most probably, no. Hindi siya ganun kadami. Kumbaga, konti lang yung ano mo, yung sample size mo, 'di ba? So, most probably ang kukunin mo diyan, ano kaya? Purposive, 'di ba? Anong other term for your purposive sampling? It is your judgmental. Ibig sabihin, meron ka bang gagawing ano? Meron ka bang gagawing criteria pag ganyan? Yes, may criteria ka dyan. Okay? Kapag na-meet yung criteria, yun lang yung pwede maging sample size mo. Okay? Random sampling, ano kaya? Ano yung random sampling mo? Ano yung sabihin nito? Ito yung mga, ano? A good example kapag random sampling, ito yung mga simple random sampling. Yan yung mga fishbowl method mo. Okay. Yan sa kadalasan yan. Okay, simple random sampling. How about your quota sampling? Ang quota sampling mo, parang ano lang siya, basta ma-meet mo lang yung ganitong number of person, okay ka na. Ganyan ang quota sampling mo. Okay? Yung convenience sampling, kung sino lang yung available within that time frame. Kung available on that time frame. Okay? Kumari, nag-research ka ng ganitong araw, kung sino lang available on that time, yun lang. Okay? Ang quota sampling, ito yung meron ka i-meet na number of sample size. Number of sample size. Okay, ganyan siya. Yan. Sabi sa akin pag done na. Done na po. Yes. Okay, next. You want to develop a tool. Kapag magde-develop ka ng tool, ano kaya? Develop a tool in measuring, develop a tool in measuring the level of consciousness of stroke patients. Ano kaya yan? This is your letter, method. Letter dog method siya. 'Diba? Ang case study, kadalasan ilang tao ang ginagawa mo kapag case study? One person lang. Very good. One person lang kapag case study. Kapag historical study, ano kaya to? Past. Kadalasan past yan. Historical, yes, past. Okay. Comparative, comparison lang ng two subjects mo. Okay. Number, 14. Or you want to examine the difference in the eating behaviors between two groups. Okay, two groups in high school students. Which of the following research design would you answer to this research question? Di ba? Ang case study, most probably, one person. Ang correlation, anong correlation? Anong correlation? Relationship. Pwede naman, relationship. Okay? How about your comparative? Letter C, comparative. Yung survey study mo is how you would collect the study or how would you collect the information. So letter cat. Kapag correlation ba, may cause and effect relationship siya? Yes or no? Cause effect. Kapag correlation. Wale. Sabi niya wale lang. Kumbaga may relasyon lang sila pero wala silang cause and effect. Okay? Kapag cause and effect, experimental yun. Okay? Experimental yun. Okay, number 15. 15. In a study on the relationship between the personality makeup and obesity, a Pearson R is 0.8 would mean, ano kaya yan? Ano kaya? Letter C. High positive. Ano yung low positive? Ilang point? Pag low positive, 0.1 to 0.3. Okay? 0.1 to 0.3. Kapag medium is 0.3 to 0.5 or moderate. And the high positive, that is your 0.5 to 1. Ito siya. Okay? Again, kapag 0.1 to 0.3, that is low. Okay, pwede siya sabihin na low. Okay. Moderate. And high. Okay? Kadalasan naglalagay naman sila dyan kapag positive or negative. Pag may negative sign, matic negative yan. Kapag walang positive sign, matic positive yun. Okay? Yan siya. Kapag low, again, 0.1 to 0.3. Pag 0.3 to 0.5, moderate. Kapag high, 0.5 to 1. Okay? 0.5 to 1 yan. Screen cap nyo na. G na. Okay. Okay, G. Emily, a 10-year-old grade 4 pupil in a private school, has just lost her best friend, Lori, who died leukemia. Her mother brought her to the emergency room, who reported that Emily has been gloomy and often expresses feeling of joining Lori in heaven. Which of the following is precipitating factors of Emily's feeling wanting to die? Ano kaya yan? Letter Apple. Diba? Matic, letter Apple. The death of Lori. Okay. Sige, catch up muna. Emily's feeling of joining. Feeling pa lang siya. Ano kaya yan? Feeling. So may thoughts ba siya mag-suicidal? Yes or no? Suicidal thoughts? Meron ba yung suicidal thoughts? Yes. Okay, may suicidal thoughts. Anong tamang sagot dito? 16 is letter apple. Letter dog. Suicidal ideation. Kapag suicidal ideation, thoughts pa lang siya of having suicide. Okay, thoughts pa lang siya na having suicide. Emily state, I will hang myself. Ano kaya to? 16 po is letter apple. Meron na bang, kapag ganyan, I will hang myself, may decision na ba siya, yes or no? Yes. That is your suicidal, ano kaya siya? Intent na yan. Okay, intent na yan. Okay, may intention na siya kasi nagsabi na siya, I will hang myself. Okay? Which of the following is the best indicator or predictor of adolescents attempting suicide? Ano kaya? Letter? Ano kaya? Feeling of what? Feeling of hopelessness. Okay, feeling of hopelessness. Letter dog. Okay, letter dog. Best indicate predictor adolescents attempting suicide. Okay, letter dog. Feeling of hopelessness. Ito yung lumabas sa board exam ko. Yes. Okay, you are a staff nurse in an outpatient department. Mrs. D brought 9-year-old daughter Bianca for consultation. Bianca is complaining of sore throat, muscle tenderness, weakness and of the arms and general feeling of not being well. The attending physician impression is infectious polyneuritis. Ay, shit, walang 20. Walang 20. Sige, sige. Wait, hanapin ko yung 20. Shit, walang 20. Ayan. Oh. Emily State. I wish I were dead. I cannot stand anymore not having Lori around. Your most appropriate nursing action would be, ano kaya? Letter, ano? Nung tamang sagot dito. 3 goes 4. Letter, wait lang. Nabi ko dito. Ano kaya best answer dyan? Letter, number 20. Ano? Siyempre mag-ano, kadalasan di ba sabi ko pag psych, explore. Letter dog, explore. On the patient's or Emily's feeling. Okay, explore ka pa dyan. Letter dog. Okay, letter dog. Okay, letter dog. Kasi ma-address mo dyan stay with the client. Kasi nag-explore ka pa. Letter dog. Okay? Okay po. Oh, you are the staff nurse in the outpatient department. Mrs. D brought her 9-year-old daughter, Bianca, for consultation. Bianca is complaining of sore throat, muscle tenderness, weakness of the arms, and general feeling of not being well. The attending physician impression is infectious polyneuritis. Okay? Ito, promise lumabas talaga to sa board exam ko. Ano siya? NP5? Alam ko NP5 to. Okay? Ano yung sabihin ng infectious polyneuritis? Ano yung infectious polyneuritis? Familiar kayo? Your infectious polyneuritis is your GBS. Okay? GBS po. Okay? GBS siya. Okay? So, tanong dito, initially, what assessment data would be the best important for you to make? Ano kaya dyan? Letter? Ano? Letter boy. Kapag GBS ba? Ascending or descending? It is ascending. Ang sabihin na ascending. Ano kaya po ibig sabihin na ascending? From pataas siya. Okay, pataas siya na weakness. Okay, paralysis. Letter boy. Okay, bakit? Siyempre, assess mo kung may swallowing siya. Increased risk for aspiration ba yan? Yes or no? Kapag ganyan. Yes. Okay, letter boy. Bianca was admitted to the pediatric ward. What would be your priority nursing action when caring for her? Okay? Ano kaya dyan? Diba? Prone ba yan magkakaroon sila ng parang paralysis? Yes or no? Yes. Diba? Ano bang gagawin mo? Prone ba yan magkaroon ng ano? Weakness. So dapat ang priority mo dyan, letter C, making a game of range of motion. Letter C. Okay, letter C. Opo, priority nursing action siya. Letter C. Number 23. The pediatric nurse asked Bianca to cough every now and then. She also assessed Bianca's speech for decreased volume and clarity. The underlying rationale for this assessment is to determine what? Ano kaya? Nagpapa-cough ka daw. And then yung speech, nag-assess ka ba ng cranial nerves dyan? Yes or no? Yes. Letter boy. Okay, letter boy. Letter boy po. Involvement of the facial and cranial nerves. Okay? Number 20, ano ba to? Number 24. Assessment findings revealed that Bianca's weak gag and cough reflexes. During the acute phase of Bianca illness, which of the following problems should receive the highest priority? Ano kaya dyan? Di ba? Weak and gag reflex, makakalunok ba to si patient ng maayos? Yes or no? No. So, Matik, anong tamang sagot dito? Letter apple. Impaired swallowing related to your neuromuscular impairment. Okay? Impaired swallowing related to your neuromuscular impairment. Bianca was placed on mechanical ventilator. Which of the following nursing action should the warders give emphasis? Okay? Letter B, ano nagpamali sa letter B? Vigorous, di ba? Vigorous. Okay. Maintaining Bianca in supine position to prevent unnecessary nerve stimulation. Di ba kapag naka-mech vent ba, ano bang position of choice mo kapag naka-mech vent? Anong priority position mo kapag naka-mech vent? Moderate high backrest mo yan para ma-support yung ventilation niya. Okay. Transferring to a bedside chair. Matatransfer mo ba ang intubated sa bedside chair? B, ang hirap niyan. Baka ano mangyari dyan kapag ganyan? Ma-extubate mo pa siya. Okay, best answer is letter A po. Bakit po? To prevent your respiratory complications. Diba? Kasi pwede po ba magkaroon ng stasis ng secretions kapag ganyan? Pag hindi mo siya from side to side? Yes. Diba? At the same time, prone din ba yan magkaroon ng bed sores? Bed sores. Prone ba sila magka-bed sores kapag ganyan? Yes. Okay, kasi 'di ba, umakyat na sa lungs kasi nagkaroon na ng paralysis. So makakapag-turn pa ba si patient? Hindi na. Okay, kasi meron na siyang paralysis. Okay? Situation. Jade Abad, 40-year-old woman, has history of your rheumatoid arthritis. Rheumatoid arthritis, systemic or local? Systemic or local? Systemic yan. Okay, systemic po yan. For the last 10 years, the following questions refer to this situation. Which of the following is a common sign and symptom of your rheumatoid arthritis? Crepitus. Ano kaya to? RA-OA. OA, very good. OA po yan. Okay? Heberdens. OA. Symptoms aggravated by humidity. Muli. Okay? Ano ba aggravate ng symptoms ng RA mo? Saan ba siya mas masakit? Pagkagising after work. 'Di ba? Pag prolong pagkagising early in the morning, very good. Correct answer is letter C. Deformity and displacement of the proximal joints. Letter C. Okay, letter C. Which of the following is not a common laboratory finding in a rheumatoid arthritis? Ano kaya dyan? Okay? Low hemoglobin expected, hindi. Low hemoglobin expected or hindi? Hindi. Okay, hindi siya kasi, expected dyan kasi prone sila magkaroon ng anemia. Anemia. Positive rheumatoid factor, yes or no? Yes. Okay. Positive lupus erythematosus. Yes, ESR. Positive sila dyan. Correct answer is letter dog. Okay, increase white blood count. Usually yan mababa. Okay, usually yan mababa. Okay, mababa siya. Kasi hindi stress yung katawan mo. So most probably nagkakaroon ka ng suppression talaga. Letter dog. Okay, letter dog. Number 28. Jade has been taking steroids for the last 5 years to control her arthritis. Which among the following is the common side effect of steroid therapy? 'Di ba? Kapag ganyan, ano tatanda natin kapag ano? Kapag steroid high, high in triple S yan, high in S. High, high sugar, 'di ba? High sugar. Okay, high sugar. High salt po ba? Yes or no? High salt, high sugar, high sex. Okay? Hyponatremia hindi siya. 'Di ba? Hindi. Dapat hypernatremia siya. Okay, dapat hypernatremia. Hyperkalemia, hypokalemia. It is hypokalemia po. Okay, hypokalemia. Okay, most probably correct answer is letter C. Increased blood sugar or blood glucose. Okay. Number 27 is letter dog. Okay. Number 24. 24. Letter apple. Okay. Next. Anong mo? Diet of choice mo pag ganyan? Letter, ano kaya? Which of the following best suited to decrease the side effect of steroid therapy? So most probably hindi ka maglo-low potassium. 'Di ba? Hindi ka maglo-low potassium. Next to. 'Di ba nagkakaroon nga siya ng protein anabolism. Okay, protein anabolism. X din to. Okay? Based po on the dapat normal carbohydrate ka lang. Okay, normal carbohydrate, high protein and high potassium diet. Letter apple. Okay, letter apple po. Okay, letter apple. Okay, next. Jade was on ibuprofen, which has stopped when the steroid therapy was started. 28 is letter cat. Which was the main reason for stopping the ibuprofen once the steroid therapy was started? Ano kaya yan? Ano kaya? Ibuprofen mo, anong drug classification ibuprofen? NSAIDs, very good, NSAIDs siya. So, ano ba siya, gastric irritant po ba yun? Yes or no? Ang ibuprofen. Yes. How about your steroids? Gastric irritant ba to? Yes. Pwede ba siya mag-cause ng GI bleed? GI bleed. Yes, pwede yan magkaroon ng GI bleed. Correct answer is letter apple. Okay, apple yan. Pwede ka magkaroon ng GI bleed dyan. Okay. Gusto mo na ba magkaroon ng 10-minute break? 10-minute break. Okay. Balik kayo ng 240. Okay, 240. Okay. Thank you. Okay. Start na. Start na ba tayo? Gina, okay. You're a staff nurse in the musculoskeletal unit of the hospital. You are taking care of the patients with varied musculoskeletal conditions. Okay? Ang tanong dyan, which of the following inflammatory conditions commonly occurs in the shoulder? O take note nyo, inflammatory. Saan ba nag-i-end ang inflammatory most probably? Saan kaya? ITs. Anong tamang sagot dyan? Letter? Ano kaya? So ano ba yung itis ng bursitis and your wala yung annotation ko. Bursitis and your tendonitis. Letter ano kaya? Letter dog 1 and 3. Yung carpal tunnel syndrome, saan common nakikita ang carpal tunnel syndrome? Sa hand. Yung hindi ko paano i-pronounce. Dupuytren's sa hand din siya. Okay, sa hand, specifically sa palm nag-occur ito. Okay, ito, sulat na natin. Sa hand. Ito din, sa hand din to. Specifically sa palm. The hand. Yan. Okay, palm of the hand. 32. Which of the following is not considered a conservative treatment? Ibig sabihin ng conservative treatment, ano to? Ang conservative treatment, ibig sabihin to, hindi siya invasive procedure. Okay, 31 po is letter dog. Hindi siya invasive procedure. NSAIDs po ba invasive pa do? Yes or no? Invasive ba to? No. Diba? Hindi pa to. Okay. Intermittent ice heat application to the joint. Invasive ba to? No. Hindi rin to invasive B. Okay. And resting the extremity. Ibig sabihin to, correct answer is letter C. Laser phototherapy. Okay, letter C. Letter C. 33. Impaired movement of the rotator cuff of the shoulder is generally termed as impingement syndrome. Edema, which is early manifestation of this syndrome, is due to what? Ano kaya? Is caused by what? Rubbing. Okay, kapag nag-rubbing yan, most probably, ano yan? Ano kaya yan? Pag ganyan, anong correct answer? Letter boy. Okay, letter boy. Muscle spasm. Kasi nag-rubbing. Okay, rubbing of the rotator cuff caused by your humerus and top outer edge of your shoulder leading to your muscle spasm. Letter boy. Okay, letter boy. Okay. So may tendonitis na nga yan. Okay, may tendonitis. For a persistent shoulder pain and weakness, this is usually treatment modality performed is, anong tamang sagot dyan? So, syempre, hindi ka muna mag-radiotherapy. That is for your cancer. Laser therapy, hindi rin. Okay, you would go for arthroscopic synovectomy. Ano ba yan? Ito yung open mo yung synovial space through the arthroscope to relieve the pressure. Diba? Yung pressure yung nagkakos ng pain. Letter dog. Okay, letter dog. 33 po is letter boy. Okay. One of the most common foot problems is callus. Ano yung callus? Ano yung callus? Anong Tagalog ng callus? Anong Tagalog ng callus? Kalyo. Saan kayo may kalyo? Nasa kamay ba? Yes or no? Mamin kayo dyan. Panig sa kamay yan for sure. Yes, kakasulat. True, di ba? The condition precedes the formation of a callus when ano? Ano kayong tamang sagot dito? Letter apple. Apple. Okay. External pressure on the foot. Your corns and callus are thick hardened layers that develop when the skin tries to protect itself against friction and pressure. Letter apple. Letter apple. Or you are the staff nurse working in a hospital and encounter situations with ethical Moral implications. Number 32 po is letter C. Okay, letter C. Ethical moral implications. Which of the following nursing actions will you do if the patient is unconscious and unable to make decision? This fact should be, ano kayang tamang sagot dito? Anong gagawin mo dyan? You, document. Okay, document in the patient chart. Okay, kasi para may proof ka, kung wari bigla nagpa-sign sila informed consent. Letter C, documentation, di ba? Yan pa din talagang pinaka-ano mo, documentation. Letter C. A patient came from the prison for emergency treatment. Which of the following precautionary measures will you institute to ensure that the safety of the hospital staff and the other patients? Ano kayong magandang gawin dyan? I-restraint mo ba yung patient? Yes or no? Yes. Okay, yes yan. So letter, letter dog, diba? In the first place, pagkadating pala ng hospital yan, nakaposas na yun si patient. Yes or no? Yes, nakaposas na agad yan si patient pagdating pa lang sa ospital. So never release the hand or ankle restraint. Letter dog. 36 po is letter cat. Document. In using your restraints to patients, which of the following guidance will you follow? Ano kaya dyan? Most probably umbrella answer ba hanapin mo dyan? Yes or no? Diba? Papansin nyo dyan, or pinaka-appropriate na answer. Diba? Letter, letter dog. Okay? Maintain respect for a client when applying restraints. Letter dog. Okay? 34, letter dog. Letter dog. Okay? Kailangan ba may medical order kapag mag-restraint, yes or no? Yes, 'di ba? Kailangan may medical order. Kailangan mo ba i-frequent i-assess yung patient mo naka-restraint? Yes, 'di ba? Remove as soon as possible po ba ang restraint, yes or no? Kailangan kapag may nakita mo na indication na pwede na tanggalin mo na agad. Yes, okay, remove as soon as possible. Okay. You have observed that a group of students are implementing their research project on the effect of hot and cold application to febrile patients without informing the participants properly. What ethical principles was violated by the students? Ano kaya dyan? Hindi mo in-inform. Ibig sabihin nito, parang naging sapilitan kasi wala silang alam. Anong tamang sagot dito? 38 is letter dog. Letter boy, autonomy. Okay, autonomy. Letter boy. Ano yung non-maleficence? Do no harm. Justice, ano yung justice? You fair. Fair. Magiging fair ka kay patient. Okay? 40, a researcher should pay particular attention in protecting the rights of the vulnerable group. Ano ba yung mga vulnerable group mo? Which of the following is not considered vulnerable? Prisoners, vulnerable ba to? Yes or no? Yes. Children. Yes. Mentally challenged. Yes. Postpartum ng anak na yan, di ba? Pregnant ang vulnerable, yes or no? Yes, ang pregnant ang vulnerable. Ito postpartum na nanganak na siya. So letter dog. Postpartum mother with normal delivery. Letter dog. Number 41. You are a staff nurse in the neurologic unit of the pediatric department. Several problems have been reported in relation to the ventriculoperitoneal shunt for hydrocephalus patients. The initial investigation on the care of the patient with this shunt revealed that the majority of the staff nurses have little experience on caring for such patients. It was decided to look into their level of knowledge and skills to serve as baseline for improving the nursing care of hydrocephalic patients on the ventriculoperitoneal shunt. The following questions. Binasa niyo ba yung na yan? Situation na yan? Totoo hindi. Mamin kayo, binasa niyo ba yan? Mamin. Tried pero hindi niya tinuloy. True. 'Di ba? Pero take note niya sa board exam ganyan kahaba yung mga ganyan kahaba yung mga situation. Promise. Tapos minsan sobrang layo. May mga ganun. Okay. A 4-year-old hydrocephalic preschooler is scheduled to have your ventriculoperitoneal shunt at the right side of the head. Which of the following position should the child be placed immediately after surgery? Ano kayong tamang sagot? Letter? Ano kaya? Letter? Non-operative side. Okay, non-operative side, left side with the head of the flat. Okay, letter boy. Okay, letter boy. Diba? Palagi nyo tatandaan kapag hydrocephalus, lie on the unaffected side. Okay, lie on the unaffected side. Dapat nga medyo i-elevate pa ng konti yan to 15 degrees para promote ng VP shunt drainage. Okay, VP shunt drainage. Next, what nursing action should the nurse do when providing post-operative nursing care to a child after insertion of your ventriculoperitoneal shunt? Ano kaya? Anong prone na ano yung prone na complication kapag nag-VP shunt insertion? Ano kaya mga prone? Saan kaya? Sa leakage, di ba? Pwede ba magkaroon ng leakage? Yes. Okay, so syempre kapag ganyan, test the cerebrospinal fluid for your protein. Kasi prone yan mag-leakage. Ano ba yung mga signs and symptoms mo ng leakage kapag ganyan? Ano yung mga signs and symptoms mo na may leakage ka? Meron kang, ano most probably, nag-frequent, swallowing. Naka-frequent swallowing po yan. Okay? Number 43, an infant. Bakit po considered vulnerable ang prisoners? Kasi di ba kumbaga naka-enclosed space sila. Okay, kaya sila magiging considered na vulnerable group. Okay? Kasi naka-enclosed space sila. Kumbaga, meron silang confined place. Kaya sila considered na vulnerable group. Okay? Ang pregnant kasi siya, nagiging vulnerable siya. Pero pagkapanganak ni mommy, hindi siya vulnerable group. Okay? An infant bakit frequent swallowing? Kasi most probably, siya dyan, may leakage dito sa may sa may taas sa may palate area mo. Kapag nag-frequent swallowing yan, most probably nagkakaroon siya ng leakage. Okay? Nagkakaroon siya ng leakage. An infant who has a hydrocephalus is irritable, lethargic, and difficult to feed before the ventriculoperitoneal shunt is placed. To maintain the infant's nutritional status, which of the following nursing action is the most appropriate? Ano kayong tamang sagot dito? Letter boy, give the infant small and frequent feedings para at least na mo siya. Okay, nagagawa mo siya. Letter boy. The parents of a school-age child with ventriculoperitoneal shunt were given discharge teaching. Which of the following signs of block shunt would the parents be able to identify that the discharge teaching is successful? Kapag nagkaroon ng blockage ng shunt, ano mangyayari? Increase intracranial pressure. Ano first sign ng increase intracranial pressure? Ano kaya? Letter irritability. Letter apple. Okay, irritability. Irritability and increased difficulty with eating, 'di ba? Most probably decrease in sensorium yan mga yan. Letter apple. Okay? 45. After a 6-year-old child underwent placement of your ventriculoperitoneal shunt, he was put on medication. Okay, IV medication. The head nurse observed that many of the staff nurses are disconnecting the flush syringe first and then clamping the intermittent infusion device. The staff nurse seemed not to understand the benefits of positive pressure techniques. Which of the following strategies would be the most effective way to improve the staff nurses technique when giving IV medication? Ano kayang tamang sagot dito? Maglagay ka ng evidence-based article on the topic in the unit. Letter apple. Okay, letter apple. Situation, you're the staff nurse in the stroke unit of the medical ward. You have a stroke patient with tracheostomy. In the last unit meeting, it was discussed that there is increasing complaints of the nurse incompetence in caring for the patient with tracheostomy. The following questions related to this situation. In providing tracheostomy, which of the following is a nurse priority nursing action? Pwede ka ba maggupit ng dressing, yes or no? Pwede ka ba maggupit ng dressing? No. Okay? No. Clean the incision. Clean the incision. Clean the incision with iodine. Iodine. Iodine ba dapat? Ano dapat? Ano dapat? Ano gagamitin mo? Hydrogen peroxide plus N, tsaka NSS. Okay, pwede ka ba mag-cut? Hindi rin po, 'di ba? Fold lang. Okay, fold lang. Okay, use clean technique. Clean technique po ba kapag tracheostomy care? Sterile. Okay, pag nagsasuction ka, sterile or clean technique? Pag nagsasuction ka, sterile pa din. Okay, sterile po. Okay, kailan ka lang ba mag-clean technique kapag involving yung GI tract? Okay, for example, NGT insertion, clean or sterile? Clean. Okay, change ng dressing ng colostomy mo. Colostomy dressing change, clean, di ba? Cleaning your colostomy, clean or sterile? Clean din siya. Okay, clean siya. Okay. So syempre, ang priority mo dyan, secure clean ties before removing the soiled ones. Letter cat. Oral suction is clean. Clean. Clean siya. Oral suction, oral naman. Okay. Next. Which of the following nursing action should the nurse teach the patient's caregiver regarding tracheostomy care? Remove the tracheostomy tube if obstruction occurs. Natanggalin mo ba kagad yung tracheostomy tube? No. Anong gagawin mo kapag may na-feel ka obstruction? Suction. Diba? I-suction mo lang muna. Okay? Leave the tracheostomy ties in place until the physician change them. Diba? Dapat part ng iyong pagtuturo ay yung matuto yung caregiver. Di ba? Pwede naman tayo magpalit ng tracheostomy tie. Okay. Remove and clean the inner cannula daily. Yes or no? Ano bang recommended mo na paglilinis ng inner cannula? Per shift, every 8 hours. Very good. Every 8 hours yan. Okay, every 8 hours. Correct answer is letter dog. Never put a covering over the tracheostomy stoma. Bakit kaya? Bakit ka never maglalagay ng covering sa tracheostoma stoma? Kasi airway, nandun yung airway niya. Yun yung source ng paghinga niya, 'di ba? Okay. Next. After tracheostomy procedure, the nurse document important observation made during the procedure such as what? Ano kaya? Pinakamaganda dyan is letter letter vital signs. Okay? Letter boy. Vital signs of the patient during the procedure. Okay? Letter boy. Okay? Letter boy. Next. What is the purpose of your tracheostomy? Ano bang pinaka-main purpose mo? It's letter apple, establish airway. Okay, establish airway po. Okay, establish airway. Yan yun agad, airway agad. Which of the following can be a major problem for a patient with tracheostomy? Ano kaya? Letter problem. Pag may tracheostomy, nakakalunok ba ito ng maayos? Yes or no? No. Diba? Pwede sila magkaroon ng problem in swallowing. Letter cat. Letter cat. You are the quality assurance officer of your hospital. The following questions relate to this question. Okay? As a nurse, as the quality assurance officer, you develop a group of nurses to conscientiously use the current evidence in managing the patient with rheumatoid arthritis. This is an example of what? Ano kaya yan? Oh. Current evidence, gagamitin mo daw yung current evidence mo. Ayan ay ano? Evidence-based practice. Ito, purposive sampling, ano to? Sampling technique yan. Your research utilization, tatandaan nyo lang, kapag research utilization, not related. Okay, not related. Kumbaga, parang more of knowledge kasi ang research utilization mo. Okay, ang research utilization, more of knowledge ang ina-apply mo dyan. So, letter apple. Okay, apple. 51. Based on the initial research findings, sterilium, an alcohol-based hand disinfectant, is more effective than the traditional brushstroke hand scrub method. You recommend its use by the nurse in the OR. This is an example of what? Effective daw. So most probably, ano yan? Letter boy. EBP ulit yan, evidence-based practice. Ang research utilization is applying the knowledge obtained from research in the clinical practice. Okay, applying the knowledge. Ito kasi, para nagkaroon ka ng findings. Okay, findings na mas effective yung isa. Yung sterilium rather than yung traditional brushstroke hand scrub method. So letter boy. Okay, letter boy. Hindi kita gets, ma'am. Wait, reply na kita. Okay. Next, one of your programs as quality assurance officer is to develop a research culture in the nursing service department. What would be the best and easiest thing to do to encourage the nursing personnel to participate in research? Ano kaya? Ano kaya pinaka-ano dyan? Sure? Ano kaya yung tamang sagot? Matik yan. Statistical procedure. Magtuturo ka ba statistical procedure kapag ganyan? Yes or no? No. Bakit? Bakit? Sa tingin nyo ba magkakaroon sila ng ano dyan? Interest kapag ganyan? Hindi, doy. Diba? Masyadong complex. How about letting them do a critical analysis? Yes or no? Hindi rin siya madali, day. Okay? The best answer is participate in research. Ibig sabihin ito, gagawa ka ng research. Okay, research culture, the best thing to do is to read or review the related literature. Letter cat. Kasi yung letter dog, parang nagiging passive lang to, hindi ka gagawa ng research. Okay? Ang gusto mo kasi ito, magkaroon ka ng research culture, ibig sabihin ito, nagiging involved sila, gumagawa sila ng research nila mag-isa. Okay? Kapag gumagawa ka ng review-related literature, mas nagiging curious ka kung nakita mo kung ano yung gap sa unit mo. Okay? Nakikita mo yung gap where nagkakaroon ka din ng idea kung ano bang pwede mong i-research na gawin. So, letter cat. Okay? Letter cat. Okay? Next, you were asked to present the most frequently occurring causes of sentinel events for the last 6 months. Most frequently, as the basis for the patient safety program. What measure, the central tendency are you going to use in this situation? Tamang sagot. Ibig sabihin, most frequently, that is your mode. Okay, that is your mode. How about yung mean? Ano ibig sabihin ito? Ibig sabihin average. Okay, average. How about yung median? Middle value. Ano yung analysis of variance or your ANOVA? Ano yung ANOVA? Ano kaya yan? Ito yung comparison of two groups. Okay? Titingnan mo kami relationship sila sa isa't isa. Okay? Comparison of two groups at the same time to determine if may relationship silang dalawa. Okay, yan siya. Ay, grabe siya. Ano daw? Sinasabi daw yung pag nainis ka. Grabe siya. Charot. Okay. Grabe siya. Ala, dami nag-react. Ang dami, may umiyak. Oh, kawawa naman. Iyak tayo. Ay, charot. Ang bad. Ano lang, sad na lang. Okay, charot lang. Okay, next na ba? Okay, next. Ito lang siya. Okay, nilagay ko lang dyan para lang meron kayo notes. Okay, nilagay ko lang dyan para lang kayo merong notes. Next na po. Charot lang. Sakto lang. Mga one na tawa. Isang tawa. Ganun. Charot. Joke lang. You want to determine the difference of coping skills among adolescents diagnosed with drug abuse as a basis of gender-specific program on coping skills. What will be your sampling technique to answer the research problem? Ano kayang tamang sagot dito? So, ibig sabihin may gender-specific program ka. Okay? Ano ibig sabihin yan? So, meron kang male, female, gender, male, female, di ba? So, hahatiin mo into two groups. Anong gagawin mo? Stratified. Okay? May magtatanong yan, anong difference ng stratified pati cluster sampling? Anong difference ng stratified pati cluster? Yung stratified, meron ka mga iba't ibang group. Stratified is my strata. Okay? Pag one thing to dyan. Okay? Kapag stratified, meron kang several group. Per group, kukuha ka doon. Yes or no? Ganun ang stratified. Yes or no? Yes. Yes. Kapag cluster, anong gagawin mo pag cluster? May several groups ka. Kukunin mo isang group, yun yung sample size mo. Ganun ang cluster sampling. Malinaw? Yes. Okay. Mas maganda illustration kapag by picture. For example, kasi common na tinatanong yan, stratified sampling, you have different groups. Ito 1, 2, 3, 4, 5, 6. So per strata or per group, kukuha ka doon ng sample size mo. Okay, as compared to your cluster sampling, meron kang 6 na group. Sa 6 na group yan, kukunin mo isang group na to, lahat sila magiging sample size mo, lahat sila magiging sample size mo. Okay? Mas nagets na yung difference? Yes. Okay. Next na. Yes. Okay. In the interdisciplinary care of psychiatric patient, each number of health item has his or her roles and the functions. The following relates to this statement. Which of the following is not an ingredient of the collaboration process? Negotiation between each member of the health team to conceptualize, yes. Okay. Receptively and respect, yes. Active and assertive communication, yes. Okay, communication technique used by each health team member. So dapat kasi magkakaroon, kumbaga, mas magiging open kayo kapag ganyan. Letter boy. Letter boy. Number 57. The most important steps in interdisciplinary team building is what? Ano kaya? Most important, kailangan magkikipag-communicate ka ng maayos. Okay, communication regularly, openly, and clearly. Okay? Which of the following is not a barrier to your interdisciplinary collaboration? Not a barrier. Sabihin, barrier bang inequality of power and status? Yes or no? Barrier ba to? Yes. Inappropriate education? Yes. Role conflict? Yes. Correct answer is letter apple. Okay, letter apple. The element of your collaboration is essential in developing further psychiatric nursing is, ano kaya? Diba alam ko sabi ni attorney to, pag meron kayo nakitang evidence-based practice, yun yung sagot, yes or no? Alam ko may ganun sinasabi sa attorney. Or hindi. Diba? Pag may EBP ka, matik yun yung sagot. Letter dog. Okay, utilization of your EBP. Okay, evidence-based nursing interventions. Letter dog. Naging prof nyo lahat si attorney. Galing niya, no? Super galing niya as in. Tapos meron siya sinasabi, ano yung kapangyarihan? Di ba? Si kapangyarihan tsaka si ano, sasabunutan ko yung M. Hindi ko alam siya ba yung nagsasabunutan? Siya yun, di ba? Di ba? Ay, sasabunutan ko yung bulbul nyo. Yun. Okay? The mental health team. O, totoo, yung kapangyarihan ni attorney. Grabe. As in. Pero wala atang research sa time namin. Diba? Alam ko kasi wala siyang Oo, alam ko. Sobrang yaman ni attorney. Ang alam ko. The mental health team member is responsible for helping patients to receive the needed services is the mental health. Most probably sino yung pupunta mo dyan? Psychiatric nurse. Diba? Psychiatric nurse. Letter dog. Okay, letter dog. Okay. Or you are the staff nurse in the neurologic unit of the hospital. You are taking care of the patients with different neurological conditions. The following questions refer to this statement. O, si Dan daw, a 24-year-old stuntman was admitted to unit unconscious after falling from a horse. Tentative diagnosis of your spinal cord injury was the cause of what? Ito, di ba, napaisip din kayo kung ito yung tamang sagot. Totoo, hindi. Ang weird. Para nandyan na yung tamang sagot, tapos parang napapaisip kayo. Di ba? Anong tamang sagot? Fall, letter dog. Madaming ganyan. Legit, yung mga ganyang sagot. Kasi mapapaisip ko kayo. Sa board exam ko, ang daming ganyan. Yung parang mapapaisip kayo na, shit, ito ba yung tamang sagot? Legit. Yung parang, totoo ba? Ito yung tamang sagot. Mga ganun level. Okay. 62. Yeah, true. Nasa harap mo na naghahanap ka pa ng iba. Grabe naman yung hugot mo, sir. Okay. The final diagnosis is for Dan. Diba? Hala, tinan mo, hala. It's a spinal cord injury or anterior cord syndrome. Which of the following is not a characteristic of this condition? Okay. Loss of motor power, yes or no? Loss of motor power, yes. Loss of pain. Loss of pain and temperature sensation. Grabe iwanan ko na siya. Hindi ako nangiiwan ng person. Ako yung iniiwanan. Okay, letter B is correct. Loss of pain and temperature, yes. Okay. Ano pa? Preserve position and vibration touch sense, yes. Diba? Kapag kapag nagka-spinal cord injury, anong tamang? Pag nagka-spinal cord injury ka ba, may pronounced sensory loss in the upper extremities ka ba? Or mawawalan yan? Most probably, mawawala yan. Okay, sa upper extremities mo. Ay, charot. Hindi. Letter cat. Okay. Pronounced sensory loss. Yes, mawawalan siya. Pronounced sensory loss in the upper extremities. Letter cat. Letter cat. Next. 62. Patient suffering from a spinal cord injury is at risk for hypotension. This is attributable to ano kaya? Diba? Kapag nagkaroon ba ng spinal cord injury, nawawalan ba siya ng reflexes? Yes or no? Yes. Anong tamang sagot dyan? Letter cat. Letter cat. Patients with spinal cord injury benefit from rehabilitation. Which of the following is not a goal of your rehabilitation? Ano kaya? To promote independence, yun ba yung kailangan mo kapag nag-rehab ka? Yes. Okay. To reduce morbidity. Morbidity, yes. Okay. Gusto mo siya makagalaw. To maximize function recovery. Yes. Okay. Correct answer. Letter. Boy. To prevent infection. Letter boy. Okay. 65. Which of the following can be used as a guide when establishing functional ability of a patient with spinal cord injury? Saan mo sa ide-depend sa 63 letter cat. Letter cat. Saan mo siya ide-depend? Sa Saan kaya? Absence of hypotension, syempre dito. Functional ability. Okay? Absence of complication di rin to. Most probably kung may natitira pang residual muscle function. Letter apple. Diba? Depend mo dun kung kaya pa ba mag-function or kaya pa mag-improve yun. So letter apple. Okay? You are the staff nurse assigned in the musculoskeletal unit to the pediatrics department. You do initial assessment of a child diagnosed of osteomyelitis, left tibia. Which of the following would you expect when assessing the area over the tibia? Ano kayang tamang sagot dyan? Ano kayang tamang sagot dito? Number 65 po is letter apple. Ano kayang pinakatamang sagot dyan? Letter, ano kaya? Letter dog. Okay, increased warmth. Letter dog. So bakit sir? Ito siya. Ito yung mga, ay charot. Sige, mag-catch up muna. 64 is letter boy. 58 is letter apple. Nakapag-catch up na yung mga person. Yes. Okay. Bakit increased warmth? Ito yung mga common manifestations. Okay. Yes po, mali talaga sa G-form. Tinama ko siya. Tinama ko po. Okay. Ano ba yung mga usual manifestations kapag may osteomyelitis ka? O, ito siya. Possible history of trauma to affected bone. Child appears very ill. Irritability. Restlessness. Elevated temperature, rapid pulse, and dehydration. Local manifestation would include your tenderness, increased warmth, so nakuha siya mismo, letter dog, diffuse swelling over the involved bone, involved extremity in painful, especially on movement, involved extremity held in semiflexion, surrounding muscle tense and resistance to passive movement. So the best answer to number 66 is letter dog, increased warmth. Gets. Sige, sagutin kita later. Okay. Wait lang. Dito. Which of the following should you include in the care plan to meet the development needs of an 8-year-old confined at home osteomyelitis? Ano kayang pinaka-best answer dyan? Ang tendency niya, kapag yung mga 8-year-old children, nagre-regress sila. Okay, di ba? Ang 8-year-old, kadalasan independent na ayaw na nilang kasama yung parents nila. Pero, kapag nagkakaroon ng sakit sa mga 8-year-old patient or yung mga school-age children, nagre-regress sila. So, most probably, they would what? Letter dog, encourage the parent to stay with the child kasi hahanap-hanapin ng bata yung parents niya. Okay? Letter dog. Okay, letter dog. Okay, letter dog. A child with newly diagnosed osteomyelitis has nausea and vomiting. The parents wanted to give ginger candy to help control the nausea. Which of the following should you tell the parents? Kailangan ba ng prescription kapag candy? Yes or no? Kailangan ba ng prescription? No. Diba? Okay. Your child needs medication for the vomiting. Dinismiss mo ba siya? Eh, gusto nga niya ibigay yung ginger candy. Who know din to? Oh, we discourage the use of home remedies in children. Hindi naman kasi siya kumbaga gamot. Okay. It's just a candy na may ginger. So letter dog, you can try them and see how it does in children. Letter dog. Okay, letter dog. Letter dog siya. Okay. A child is to receive your IV antibiotics for osteomyelitis. Which of the following blood tests should be done before the initial dose of your antibiotics can be given? Ano kayang tamang sagot dito? Pinaka most appropriate answer. Hemoglobinmatic, hindi. Okay? Your white blood count, pwede siya, di ba? Pwede siya. Your culture, yes. Your creatinine, yes. Pero ano yung pinaka-appropriate answer kaya? O tanggalin natin to si creatinine. Okay? Kasi possible, hindi naman siya most probably. Tanggalin natin si white blood count. Bakit si culture ang sasagutin mo? Kasi, di ba, kailangan mo makuha yung culture para malaman mo kung anong klaseng antibiotic ibibigay. Yes or no? Yes, di ba? According nga, di ba, organism identification and antibiotic susceptibility testing are essential for effective therapy. Culture of your aspirated purine drainage along with cultures of blood, joint fluid, and infected skin samples should be obtained. Letter apple. Okay, letter apple. Yes, mali talaga siya sa G4 po. Mali lang po talaga sa G4. Letter apple. Okay, letter apple. 70, you are caring for a child with osteomyelitis who will be receiving high dose of intravenous antibiotic therapy for 3 to 4 weeks. Which of the following should you monitor? 'Di ba? Kadalasan yung mga bata or yung mga patient na merong high dose antibiotics are prone for what? Ano? Prone sila magkaroon hematologic, renal, hepatic. Sarap, ano ba ito? Renal, hepatic. Ano pa? And ototoxic. Pwede din siya maging ototoxic. Okay? Ayan. So, ang gagawin mo dyan, i-assess mo? Thrombin time, hindi naman yan. Blood to. Okay? Glucose and blood glucose level, wala naman siyang effect dito. Press answer mas letter dog. Okay? Letter dog. Letter dog po. Ha? Ito siya. Dito. Prior to giving your initial dose. Okay, initial dose. Okay, bakit? Most probably kasi, 'di ba? May nakalagay ba diyan na alam niya na agad yung organism na na-identify? Mag-initial dose pa lang siya, unang dose pa lang, 'di ba? Kailangan alam mo kung bakit. Okay, alam mo kung bakit. Okay, wait. Kunin ko yung yung source. Papakita ko sa inyo yung source. Wait lang. Wait lang. Ganito. Wait lang. Ito. Ito. Alam ko na. Sa book na lang. Wait lang. Ito siya. Ay, sarot. Ito. Kita ba? Kita ba? Ayan. Ayan siya. Organism identification and antibiotic susceptibility testing are essential for effective therapy. Culture aspirated purine drainage along culture of bloods, joint fluid, and effective skin sample should be obtained. Ayan siya. Tapos nakalagay dito. Ano to? Wait lang. Kaya mas importante yung culture. Okay, yung culture. Ayan o. After culture specimens are obtained, empiric therapy is started with IV antibiotics covering the most likely organism. So mas gusto mo pa din culture bago ka magbigay ng antibiotic mo. Okay? Next. So most probably nga, 'di ba, kapag ganyan, creatinine clearance siya kasi renal impairment ka. So letter dog. Letter dog. Okay, letter dog. The nurse okay lang, wag ka mag-sorry sa akin, promise. The nurse service department of the hospital you are working in his plant and training program. May question ba? Malinaw na. Malinaw. Or meron pa ding Yes. Hindi po si Doc. Yung. Hindi po ba dapat si order? Which of the following tests should be done? Test yung ginagawa po. Test. It would take ilang days. Okay, it would take ilang days. Yes, it would take ilang days. Kaya most probably, ang initial dose ng antibiotic mo, broad spectrum antibiotic yan. Okay, broad spectrum antibiotic yan. Okay, ang ginagawa, ang practice kasi dyan, ganito ang practice niyan pag may prior to giving any antibiotic dyan, kailangan mo ng blood culture. Okay, kailangan mo mag-blood culture or anything culture. After nyan, magbibigay ka ng broad spectrum antibiotic. Broad spectrum antibiotic. Kapag lumabas na yung culture studies mo, tapos hindi pala siya appropriate doon sa antibiotic na binibigay, doon ka lang magtatama na antibiotic ng tawag doon. Doon ka lang magbabago ng gamot. Okay? Kaya dito kasi initial dose siya. So prior to giving any initial dose, kailangan mo muna kumuha ng culture. Okay? Kailangan mo muna kumuha ng culture or blood. Pwedeng blood culture kasi nasa blood test naman siya. Okay? So ang best answer talaga is letter cat. Ay letter apple. Culture. Okay? Then nursing service department of the hospital you are working in has planned a training program ng computerized documentation. To keep yourself updated with the advanced technology, you signed up for it. Which of the following is a language system that includes common nursing terms from variety of vocabularies? Ano kayang tamang sagot? Letter C. Okay. International classification of nursing practice can play a major role in harmonizing across the various terminologies through a unified nursing language system. Letter cat. Okay, letter cat. The specialty in which nurses are considered experts in healthcare information technology is, ano kaya yan? Specialty daw in nursing, that is your letter boy. Nursing informatics. Meron tayong specialty when it comes to your nursing informatics. Okay, may ino-offer. Hindi ko lang sure kung saan ino-offer nursing informatics. Pero merong available nito dito sa Pilipinas. Okay, letter boy. Kasi kalagay health information technology. Okay. 73. What equipment is not considered technologically sophisticated? Ano kaya dyan? Your chest x-ray. Kasi yung chest x-ray mo, ginawa pa to simula 1900s. 1900s pa lang available na chest x-ray mo. Your blood gas analyzer, yung PCA nga most probably, baka may mga iba pa dito, hindi pa familiar when it comes to your PCA. Aware sa PCA? Yes, aware kayo lahat. Yeah, di ba yun yung patient-controlled analgesic, which is bago lang din naman siya. Computerized infusion pumps, yes, bago lang din siya. Kumbaga, medyo recent lang siya nagkakaroon. Okay, so the best answer is letter dog, chest x-ray. Simula 1900s, meron na tayong chest x-ray. The virtual office visit is growing trend in patient care. Which of the following is not true of this type of visit? Okay? The patient and the nurse are able to view and speak to another. Yes. Okay? The patient and the nurse are able to exchange information. Yes. Okay? It uses email. Yes. Okay? Bakit mali yung letter Apple? Mali yung letter Apple kasi via video monitors po yan. Okay? Gumagamit po tayo ng webcam kapag virtual office visit. Webcam po ang ginagamit. Letter Apple. Okay, letter Apple. Okay, letter Apple. 75. Which of the following chronic disease condition is not considered in telemonitoring? Ano kayang tamang sagot? It is your letter Apple. Ano bang treatment or anong ginagawa kapag may chronic renal failure si patient? Dialysis lang. Kailangan ba ito i-admit sa telemetry? Yes or no? No, hindi na yan, B. Kasi ano lang naman, dialysis lang kailangan ni patient mo. Research findings suggest that among soldiers who experience war combats, there are some of them who may experience the phenomenon known as the post-traumatic growth. You want to explore this phenomenon. You formulated the problem as, what is the relationship of your PTG and social support among soldiers who experience battle-related traumatic amputation? Which of the following is their independent variable? Kapag independent, cause or effect? 75 po, letter Apple. It is your cause. Ano yung cause kaya dyan? Or yung nagpapagalaw, that is your letter. Ano kaya? Cause. Ano yung cause dyan? Yung nagpapagalaw, letter Apple. Social support. Okay, social support. Letter Apple. Okay, 77. Which of the following is the dependent variable of the study? Okay? It is your letter dog. Ano yung dependent? Effect or cause? That is your effect. Diba? Siya yung pinapagalaw. Siya ba yung nagkakaroon ng movement? Yes or no? Or pagbabago? Kapag dependent variable, siya ba yung nagkakaroon ng pagbabago? Yes. Okay, yan ang dependent variable natin. Which of the following sampling techniques is the most appropriate for this study? Ano ba to? Post-traumatic growth. Okay, post-traumatic growth sa mga war combative. Common po ba yung mga ganun? Yes or no? Common po ba to? Common po ba yung mga ganitong study? No. Anong gagawin mo? Magsisimple random sampling ka pa ba? Hindi, kasi hindi naman ganun karami yung sample size mo. Convenience sampling, hindi rin. Okay? Your Delphi technique is tawag dito, research design. It is a research design. Anong ginagawa kapag Delphi technique? Halong quantitative and qualitative research. Okay, halong quantitative and qualitative research. Ang main gist ng Delphi technique is you will have a consensus, okay, from the group of people. Okay, consensus from a group of people. So the correct answer is letter Apple, purposive sampling. Okay, letter Apple, purposive sampling. Okay. Next. You have 1,656 soldiers who experience battle-related traumatic amputation using the Slovin's formula with 5% margin of error. What will be your sample size? Ano kaya? Wait now. Compute natin. Ano muna ang iyong formula? Anong formula pag ganyan? Anong formula ng Slovin's formula? Is N divided by ito, 'di ba? Ano ba ang sample size? Ano ang sample size natin? 1656 divided by 1 plus 1656 1656 times ano yung E dyan? Paano mo i-convert yung letter E? Wait lang, tama ba slogans for me? It's 0.05. 0.05 times 0.05. Yan. O, compute natin. Wait lang. Charot, 1. Wait lang. 0.05. 0.05 times 0.05 is equal to 0.025. Okay? 1656. 1656 divided by 1 plus 0.0025 times ano yan? Times 1656. 4.14. 4.14. O 1 plus 4.14 plus 1 is equal to 5. 5.14. So 1656 divided by 5.14. Anong tamang sagot? 322. Okay, 322. Ano pinakamalapit na sagot dyan? Letter boy, yun na yung pinakamalapit na sagot. Okay, yun na yung pinakamalapit na sagot. Siyempre, hindi naman natin kukwestiyonin yung board exam. Okay, hindi natin kukwestiyonin yung board exam kung ano ba talagang tamang sagot. Okay? Kapag ganyan, closest answer na lang yung kukunin nyo. Or nalito sa kung paano mag-compute. May gusto magpaturo paano mag-compute. Wala na sila. Merong gusto sige, pa-compute ulit. Okay. It's okay. Don't feel sorry. Okay, ang arte, no? Okay, 1656, that is your N. Divided by, ano yung 1? Plus, N mo ulit. Ito yung N mo. 1656. Times, ang exponential mo, i-convert mo yung percent to decimal. Okay, i-convert mo yung percent to decimal. So, points, di ba ang 5%? So, how would you compute your 5%? So, ano siya? I-divide mo by 100. So, 0.05 times 0.05, yan ang initial formula mo. Okay, yan ang initial formula mo. Ito siya. Okay? Ang next formula mo is 0.05 times 0.05. Diyan magiging, ang sagot niya, 0.05 times 0.05. 0.0025. Yan ang next mong Okay? So kapag minultiply mo pa yan, eto na siya. Multiply mo si 0.0025 kay 1656 times 1656. Magiging, siya? 4.14. Okay, 4.14. Okay, and then you would add this one. Okay, you would add this one. So, 1656 divided by 5.14 is equal to 1656 divided by 5.14. It is equal to your 322. Okay? 322. Paano i-compute? Di ba? Your 5%, paano i-compute siya? Okay, paano siya i-compute? Di ba? Ang 5% mo is equal to 5 in every 1,000. That is your percentage. Di ba? Ito siya. Para ma-convert mo to into whole number, di ba? 5 divided by 100. Sagot mo, 0.05. Ayan siya. Okay? Again, kapag percentage ang given, 5%, i-divide mo siya by 100 muna. Okay, so 5 divided by 100 muna is equal to 0.05. Okay po? Okay, so screen cap nyo na lang para mas mas magets nyo. Okay, tanggalin ko na po. Paulit lang saglit. Okay. So for example, ito yung your total population is 1656 divided by 1 plus n times 0.05. Saan ko nakuha yung 0.05? Dinivide ko yung 5 divided by 100. Okay, is equal to 0.05. Okay? So 0.05 times 0.05 is equal to 0.0025. Okay? Times minultiply ko tong dalawang to. Ang magiging sagot niya is 4.14. So 4.14 plus 1 is equal to 5.14. So di-divide ko na si 1656 divided by 5.14 is equal to 322. Kaya ang tamang sagot is, ano bang closest is letter boy. Letter boy. Okay, delete ko na to in 3, 2, 1. Okay. Findings revealed that are 0.49. This means relationship is, di ba, ang normal mo, 0.1 to 0.3 is equal to your 0.1 to 0.3 is low. 0.3 to 0.3 to 0.5 is moderate. Okay? So positive to letter. Anong tamang sagot dito? Letter cat. Moderate. Positive relationship. Ayan siya. Inulit lang natin siya. Okay, inulit natin siya. Next. You are the staff nurse in the eye unit of the hospital. You want to find out the evidence-based care, letter cat, for the nurses to improve adherence to eye drop therapy. You formulated the clinical question among patients with glaucoma, which nursing interventions increase adherence to eye treatment. Which of the following is the expected outcome of the clinical question? Ano kaya dyan? Letter. Anong gusto mo outcome mo? Increase adherence to your eye drop treatment. Letter cat. Letter cat. Okay. Number 82. Which of the following research evidence will most likely provide you the best available for adherence to your eye drop treatment? Ano kayong pinaka-available evidence na? Ano yung highest form natin? Your highest form of your research evidence is your RCT, using your systematic review of randomized controlled trials. Letter apple. Okay, letter apple. Okay, letter apple po. Number 83. You would include the nursing interventions for adherence to eye drop treatment the following, except, paano malalaman nag-adhere siya? Verbal and written information, yes or no? Yes. 80 po is letter cat. 81 cat. Okay. Patient education program, yes. Diba? Eye drop installation training, yes. Pero telephone instruction is not reliable. Hindi yan mag-guarantee. Okay, di ba hindi siya mag-guarantee na may na-develop na skills? Letter dog. Okay, letter dog. Next. 84. Which of the following would be your measurement tools for adherence to eye drop treatment? Ano kaya pinaka dyan? Measurement tools. So most probably may checklist ka ba dyan? Yes or no? May checklist ka, yes. Ito, o tanggal to. Questionnaire, pwede ka din ba mag-questionnaire? Yes. Okay. So tanggal din to. Okay. Patient diary progress notes, mas maganda tingnan mo yung letter dog, patient diary. 345. Ay, 345. 85. For patients with impaired hand coordination, which of the following you include in your health teaching to ensure that there is adherence to eye drop treatment? Kapag may hand coordination ba, impaired hand coordination, mahihirapan ba maglagay si patient? Yes or no? Yes. Okay, anong gagawin mo? Mag-instruct ka sa caregiver. Okay, number 83 po is letter dog. Mag-instruct ka, letter boy. Teach patient's caregiver how to instill eye drop. Letter boy. Miss Cha, 21-year-old female student in a private university, came in for consultation at University Health Service with chief complaint of poor attention span, poor concentration, and hearing some voices calling her and sometimes people following her. She claims she started to experience all this 3 months ago. 84, letter dog. Which of the following clusters symptoms indicate the presence of your schizophrenia? Ano kayang tamang sagot? Ano kayang tamang sagot dyan? Most probably kapag schizophrenia may hallucinations. Hallucinations. Ano yung hallucinations? Includes your 5 senses, yes or no? Kapag hallucinations. Yes. Kapag delusion, ano yung delusion? Ano kayang delusion? It is your false belief. Letter boy. Okay, letter boy. O, number 87. 80. 80. Sabi mo naman. Letter cat. Which of the following marks the initial phase of your schizophrenia? Paano mo malalaman kaya? Letter dog. Impaired role function and neglect of personal hygiene. Okay, impaired role functioning and neglect of your personal hygiene. Okay. Which of the following symptoms of schizophrenia are likely to be responsive to the medications? Yung mga antipsychotic drugs mo, ano ba ina-address nito? Positive or negative signs? Or negative symptoms? Your positive symptoms. Okay, positive symptoms. Ano yung sabihin nito? Ang positive symptoms mo, kadalasan yan, delusions and your hallucinations. Okay, delusions and your hallucinations. Anong tamang sagot dito? 87 pa lang tayo, Mamshi. Ay, 87 is letter dog. Okay, 87 is letter dog. Anong tamang sagot dito? Kapag antipsychotic drugs, again, positive symptoms. Ang positive symptoms mo, hallucination and delusions. Anong tamang sagot? Letter apple. Hallucinations. Okay, hallucinations po. Okay. 84 is letter D and B. DB. Which of the following methods can reduce the intensity of your auditory hallucinations? Ano kayang pinakamagandang gawin dyan? Letter dog, talk with the patients or talk to the patients. Okay, talk to the patients. Para may reduce. Ang amitriptyline, para siyang amitriptyline, para siyang for pain yan. For pain or antidepressant. Okay, pero kadalasan iba'y use na siya for pain. Okay. What is the lifetime risk of developing schizophrenia in the general population? Ano kayang tamang sagot dito? Pag ganyan, may na-encounter ako na ganyan. Sa ang board exam question namin, population ng Pilipinas year 2017. Yun yung tinanong sa amin. Letter, C, 1%. Okay? 1%. Letter C, 1% lang po siya sa buong mundo. Okay? True. C for Christ, para hindi pag-sure. So you are the staff nurse in the psychiatric unit of the hospital. One of the most common conditions you care for patients with anxiety. The following questions relate to the statement. The patient with obsessive compulsive disorder attempts to control anxiety through ritualistic behavior. Which of the following nursing intervention will increase the patient's sense of security? Pipigilan mo ba ito pag ganito? Yes or no? Pipigilan mo ba siya? No. Diba? Anong gagawin mo? Letter, allow the patient pero may certain extent lang ba? Yes or no? Up to certain extent lang yan. Okay? Up to certain extent lang siya. A patient with panic disorder is learning to counter negative thoughts. I am going to die. With this is only anxiety and it will pass. The patient is using which of the following? Bigla nag-shift. So most probably nagkakaroon siya ng cognitive restructuring. Okay, letter Apple. Cognitive restructuring. '93, you have a patient having panic attack. Your most appropriate action is, kapag nagpa-panic attack, makakapag, function ng maayos yung patient mo? No. Pwede ka pa ba makakapag-explain ka pa ba sa kanya? No. X na to. Okay? Mare-reassure mo ba si patient? Yes or no? No. Makokontrol mo pa ba siya? Yes or no? Diba? Hindi na yan. B. Ano pinakamagandang gawin mo? Diba? Stay with the patient na lang. B. Letter Apple. Okay? Hindi na yan. Number 91 po is letter dog. Number 91 is letter dog. 94, distorted perception, loss of rational thinking, and failure to perceive potential harm to characteristics which level of anxiety. Anong tamang sagot dyan? Letter boy, panic. Ano ba dapat ang healthy? Anong healthy anxiety dyan? Dapat kayo nasa ano lang kayo? Nasa mild lang. Okay, pero ngayon ano nyo? Dapat mild pa din para sobrang healthy ng nyo. Normal magkaroon anxiety. Okay, normal magkaroon ng anxiety, promise. Eh kapag pag moderate kasi anong tendency mo dyan? Focus or feeling details na nakukuha nyo. Which is hindi, mas maganda, mild yung mga important. Okay, important yung hahanapin mo. Letter C, dapat kayo. Mild pa lang kayo, dapat B. Okay? Kailan magpapanik? After boards. Okay, after boards. After boards kayo magpapanik. Kasi bakit? Wala kayong gagawin kapag nag-board exam, after board exam. Nasabi ko sa inyo mas mahirap. Mas mahirap kapag katapos ng board exam kaysa before the board exam. Mas mahirap mag-intay. 'Di ba? Maniwala ko so hindi kayo makakatulog kakaintay ng result. Kaka-research ko anong tamang sagot. O you are teaching a patient with generous anxiety about food. What would you instruct the patient as to avoid? Ano kayang tamang sagot dito? Letter boy. 'Di ba? Letter boy. Mas nakakapraning talaga, promise, ang pag-iintay. Mas nakakapraning siya. Kasi doon yung dami niya ma-realize na parang ay shit, mali yung ginawa ko, yung mga ganong levels. You're the staff nurse in the psychiatric unit of the hospital taking care of patients with various psychiatric disorders. The following questions relate to the statement. A few minutes past midnight, a patient with mania approached you in the nurse station. He demands that his psychiatrist come to the unit now and write an order for Paz to go home. Your most therapeutic response is, ano kayang tamang sagot dito? Oh, matter of fact ka dyan dapat, I can't call your psychiatrist now, but you can talk to me about your request for a Paz. Letter Apple. Okay, letter Apple. Okay, letter Apple. Oh, you are concerned about the lack of food and fluid intake of one of your patients with mania. What should you select that would best meet the patient's nutritional needs? Okay, bakit letter Apple? Bakit hindi letter dog? Bakit hindi letter dog? Di ba dapat finger food B, hindi yung mga steak, maghihiwa-hiwa pa siya dyan. Letter Apple ang best answer dyan. Peanut butter, sandwich, and milk. Di ba? Okay. O bakit hindi letter boy? Mas mataas ang caloric ng letter Apple mo. Diba? Mas mataas ang caloric ng letter Apple. O you observe a patient with mania taking food from another patient's food tray during lunchtime. Your nursing intervention should be based on what rationale? Kailangan i-protect mo ba yung other patient? Yes or no? Yes. Letter dog. Other patients need to be protected from the intrusive behavior of other patients. Kailangan i-protect mo sila. Okay? Kailangan i-protect mo yung other patients. Kasi it could cause harm by yes or no? Yes. Okay. Which of the following activities would you select to provide distraction for a patient with manic behavior? Pagbabasahin mo ba to ng libro? Or magbabasa ba siya ng libro? Magbabasa ba siya ng libro? No. Anong gagawin mo? Letter C. Pag-aanay mo ba siya ng games? Yes or no? Paglalaroin mo ba ng games? Bakit? Ano mangyari pag pinaglaro mo siya ng games? Magiging competitive siya. Nakakita na ba kayo ng manic patient? Nakita na kayo ng manic? Di pa, sobrang literal na manic as in, sila, parang sila exaggeration from all aspect, ganong levels. As in, exage talaga. Okay. Which of the following would include therapeutic activities for the patient with mania? O, bingo. Papag-bingo mo ba to? Yes or no? Pag-bingo? No. Playing cards? No. Siyempre, pag fold mo na lang siya ng towel. Okay, pag fold mo na lang siya ng towel. Questions? Okay. Questions? 100 po. Oy, grabe. At least hindi ako nag-overtime. Thank you po, sir. Question pa. Yung mga pala, kukunin ko lang yung link doon sa sa review assistant. Okay? Kukunin ko yung link sa review assistant. Kapag may questions kayo, message na lang ako sa Instagram, wag Facebook. Madami ako kausap sa Facebook. Madami ako mga group sa Facebook kasi. Nandun yung unit ko. Ay, yung unit yung madaming nandun naka-involve yung choir, yung unit ko, ganyan-ganyan. Okay. Hindi madaming kausap na kadit. Grabe naman kayo. Kausap na parang group chat for the station, group chat for the ganyan, group chat for ganon. Okay? Para lang kasi hindi ko kayo ma-replyan talaga doon. Nandun din yung mga review assistant ko. Review assistant na nagko-communicate sa akin. Kaya ang hirap. Okay? Ang hirap. Ayan po. Okay, pogi ba ako? Maniwala ko sa'yo. Okay, may link na for the special senses para lang mabilis lang. Mabilis lang yun, promise. Okay? Questions pa. Pag may tanong kayo, shout out kay Saudi. Pag may tanong kayo, I'll answer questions. Nagsasagot naman po ako. Okay na sa akin magtanong. Medyo na-relate lang ng reply. Okay, kahit sa mga random questions na related naman sa board exam B, ang hirap naman pag hindi related sa board exam. Pero I'll answer questions as much as I can. Kaya na pag may mga conflicting answers, sumasagot talaga ako dyan. Okay? Babay na. Yung magre-recalls, yung mag-special senses, mabilis lang yan. Wala pang 5 minutes tapos na. Promise. Okay? Wala pang 5 minutes tapos na yon. Okay?